этом канале.
Здравствуйте, дорогие коллеги! Я рада приветствовать вас на нашем международном конгрессе. Для меня сегодня очень волнительный день, так как выступаю в несколько непривычной для меня роли президента сразу двух ассоциаций. Международной ассоциации врачей, использующих медицинские газы, и Северо-Западной ассоциации врачей и медицинских организаций, использующих медицинские газы. В прошлом году в Польше принято было решение о переоформлении Азиатско-Европейского союза озонотерапевтов
of the
в
European
Единую
Union of
ассоциацию
Ozone
врачей,
Therapists
использующих
and the
медицинские
Association
газы,
of Medical Doctors who
состоящую
are
из
using
15
medical gases,
стран.
that consists of 15 countries. And also a decision was made to have the first association assembly in St. Petersburg, despite the fact that there is a complicated epidemiological situation in the whole world, and we were not able to meet you physically near the Finnish Gulf. But next summer, when there will be white nights, we'll have this opportunity. And now in online format, we are going to listen to new information, share the experience of using medical gases and experimental data, the mechanism of oxygen, xenon and dioxide, how it is used. And I'd like to express my gratitude to the esteemed speakers and the audience that has joined us, and to wish everyone success. I'd like to give the floor to the chairman of the Permanent Organizational Committee for the International Association of Medical Doctors who use gases, AMTH, Mr. Nazarov. Dear colleagues, Anastasia told us about the external developments, the events that had impact upon the current event. And I'll say a few words on what is the motivation for this whole transition. The European Union as on therapists that has been in existence for 17 years already. And its transformation into the International Association of the Medical Doctors who use medical gases, AMTH. And the most esteemed medical gases, if we describe it like this, and this ozone, of course, and the corresponding mixture that was used as a medical approach by Nikola Tesla, for example, 115 years ago in 1905, medical gases company Medical Ozone was founded, and Nikola Tesla was the chairman. The history of ozone therapy went through different periods of the ups and downs that was related to antibiotic era. And it seemed like antibiotics would resolve absolutely any problem. Then data has been stood up on how this ozone therapy has been conducted, and let us say ozone was invigorated. This was notable after the First World War, and the properties of ozone and storing clinical experience, accumulating it, we could then understand the pharmaceutical impact of this medical drug. And with every new 10 years, there are new examples in the use of this very successful gas. And there is this question of why specifically this medical agent, even when it's used in such insignificant concentrations, gives this effect. The attention of medical doctors was more focused on the fuller understanding and studying this ozone impact. And in the end of 90s, then the new gas xenon was used with oxynitrogens. And then again, this was used. And at first it was a bit unusual, and xenon, because we are going to be talking about xenon and about hydrogen. It also demonstrated quite a wide range. It was a bit strange, amazing. But at 2007, ozone and xenon also was joined with hydrogen. And this is a kinetically inert gas, and so we look at its kinetic activity, and it turns out that it also has this very wide range. And when this data was accumulated into one integrated whole, then maybe we had to a bit defocus the use of it. And we should think about the use of these gases and that's how our association was born.
Евгения Ванин, спасибо за ваше слово.
Thank you.
Слово Вере Васильевне Кирьяновой,
Now let us
профессору
give the floor to Vera Vasilyevna Kiryanova, who is the head of Association of the Medical Rehabilitation and Physiotherapy. Good afternoon, esteemed colleagues and listeners. And now we met to talk about gases. And I was thinking of what are gases. In my presentation, I came back to the notion of the word air, and we live with this. And then I understood that these gases, they are around us. And even in our routine, we forget that you constantly breathe in every second, every minute, using all kinds of gases. And I was listening to Anastasia Khatkevich, and I'm very grateful to her that she had this responsibility for all of us to meet here. Because in principle, this is physiotherapy, it's a natural factor. And even in my speech, I'm going to talk about physiotherapy because we don't understand that this is the air we are breathing with. And physiotherapy is translated as a treatment with natural factors. So, first of all, there should be natural factors we run into. And it is very interesting that for a long time we didn't notice these gases because 123 years ago aspirin was synthesized. And this specialty of physiotherapist sprang up 133 years ago. And over these years, physiotherapy, like what gave humanity an opportunity to survive, that pharmacology It has only been born 123 years ago. And we should not underestimate its significance. This is a truly important factor. And the air environment should be used in physiotherapy. And I should draw your attention that physiotherapy with gases, it is used for inhalation as gases and for various medical devices. So its capacities are quite wide. And there is this wide usage of gases that are used as medicine and as diagnostic means. And the enormous potential has been stored. I was astonished by the use of gases in medicine. And the fashion is fashion everywhere. So it's not only using some fashionable pharmaceuticals or some new apparatus, because sometimes they say that some device is not worse than an antibiotic and everyone will just suddenly get healthy forever. But the real possibilities of therapy with gases are amazing. And right now it is in fashion. Ozone therapy is in fashion. And I always say that in rehabilitation of COVID medical doctors, if there are complications, maybe some bureaucratic situations do not allow to use them so widely. And we have been studying this, and we use it in hospital number 10 in St. Petersburg, and everyone has been in great admiration with the results. We need to understand what is gas's place. Conference gives an opportunity to understand how global this is and what you can combine it with, so that the effect would be clearer. Who should be doing this? Because everyone should be doing this. And the person can ask for example, ozone therapy or laser therapy. But if we combine these two procedures, they're both too powerful to combine. Of course, if somebody promises money, a doctor might do this. So let us better discuss all of the points related to physiotherapy, to basic therapy, to focus on this in order to discuss the results. Thank you so much for your speech. And now let's give the floor to Mr. Nazarov. Dear colleagues, the topic of my report, this is hormoligosis, Pavlovian conditioned reflex, and the system of therapeutic impact of ozone, hydrogen, and xenon, which are very different from the whole mass of gases. One of them is the oxidizer that is quite powerful, and hydrogen is an amazing restoring factor and has great chemical impact. Also, a concept of hormoligosis will be offered as a basis of the therapeutic effect of medical gases. And at present, there are a few independent directions of medical gases treatment. This is carboxyl therapy and ozone therapy. And then we are also forming the hydrogen therapy. And all of them are unfortunately marginal in medicine so far. And the reason is because the main trend in modern medicine is a pharmacological approach to medicine that is often not used in therapy. And how should we correct this situation? So the ticket for using these gases is the answer to four testing questions as pharmacological qualifications, therapeutic use, aspects of pharmaceutical activity, and the action mechanism. And speaking of qualification, in 2009, a Japanese researcher Naka and his colleagues proposed to consider medical gases and antioxidants, and we should pay attention to the fact that all of these gases, except for hydrogen, are poison. And so this is determined by the width of the range of medical gases use. And if we follow the principle of a knockout concept, then we should place medical gases into metabolic group. As one of the most popular qualification states, that maybe this is narrowing the properties of gas because they also have vegetatropic properties, neurotropic properties, antimicrobial properties, anti-tumor capacities. That is why it would be illogical. So I'd like to offer the alternative approach that demonstrates the combinatory use of these gases. This might seem paradoxical in the spectrum of pharmaceutical activities. So it seems a rather improbable name. And during this report, first of all, we are going to pay attention to one of the main properties, the impact of the above-mentioned gases upon the organism and upon the changes in internal and external environment. We should understand the importance of this in using the gases systemically. And we would like to make half a step to pharmaceutical qualification of gases and to start thinking of how to make medical gases officially recognizable. So the first step is accepting the fact that the endocrine system of the body is very sensitive to gases, and we can expect the most amazing physiological consequences. First of all, toxicology, because pharmacology and toxicology are always interconnected. And recently, Mr. Thompson, who studies intoxication during medical gas use, he demonstrated the impact in graphs, how it impacts the heart, the liver, the spleen, the kidney. And we see the dose dependent impact and upon the transcription factors and also TNF and AF and different body parts. And then corticosteroids increase, which play a role of cortisol that correlate very well. And the described cortisol factors are well known. That is why the correlation of ozone and impact, then we should see that it should not be blocked by interferon. This is a selective blockator of corticosteroid synthesis. And in the work of other authors, it was demonstrated that inhalation with ozone might be also blocked with misrapon, and for modulation or for lateralactomy, we need to see the decrease of ozone, because we have always considered that or first it elicit the oxidization of surfactants, but this seems to be very closely connected to corticosteroids. So if we look at what synthesizes these hormones, the toxicity of ozone multiply decreases. And then the toxic impact of ozone upon the area above of the kidneys. On this slide, we can demonstrate one of the results of the cortisol dynamics, and the treatment course was with large doses. A dose was 27 mkg and once in 2 days. At the beginning of this course of therapy, we see the sharp dynamics of cortisol that should be controlled and made stable. So here we see the procedures for measuring cortisol, and then this stability can be destroyed after we started the treatment, and after some transformation which are happening in endocrine system, then we see cortisol at better level. We look at various endocrine systems. And another experiment is demonstrated in terms of the dynamics of hormones of cortisol and aldosterone as a mineral substance, and they are considered highly important adaptive system regulators. And this doesn't clear the fact that concentration of these highly effective bioregulators is changing multiple times. And here is the pendulum of Hans, and Gonsalves was also founder of this direction of studies, stress cortisol studies. And he was talking about glucocorticoids and mineralocorticoids oscillations that might have impact upon distress. And if Cellier would live till our times, he would know that this adaptation pendulum is launched. And then it was demonstrated that xenon of the system of the above kidney areas and also at the hanodal system. And there might be an impression of the hormonal system impact, but if we look at micellar water, there might be a ghrelin hormone release, and it plays not only important role in dietary behaviors, but also it's a factor that increases the nervous cells growth, that suffer during popular and well-known degenerative diseases. For example, in case of Alzheimer's disease, here the mechanism is not very clear how ghrelin is released. The discovery, this is the discovery of a Japanese professor, and the next step is that the impact is connected to the preliminary protective action, and all of the terminology is extremely important. This is a formation of a conditional reflex, and this is like a preliminary protection that is born on some inherent inborn reflexes. Here we see toxicological data. Here we see ozone data. Here is a column where conditionally we are demonstrating the changes in comparison to the norm, and the aggregation of red blood cells and some other parameters. You can see glucose, cortisol, and also suppression zones and synthetic zones. So what is the range of the same gas in case of therapeutic doses? In the next column, and we see a mirror image. If high concentrations had a pro-inflammatory action, and then in case of therapeutic doses, it's anti-inflammatory. And if there was constriction, then you see a dilatation. We see this mirror image, and analogous impact can be produced by medical gases and toxic agent. So it is a bit strange to listen about xenon as a toxic agent if we talk really precisely with poisoning, about poisoning. So in this sense, of course, it can be described as toxic and with some neural side effects. And here we can see high concentrations of xenon, which do not allow for the organism to function normally. So they are transforming in some reverse way. And there is this 5 to 20% of xenon. And the rest are used for anesthesia. And here it is realistic to see the formation of the conditional reflex. But is it realistic to form a conditioned reflex to maintain health? It is known that a really conditioned reflex is based on the unconditioned reflexes. The first example. So this is related to Pavlov's experiments. For those who do not know, who have forgotten it, if we look at the neural activities and just life activity of any human being. Here we look at glucose at the peaks the first time, the second time, and the glucose concentration increase. So what might occur? So there is like a hypoglycemic effect. And if you think a little bit, then you might understand this. And so the body starts fighting, and this expression of insulin is a protective response that can be observed. So I'll be illustrating this. So this is the norm. Now this intravenous introduction of glucose when we inject glucose. So what's happening in the body when we use insulin, and the response to glucose is remaining. So if we see only glucose, we can see hypoglycemic effect, and this will be the realization of conditional reflex. There are many, there's much data of such type, and really this experiment, it's interesting that it was first done even in 1937 by Mr. Pavlov, Ivan Pavlov, Nobel Prize winner in reflexology. And there was a hypertensive response, not hypertensive.
How it can be explained?
And using this metaphor, what do we have in this case? We'll have the formation of other conditional reflex. There should be the reflex for supporting blood pressure. Such reflexes have this quite coherent character. They happen throughout the whole body. You can see here the water is brought out of the organism, and the urine is still expressed because the body develops this pre-protection for the hyperactivity. And here we study mice behavior, and we see that motor activity falls down, and if we introduce a physiological solution, a motor activity, and then you see it's a protective response. And the last example is very ancient.
Where we actually use the talc, for example, we can see this rat or mouse that can be used, or porcupine. We could use this for this kind of experiments, and so we actually don't have to use any additional means for it to produce mononucleares. What kind of conclusions we could take from that? I think that these are just brilliant experiments. As for homeostasis, if we talk about toxic effect and many other things, of course we understand this is one of the reflex, as congenital reflexes of thermoregulation, cardiac, respiratory, and vascular nature. This is a universal means of correction of any disorders of the psychosomatic state of the body. And we also have to admit that repeated repetition of the effect of disturbing homeostasis leads to an unconditional fixation of the condition of the external and internal environment, accompanying the violation of homeostasis. And we understand that while repeating, one or more of these conditions, so the body develops an anticipatory reaction, which is quite a reverse to the effect of damaging factor. It could be a stressful reaction. It could be something related to social adaptation, and of course, organism might develop this kind of hormones and this kind of reaction, and will be of um, this kind of nature. And now at step number 3, we talk about hormoligosis as one of the major therapeutical effects that is an integral part of this therapy related to medical gases. So I have mentioned that it's something that should be done at hormone level. And of course, we need to understand how we can actually organize our, reactions, and how we can actually turn it into homeostatic effects. So at the second stage, we said that there is certain reflex. And the next stage, we see that this kind of reflex mobilize the system to tackle different issues to actually maintain this hormolysis effect. Here we can see the Pavlov effect, and so we will try to analyze what actually happened under this kind of conditions. So just to summarize a little bit, the body is able to develop a conditional response to all those factors that provoke violation of homeostasis. But at the same time, it is obvious that poisons in moderate doses, yes, they can be used many times. They are also able to develop quite a conditional reaction. And speaking about these reactions specifically, this reaction will be the inverse of the toxicant. But what about all those factors? They need to be really analyzed. Just to make sure that they can really produce the right amount of hormones that we have, and also the effect that we would like to have. What about different areas like minerальные воды or some others? There could be different reactions of the bodies produced, and they might be really different, and we need to understand which reaction is absolutely pathogenically efficient from different points of view. We need to come up with the right reactions, and how can we do that? I'm sorry. Yes, we need also to make sure that we have a prolonged reaction, for example, within a period of several months. And if it is prolonged, then it will be maintained by the body. And we need to make sure that we have a proper reaction to a certain poison. And we have to understand that we also need to think more about pathogenesis, about different poisons that might be identified within the blood content. So, in our opinion, if the pathogenesis of the action of the poison is similar to the pathogenesis of any disease, then the condition reflects homeostatic reaction to this poison will be a pathogenically justified method of treating the disease. I think that, uh, uh, all the possible drugs can be classified as poisons. It depends on the dose. It depends on the doses. Again and again, we needed to repeat this information. So the data that we have analyzed, this one of the points that make us again believe that it is actually the case. We need to come up with particular doses and particular approaches, and just to see that um, we needed to find the best ever approaches from the therapeutical points of view. So, in order to synthesize many years of clinical experience in the use of medical gases and also our analysis and our approach and pharmacological analysis, I mean, regarding physiological activities, we talk more about hormoligosis. So, this term was suggested a long time ago. It is derived from the Greek language. Hormone sets in motion, activates the hormonotropic effect and the LIGO in a small amount. Well, if we talk about this in general, then we can see that first we have a stimulation, there's certain suppression, etc. So actually it incorporates quite a number of different effects, but we need to understand how it can, I mean, actually explain the effect that is produced, for example, on endocrine system. And first, we use quite a small dose, and the toxic effect is not quite considerable, quite insignificant. But at the same time, the body produces some kind of protective substances to counteract that. And as for that toxic effect and this element, yes, it can be later used, but at the same time, we can see that the reaction of the body a little bit. I mean, it changes a little bit, and so we can see that the curve regarding the impact and regarding the reaction changes a little bit. I would like to mention once again that from the Greek, hormone sets in motion, something that activates the hormonotropic effect and illegal in small amounts. This is, I mean, a special approach that allows us to really, I mean, um, to trigger some of the very important activities within the body. Because of parental therapy with ozone and xenon is a procedure for the formation and development of homeostatic conditions in reflex to a toxic substance. I mean, some people who have already tried that in order to fix this effect, yes, we need to preserve this, I mean, this uh, stimulation and this actually effect that is produced by this therapy. I think that in both cases we actually come up with a special reflectory mechanisms. There are some other things. Here you can see immune systems. It's not about endocrine systems. So you can see monocytes, eosinophils, basophils, and neutrophils, and the way actually they, I mean, their amount actually is changing based on the treatment parameters. We can see that this is um, quite a dynamic picture. And during the course of ozone therapy, leukocytes concentration and heart rates, the variability parameters changes a lot. Here we can see vegetative systems and the way it actually um, reacts to this kind of treatment, especially when it comes to ozone therapy. So it changes tremendously, and thus we can see we have three systems: endocrine, nerve, and immune systems. They are involved in I mean, the process of reaction to all those medical gases. And this is very important for a proper homeostatic effect. And of course, it has a direct system on our endocrine system. And if everything works out fine, then we can we can say that here we can have quite a good situation with different other factors, for example, inflammatory state and also with the mood state, etc. We can also see that it can also have a direct impact on the nerve system, especially when it comes to the infiltration of xenon, and it helps to um, maintain the adaptation system in the right state. At the same time, use, for example, of H2 and hydrogen from the toxic point of view. It also allows us to use it, I mean, together with the gas and xenon. But when we use this gas together with xenon and ozone, it's actually also adds an additional aspect to the homeostatic reflex that is formed by the body. And here is the scheme that we are suggesting. Uh, I mean, it's very important for us to understand how actually our adaptive system works when it comes to hormoligosis action as for
So we see the complicated feedback. Here we see ozone, xenon, that has impact upon the whole complex and the endocrinological system. And then hydrogen also has positive effect. So we make observations through the release of hormones, specifically ghrelin hormone. And the endocrine system has a set of hormones, the immunomodulating effect and the antioxidant factor. And then the system develops a hormonal effect. And then we see the violation of these norms, then we need to set the appropriate norm, they recreate the norm and recreate health by doing this. The factors that were required for the achievement of homeostatic effect. Then we look at the aldehyde impact upon the processes and prostaglandin production and release. Then there's no decrease of the prostaglandin level. Then this is related to the factors that mediate and transcription of proteins factor. Sometimes they might look as antioxidants, but really this is a complex systemic response that uses these bioregulators as a tool. Now we made 3 steps, and we have to make a small step in order to understand how important is the pharmaceutical impact of medical gases. If we would ask such a question, of what are the various pharmacological agents, we would say that this is anti-inflammatory, immune modulator, antimicrobial, antiviral, antihypoxic, vasodilatory, cardioprotectors, detoxifying agents with a therapeutic index of more than 350 times and a half-life of 60 days. There's such other examples of other chemical combinations. These are adaptogens, as anti-inflammatory, immunomodulating, etc. The same spectrum with a therapeutic index of 350, 60 days. And the term adaptogen was introduced by a genius scientist in Russian medicine, Mr. Lazarev. and who studied also the use of xenon in medicine. And he proposed 4 criteria that are used for the study of certain combinations and relating them to adaptogens. There should be a wide therapeutic action, change in the function of the organism. So then we should look at a wider range of factors. Then the impact of adaptogens should be more powerful if there are a lot of disadaptive changes in the body. And synthetic adaptogens, such as triclosan, metaprot, polyoxidonium, do not have such properties. And the fourth adaptogen should have a normalizing effect independently on the previous shifts in homeostasis. This is what we see as a therapeutic index. So this half step then consists of the following. On the basis of this data, we should replace this qualification and they should clear them from the metabolic group and to shift it into the pharmacological qualification of medical gases into the subset of neurotropic drugs, adaptogens. So we have done all the three and a half steps. If we have 3 minutes, can this new approach be used for increasing the efficiency of medical gases-based therapy? Because this process is rather complex. This is not a hyperglycemic response with the help of insulin of a parasympathetic system. So the results of the impact, for example, of ozone, this is very good, but we cannot shift the patients towards a set of happy patients, let us say, or healed patients, but it's a good result. How should we make it more perfect? And here the methods only touched upon this problem. But we can do constant monitoring of patient's condition, because we cannot prolong this treatment too much. And what happens if we continue to use ozone? The time for the conditional reflex formation can be significantly decreased, and at the same time there can be stimulation of the limbic system in the brain that controls this process of conditional reflex formation. And this was proved in the previous century. For this purpose, we created a special device that helps to prolong the response in 2 or 3 procedures. And we should hope for your kind attitude and my warm hello to all of my foreign colleagues as outstanding experts. And we are moving on in the program, and at 10:30 we are going to give the floor to Mr. Peretyagin. And now there is a small pause for preparing the presentations and uploading them.
Уважаемые коллеги, наша трансляция продолжается. И сейчас мы с большим удовольствием передаем слово президенту Ассоциации российских озонотерапевтов России, доктору медицинских наук, профессору Сергею Петровичу Перетягину. Пожалуйста, Сергей Петрович, вам слово.
Спасибо большое. Уважаемые коллеги, мы от Ассоциации российских озонотерапевтов поздравляем всех вас, всех организаторов этого замечательного конгресса с его началом. Желаем удачи в развитии тех идей, которые будут звучать на этом конгрессе. Со своей стороны я хочу продолжить с небольшой комплексной информацию о широте терапевтического действия озона с точки зрения как раз предыдущего докладчика Евгения Ивановича говорил о создании с помощью различных медицинских газов условно-рефлексогенного воздействия, запуска механизма по условно-рефлексогенным связям в организме. И конечные результаты, положительные результаты лечебных эффектов этих газов медицинских, они во многом пересекаются и схожи. Но сегодня и сейчас мы хотим поговорить немножечко о широте терапевтического действия озона, которое и начиналось, так сказать, широкое продвижение медицинских газов с лечебной целью, по крайней мере, у нас в стране. Несколько слов об Ассоциации российских озонотерапевтов, потому что в коллективе, присутствующем на этом конгрессе, и участниках конгресса, которые будут смотреть, не все занимаются озонотерапией. Несколько слов о нашей ассоциации. Ассоциация российских озонотерапевтов была основана в 1995 году в Нижнем Новгороде. Ее главной задачей является продвижение технологий озонотерапии в практическом здравоохранении. Для популяризации достижений и направления применения активных форм кислорода организован выпуск научного журнала «Биорадикалы и антиоксиданты». Он имеет государственную регистрацию и внесен в международные базы цитирования. С 1992 по 2018 год наша ассоциация организована и проведено 11 всероссийских международных конференций и конгрессов.
So then there is this conference, and the congress was organized
conferences and workshops,
in
and of
the
course
frameworks
we understand that
of
all
medical
those
education.
issues should be considered more carefully regarding different initiatives that we already have. Thus, for example, in
Since
Madrid,
an
in
international
Spain,
association was
we can see
organized
that
in different regions of the world,
we can
this is
see quite
association.
a big organization working on this issue.
So then
For
we
example,
look at
Spanish
Adriana
Association of
Schwartz
Medical
studies
Professionals in Ozone
of
Therapy,
ozone
which is called
therapies,
ILO-PRO, that covers 29 countries.
and the active organ of this association is
And
the
also we have
international
a
committee
special
that has
committee.
specialists, and the chairman is a doctor of pharmaceutical sciences who is working in Italy. And the activity of this committee is a generalizing international committee and Madrid Declaration in the School of Ozone Therapy. And for 1993, at the 11th in Congress in San Francisco, then there was a formulated conclusion of the forum, and in the presentations of Russian specialists who told us about possibilities of bringing ozone to a patient with the help of a transferring substance, the physiological solution, and also extracorporeal processing of with ozone. So then we should say that the attitude to ozone therapy should be formulated in a Madrid Declaration, that ozone therapy should be considered auxiliary, and the understanding of difference between this therapy and other therapies is significant for a medical doctor. We need to understand the difference between additional and alternative therapy. And the use of ozone therapy supplements allopathic methods. And the impact of ozone, this is the interval of concentration that elicits a therapeutic effect that has usual impact. And we should remember the minimally allowable concentrations in the air of the working zone, concentrations of ozone. We should be careful with this. And there should be 45 micrograms, the allowable concentrations in Russia, and like 1/10 of milligrams. And the acute poisonings that might be chronic and might prevent the use of ozone inhalation do not depend on time, but rather on exposition of these low concentrations during 2 hours or more. And there might be some undesirable phenomenon as the incapacity to focus with the also breakups in the vision field. The use of ozone and other oxygen forms in medicine then is related to the problem of intensification in the free radical oxidation. And the activation of processes of lipids oxygenation should be taken into account, especially when we have long-term treatment courses. And the local use of ozone therapy and the forming of different oxygen forms, and, as well as of nitrogen and chlorine. The human body has a complex of metabolites, and bringing ozone molecules with high potential, from which endogen forms are formed. Then there is a response to metabolic oxygen, and then there are mechanisms that transform these substances, and there is a change in energy. The use of active oxygen forms that change the oxygen metabolism. It is not sufficiently safe in case of possible violations on the work of these systems. That is why there should be stimulation and reactivation of oxygen metabolism without the violation in the work of oxygenation and reparatory systems. So we look at fermentative and oxygen wells, and this was encoded in the practical manuals, and the effect of small doses of medicines. This Paracelsus principle: everything can be poison, but only the right dosage makes poison safe. So then the formation of adaptive mechanism where the active where we started with low treatment doses. In medical literature, then there is information for physiotherapists
об успешном применении ингаляционной
with the
озонотерапии.
successful
Позднее
use
была
of ozone
разработана технология
therapy.
искусственного озонирования воздуха
Then
рабочих
there's
зон.
a technology
Ее
of
внедрение в спецовские
artificial
годы позволило снизить
ozone,
общую обсемененность в рабочих местах,
ozone
полностью устранить
supplement in the air
патогенную
working
токовую
zone,
флору, уменьшить
and
патогенную
its impact
микрофлору в
upon
15-20 раз,
pathogenic flora.
достичь
So, for
сапрофитизация
example, we want to
микроорганизмов
decrease the
16 до
pathogen microflora in
54%,
15 to
достичь
20 times
нормализации муонного
to
состава
achieve
воздушной среды, а у
saprophytization of
работников производств
microorganisms
улучшалась неспецифическая
16 from
резистентность
16.5 to
организма.
54,
Активность
and
лизоцилла
the
возрастала,
normalization of ionic
бактерицидная способность кожи,
composition of the
снижалось
air,
загрязнение кожных покровов,
and
достигнуто
also the
снижение
changes
заболеваемости организма болезни
in
на
the
25%.
contamination
А
of
по
the
итогам
skin,
этой работы Минздрав
making
Российской
this
Федерации в
contamination
1991
two
году
times
утвердил клинические
smaller.
рекомендации методические
And
по
we should
пути
develop
повышения
methodological
неспецифической
recommendations
резистентности
about this and
организма
how to
в условиях
decrease all these
экстенсивного
factors
производства.
in case
Позднее
of
ингаляционная озонотерапия
production.
в комплексном
And
лечении,
in the
например,
inhalation
ишемической болезни
therapy, when
сердца, была
there is complex
продемонстрирована в работе
treatment,
Ивановой Анны Викторовны,
then
которая из Ростова,
also
которая
uh,
проводила
Anna
ингаляции
Viktorovna Ivanova demonstrated this.
воздушно-озоновой
She had
смеси при
inhalations of air
используя
ozone,
экологические
and she
концентрации
used
озона, экологические концентрации
environmentally
озона, и сравнил ее с действием
appropriate
гиперболической оксигенации.
concentrations
В
and
результате
also compared
компенсации
it with the action
гипоксии
of metabolic
постишемической
oxidation.
и самой гипоксии
And then
постишемических
the
изменений в сердце
hypoxia
достигалось
itself
за счет
had the
повышения
changes in the heart,
углекислофосфоглицерата. Известны
um,
методы компенсации кислородного обеспечения при
so that there would be
при инфузиях,
uh,
при
the
попадании
infusion
озона другими путями, не ингаляционными.
when
Вызвало
there are other ways
гиперболической оксигенации
where
в
there is
плане влияния
oxygenation,
на лимфатическую систему,
when there
на
is
кровяных мембран. Озон
uh,
нормализовывал вегетативный статус при хронической ишемической болезни сердца с уменьшением активности симпатической и
when we
повышением
look
активности парасимпатической
at the parasympathetic
нервного
activity,
влияния. Снижал напряженность регуляторных механизмов.
where the regulatory mechanisms increased.
Точно так же низкие дозы озона оказались эффективными и при системных процессах,
In
связанных с
systemic
микробной инвазией
processes.
на целостном организме. Нами в Нижегородском институте
And
оборудованном
in
центре
the
изучалось противомикробное действие озона в организме при его системном применении, которое
so
имело
when
свои
there was
особенности. Эта
systemical
работа Кулакина
use
Емельянова
and
Нины
application.
Аркадьевны в 2006 году оказалось, что в условиях инвитро
So when in
озонированный
vitro
фиброраствор
conditions,
угнетал ростовые свойства синегнойных бактерий, снижал их адгезивность, повышал фагоцитабельность. При этом
so
наиболее выраженное влияние на
the most
частые
expressed
патогенности вот этих
impact
бактерий оказывал раствор с
that there
насыщающей
was
концентрацией
the
только
solution
1000
with
микрограмм.
iteration of with
На рисунке
1000
представлены кривые
micrograms,
роста синегнойной бактерии после воздействия
where
озона
we looked at
с разными
the
концентрациями 200 микрограмм, 600 и 1000 микрограмм. И
bacteria,
оказалось, что
and
как раз концентрации 200 и 600
then
микрограмм мало оказывали влияние в конечном итоге спустя
where there was
18
little
часов
impact
на
after
рост
18
вот
hours
этой синегнойной палочки в
upon
питательной
the
среде
growth
от 1000
of this
микрограмм, когда мы встречали
bacteria.
газовую
When we
фазу
talked
содержания
about
озона с 1000 микрограмм,
um,
заметно снижала
there
и
was
вот
the
этот рост
notable
синегнойной палочки. На
decrease
следующей диаграмме
in
представлена
the growth and
адгезивность
of this
разных штаммов
bacteria. And
синегнойной палочки.
when
Каждый
we looked at
озонированный физраствор с
the
концентрацией,
different
насыщающей 1000 микрограмм,
strains,
50-30 и 60 нанометров,
and
заметно снижал
we studied different strains
адгезивность,
of
то есть
Pseudomonas,
прикрепление самой микробной палочки к
and
клеткам
we looked at
хозяина.
the
На
connection
следующем
to the
слайде
host
показан рост
organism of this
фагоцитабельности
Pseudomonas
медных микроб при воздействии
originosa,
на них физиологического раствора,
and we
обработанного
looked at
разными
the
концентрациями озона. И
physiological
следующий слайд
solution. In the
регистрирует
next slide,
результаты методики, с помощью
we
которой можно
see
было
the
определить,
results
разработана была
that
методика,
we could
чувствительность к антибиотикам
determine
у микробов
there
с помощью
should be
добавления
sensitivity to
вот этой рабочей
antibiotics
концентрации озонированного физиологического раствора.
of
Оказалось, что вот верхний ряд
physiological
столбиков, среди которых
solution
выделялись несколько антибиотиков, которые
where
проявили
there were
наибольшую
few
чувствительность
antibiotics,
после действия физиологического раствора, мы их и выбирали для персонального назначения
where we looked
отдельным больным.
at the scrabble to different patients where there was a limitation in dissemination. And there was this inhalation method, and not only Vitokhin, but Spiridonov and Babanov with lung diseases, and how to increase the labor capacity in a patient. And here we can see the results of experimental approach and the intravenous injections. And so when we look at the lower ozone doses, we can compare the results and can look at the oxygenated solution when there is a control, and you look at the oxygen homeostasis, where we look at the centralized hemodynamics, and we look at the applied methodology that was selected in order to make intravenous infusions for the first procedure in ozonated solution. And when we look at the oxygenated solution introduction, then we check the condition of antioxidant balance in order to compare the priority study and non-invasive introduction of physiological solution of systemic ozone therapy. And the comparison of infusion demonstrated that the primary procedure, there was oxygenation many times that had the advantage in ozonation and its impact upon metabolic systems and other oxyreductants and the oxygen exchange. So here we look at the capacities of ozone impact with the help of fluorography device in order to use this apparatus both for the evaluation of metabolic response if then we look at the oxygen that was dissolved in the solution, then the efficiency of the ferment decreased. And then the presence of ozone in physiological solution then could be, you could see the increase of biochemical activity. And the comparative evaluation of ozone solution with the parameters of the central hemodynamics, and this is before oxygenation.
сократительности миокарда, ударного объема и минутного объема с понижением периферического сопротивления сразу давали себя знать уже на первых процедурах системной озонотерапии. На следующем слайде показана
used actually, and the results that were received with the procedures that we used with natron chloride plus O2, etc. And also we can see quite direct response regarding the response of the bodies and the solutions that were used for that matter. So this is the data that were received from somatic patients, and they were confirmed during the use of physiological solution and complex solution for systematic hemodynamics. And here we can see analysis within the 12 and also 10 days. We can see the concentration that was used here. We can see that microcirculation indicators was quite important for this kind of patients. And we can see, well, actually it's was really important for the infusions of ozone physiological solutions used within 10 procedures. I mean, 10 infusions that were used there. Here we can see here we can also see different other factors, thus for example, that could be used for the analysis of the efficiency of natrium chloride that we used. And also we can state that there were quite positive effects when we used one single used ozone therapies, I mean therapeutic solutions, and also, for example, Mr. Tartip Alexander Lvovich, he developed quite an interesting procedure regarding osteogenesis with the help of ozone-based isotonic solution. Here we can see that it was used for the situations where we had a problem with fractures and some other medical situations. And here we can see different ranges of concentrations. We started from 500 micrograms to 5,000 micrograms, so different ranges of concentration. And as we can see that ozone concentration was a little bit different, but at the same time, I mean, all those effects, they were analyzed, and we also analyzed the effect of this concentration of fractures on the formation of osteoneons and also formation of different bones, vascularization of the fracture zone, etc. So, well, and from the experimental point of view, we can state that this kind of, I mean, effect that was produced and that was analyzed is absolutely important. We can see that this inhalation and ozone therapy really has a direct impact on the overall situation. And at the same time, we still understand that probably all those ozone concentrations could be also modified depending on the effect that we would like to produce on the patients. Here we can see some clinical studies where we used physical solutions. Here we can see different method forms and different, I mean, cases, etc. We can talk about the use of minimum zones of ozone therapy. So it's something that was done also by Mr. Boyarinov. It's one of the Association of Russian Ozone therapists. We can see where we used all those ozone solutions with a concentration of 30 micrograms. Well, we can see how it was used during the first day, the third day, fifth day, and seventh day. So we can see that there was quite a decrease in molecules that were produced following the ozone therapy.
Следующий пример эффективности внутривенных инфузий малых
Here we
доз
can see
озона в
some
малых
intravenous
концентрациях в
infusions
ходе
and
малых процедур
how it
лечения
was actually
сопровождается
used
кислотой.
as part
Например,
of,
работа
I mean, the analysis was conducted to
применение
analyze the clinical
введения
efficiency
заболевания
of
загрязненности азота
intravenous
в нейроциркуляторном
injections.
организме. Тоже были
Um,
насыщающие
and
концентрации
again, we had
величиной
some concentrations, they were
2,5
not that significant as it was
миллиграмм с
2.5,
с дозами
3.3
озона переносится
milligrams
по 120 микрограмм
per
и в течение
liter
10
in the gas
12 минут.
phase, and it was, I
Когда
mean,
отслеживали состояние
done with a
сосудов
period of
коллектива глазного
12
яблока и
days.
капилляров опухолей
We can
стволового
see that it
мозга,
has a
здесь
direct
представлены
impact on the
показатели здоровой картины микроциркуляторного русла глазного
capillary
коллектива
system
глазного
and
яблока и
also
ногтевого ложа у
uh,
здоровых людей.
on the
Вот пример
nail layers
таких же
that
фотографий у
were
него уже
detected
у
there.
пациентов
See
с
some
имеющейся нейроциркуляторной
additional
дискинезией,
pictures.
с гипертензией,
We can
серьезной
see
гипертензией, когда
here,
отчетливо
for
видно
example,
патологии
I mean,
венозного
patients
отдела
with venous
периферического сосудистого
hypertension, again within
кровообращения,
the
коагуляции
vascular systems
сосудистого
was,
ногтевого ложа
um,
и
we can see arterial and venular
капиллярная
coefficient
просматривается не во всех полях
1.24,
и малых
and we
контейнерах.
can see
Ну, вот
capillary
такие же
network that
фотографии
is pretty much
после,
affected
после
within quite a
введения,
number of
после введения
different areas, and we can see
вот это
what
было
actually happened after, I
и
mean, this
патологии, и
kind
все
of,
те же фотографии,
I mean,
такая
pathology
же
happened,
эффективная
and so
картина
when
после курса
uh,
системной
treatment
озонотерапии.
was actually accomplished. I mean,
Еще один
using
пример
ozone therapy.
влияния озона на
Another
метаболические процессы в
example,
организме–
here
это
we can see
стимуляция
effects on
функциональной
metabolic
способности
system of
печеночной,
the body. Here we
печени
can
как
see
органа
what is actually
детоксикации и
happening with the
органа
liver, and
синтеза
I mean,
белков
when
в
we have
организме.
a direct impact on the
Вливание
synthesis that is
азонируемого
produced
раствора в
by
течение курса по сравнению со
the
стандартной
liver,
терапией
and we can
оказало
see where we have a
преимущественную
very interesting combination of
стимуляцию
ozone therapy and
белковообразовательных
also
функций
some
печени,
other
наоборот,
conventional
здоровой болезни,
approaches,
которая
and we can see
получила
that
только дополнительные
when we
инпуты
used
озонируемого
those
раствора
additional
за
infusions,
счет
it really
выполнения
improved
чисто
the
стандартным методом
situation. So
лечения.
we can see where it, I mean, how it was
Низкая
happening,
активность
starting from the
системы
second week,
введения
the first week,
озонируемого
etc.
раствора
We
в
can
больных с
see here
СРЛ.
also, I
Работа
mean, the
выполнялась
use
в
of
Саранском медицинском
ozone
университете
therapy and how it
и
is
оказалось,
used with
что
all
введение
those patients
озонируемого
with
раствора и сочетание введения
psoriasis.
озонируемого
We can
раствора
see
с
a combination of different approaches. For example,
эфирентными методами
traditional
с аутогеостазом
plasmapheresis, and
фолликулярной
so on and so
озонотерапии
forth.
давало
And
преимущественное
also we can
снижение
see that at the
серомукоида,
same time,
C-реактивного
I
белка
mean,
и
approaches
серомукоида у
related
этих
to
пациентов.
zone therapy, well, led
У
to
больных
quite
с
positive effects.
Hormoligosis пример
Another
использования
example,
озонотерапии
I
в
mean, where we
стоматологии.
actually used this ozone
При
therapy in,
применении внутривенных
I
капельных
mean,
инфузий
in dentistry. Here we can see the use of
озонируемого раствора при
infusions.
сочетании вот этого метода с
And so when we
гирудотерапией
combine these
в
methods with
стоматологической клинике,
therapy, for example, within our clinic,
проводителя этой работы,
I mean, that was
повысила
guided by Mr.
эффективность
Kazarin,
комплексного
it
лечения на
proved the
29%,
efficiency
эм,
of this
на
approach. And so we should say that
29%.
the efficiency of the approach in general was boosted by 29%.
В хирургической клинике
Here we can see
Саранского медуниверситета была разработана технология
Saransk
использования озонируемых азотных
medical
растворов с
establishments.
малыми
There we
концентрациями
used
привлечения в
also
диетической
physical
среде.
solutions.
На вторых
We
под
had a
руководством
combination of
профессора Беляева
natrium fluoride
использовали
and
и в
ozone,
этой комплексной
and
терапии
we also
как
used
внутривенные
quite a
инфузии
comprehensive approach to ozone
озонируемого
therapy.
раствора,
So the point is that it was done intravenous, and the point is that it proved quite to be a successful approach as for medical literature and the internet. Recently and now there we can see a lot of discussions related to ozone therapy and also different doses of ozone so that might be used. And of course what we do really want to receive, we want to receive the more precise information regarding the efficiency of this or that approach. So in order to study all those issues and to think more about I mean, probably the toxic effects of such an experiment and such an approach. We need to analyze quite a number of documents, and one of them is one of the guidelines for the preclinical studies, new pharmacological agents. I mean, where we can see a full analysis of all those issues dates back to 2000, 2003, and there we have certain studies that also include information regarding, I mean, with months, etc. Here we can see, different test groups where we could use the different micrograms, zero point 0.6, 2 micrograms, 8 micrograms, and also there was quite a thorough study where there was an analysis accomplished on the rats and also on the human bodies. So we can see here that we also used their human beings with a total mass of 70 kilograms, and there were different approaches. For example, 168 micrograms, 560 micrograms, 2,240 micrograms, and they were used for different mass criteria, etc. And here we also analyzed different approaches to the toxicity, I mean, toxicity effect that was produced based on the use of this therapy. So we analyzed the state of, of people involved in the experiments and also rats involved in the experiments. So we can see, the overall oxygenated and ozone-based physiological effect, and also the recovery period that basically took up to 30 days. And here we could see the antioxidant effect, I mean, the way it developed and how it actually changed within a certain period of time, 30, 60 days, etc. So we understand that, these indicators give us quite a clear picture regarding the situation that we have here. Here we can see, for example, products of also oxidation, I mean, lipids specifically related to the infusion of oxygenized and also ozone physiological solutions. We can see the impact that was produced within a period of 30 days. We also can have some information regarding recovery periods and also percentage, how the concentration changed regarding the initial dose. We also kept a close eye on super oxidamentase of, for example, erythrocytes or thrombocytes after a course of infusion, and how it's actually changed within the period of 30 days, which is really important in terms of overall analysis. The way, the figures changed within a period of 30 or 60 days. We also need to think about ozone and physical solution that's used also for the recovery periods up to 30 days. We can see information about lactogenin S and also algidrogen S of erythrocytes that could be used for this kind of treatment. We also need to think more about carbohydrate exchange and the way it actually presented in the blood circulation and also in erythrocytes. Here we can see some information about uh, functional changes. So we could saw that there have been some changes in the function of cardiovascular system and also some uh, functions of the body, uh, but it was only uh, very well witnessed on within the
в последующее восстановительном периоде. Следующий слайд.
animals that were used for this kind of experiment. Speaking about regulatory mechanisms, specifically regarding blood circulation, etc. Yes, we got saw that yes, ozone therapy was quite efficient, and information actually very dependent on the dosage and many other aspects. And here we can see morphology of the blood itself. I mean, something that we assessed with the help of crystal-based diagnosis. Here we study we use the methods of the so-called drying drop. Here we can see how it was accomplished, depending on the dosage. We can see 0.6 micrograms, 2 micrograms, and 8 micrograms. We can also analyze here crystallization level and so on and so forth. Also, crystallogenic blood serum activity was also analyzed there. So as a resume that we analyzed there, we of course first of all stay focused on oxygenized solutions and the effect that is produced on human beings and animals, etc. And of course it needs to be studied more. We need to analyze it more carefully regarding, for example, the effect that it can produce. Here are some of the recommendations that were suggested and put forward. For example, here we have one of the approaches where we say that we need to focus more on ozone therapy and probably to think about the possible dosages. Some of those aspects were reflected in one of the declarations regarding ozone therapy that was issued on the 22nd of March back in 2020. And of course, still we need to be really careful about the usage of such recommendations. And speaking about the dosages, Andrei Ivanovich, for example, conducted some of those studies. You can see here this visual picture, I mean, of the blood, and we can see that, a lot depends on the dosage that we are using in our work. I would like to say that yes, we conducted also similar studies, and back in 1995, that was also the case. We worked with a number of volunteers, and also in Nizhny Novgorod, we used also quite a big concentration of ozone, and they were used for our patients. And then we actually keep track of, everything that was happening with that afterwards. So it turned out that after this procedure, one blood is treated with mid-size and also small size, dosages, milligrams, where we had, for example, 80 milligrams. It turned out that 1 hour and a half it was controlled. It turned out that the biggest number of all those I mean,
таким образом, заканчивая свое
uh,
выступление, хочу
blood cells, I mean,
поблагодарить всех
I
присутствующих
mean,
слушателей и
erythrocytes,
обратить
they
ваше
found
внимание
in
на возможности
kidney and also in the liver. I
терапевтические
would like to think
возможности
that there are
применения как
certain
раз низкого
theoretical effects that
надпорогового
can be generated with the
внедрения
help of ozone
озона в
therapy.
качестве
And of
лекарственного
course, it can be
средства,
used as one
которые
of the medical
позволяют
approaches,
моделировать,
allowing us
модулировать как
to
раз те условия
really create
рефлексогения
very
организма,
positive
адаптационные
approaches
реакции,
to adaptive
которые говорил
reactions
Евгений
of
Иванович. Вот он
the
говорил как раз
body.
именно об
And
этом.
it was
И
mentioned by
это
Gennady
прозвучало
Ivanovich as well. And it
в
was also
оценке
mentioned by
замечательных ученых
some
разных газов,
other
особенно тех
specialists.
газов,
We
которые
need to
несут в
think
себе
more about
начало
cases that can be
активного
used for that matter,
кислорода,
especially when
и
it comes
которые
to
эндогенно
active
присутствуют в
oxygen, where we
организме. Вот
have
эти
androgens,
эндогенные
etc.
адаптационные
So
механизмы,
I
они
think that
необходимо
all those
сформировались
mechanisms
у
are absolutely important
человека, поэтому при любой
for us
патологии,
and
которая
for
нарушила
human beings.
эволюционный
When there is a pathology in
естественно-эволюционный,
place
физиологический
and
и
where we have a
адаптивный,
problem with some
дезадаптивные
adaptive
реакции
reactions,
возникают. Вот
well,
это
it needs to
организм
be more
борется
carefully be
естественными
analyzed.
механизмами,
I'm
которые мы
absolutely sure
оспорим
we
в
need to
сторонам, но мы будем на
come
них
up with the right
концентрироваться и
mechanisms
представляем
that could be used to
выработать
help us
ответную позитивную реакцию в плане
to
адаптации
treat
к этому
different
патогенному
diseases and
механизму.
also to
Благодарю вас
come
за
up
внимание. Спасибо
with
большое.
certain approaches
Большое
to
спасибо, Сергей
different
Петрович, за очень информативный доклад.
diseases.
Наше
Thank you very much
мероприятие
for such
движется дальше.
informative
Благодарим вас за участие. И
presentation. I would like
мы
to
с
thank you
большим
for your
удовольствием
participation, and
переходим к
it's my
следующей
pleasure
теме.
to
Инертные газы
proceed
в медицине,
to the
опыт
next
применения и перспективы. И
presentation.
представит эту
Inert
тему
gases
исполнительный
in
директор
medicine,
Ассоциации
and
специалистов
the
в области
floor will be
медицинских
given
газов,
to
член-корреспондент АМТН
specialist and also
Александр
one of the
Владимирович Потапов.
correspondents
Пожалуйста,
of
вам слово.
FGM, Mr. Potapov.
Уважаемые
Please,
коллеги, добрый
over to
день.
you.
Я вашему
Dear
докладу,
colleagues,
вашему
good
вниманию хотел
afternoon.
представить озвученный доклад.
I wanted
Вообще,
to
когда речь
share
о
my
инертных
presentation
газах,
with you. Actually, when
всегда
we talk
кажется, что
about
это какая-то абсолютно
inert
инновационная
gases,
тема. В основном она ассоциируется
seems
с
like
какими-то
it's a quite
разработками
innovative
с
issue,
ноу-хау. И, по сути, цель моего
very much
сегодняшнего
associated with
сообщения является
know-how.
некоторое
And
развенчивание
what I
этого мифа.
wanted to say is
Я постараюсь очень
just,
коротко и сжато
I mean,
рассказать о
to
том,
really
что
get
было
rid of
сделано в
this
мире
myth.
за
And I
эти
want to
десятилетия
say a few
применения
words
исследований
about
инертных
what
газов
was
и
done
какому этапу
within
сейчас
the
находится
periods
современная
of
наука в этом
2
направлении и
recent
что постарается
decades
на какие
where
области
our
смотреть в ближайшие годы.
science is
Когда мы
on that
говорим об
matter.
инертных
When we
газах,
talk about
мы
inert
всегда помним
gases,
школьный курс химии, физики, что
we
опять
also think
повторение газов,
about
начиная от самого легкого гелия до самых
some
высоких
classes
газов.
that
И, разумеется,
we
свойства этих газов
received
настолько различны от
back in
микроорганизма
school,
к
for
камню,
example, xenon,
бактерии, к всем
xylon,
растениям,
etc. Of
ко
course,
всему
they are
бывает раз
unique,
тяжелее
they
воздуха,
are quite
то, конечно,
lighter than
сравнение
oxygen.
этих газов от
But
физиологических
if we
эффектов
compare all those
достаточно
gases
сложная
and all those
многообразная
physiological
задача,
effects,
которую исследователи
this is quite a difficult issue, but
предлагают
at the
как
same
решение
time, it's very
отдельных
important if we
вопросов.
talk about the gas
Поэтому мы
therapy
сегодня
that
постараемся
we work on
ограничиться двумя
right now.
газами,
So today we are going to work with
изученными
the two
и
most
исследованными. Это газ ксенон,
important gases,
как
which is
самый
xenon,
тяжелый благородный газ,
one of
газ
the
эфир, как
heaviest
самый легкий
gases,
газ. И я вам
and
сегодня расскажу о том, что
helium.
было сделано
So
и
today I'm gonna say a
в
few
данной
words
системе
about what
газов.
was done in that particular
Когда мы говорим про
direction.
ксенон,
So when we talk
конечно, в
about
основном
xenon, of
ассоциация
course,
это возникает у
one of the
специалистов,
major
это
association
обозреватели,
that we have,
профессиональные
I mean,
фары.
for the
Это наиболее
specialists, it's
часто
all about
применяемый сегмент.
xenon headlines. It is
Конечно,
very much
безусловно, есть
used
еще и другие
in
применения.
technology,
Это и
etc. We also
коррекция
know some other
кислорода,
usages, and also in, for example,
специальные газовые смесители лазер.
I mean,
И
satellite
когда мы говорим о
systems,
медицине,
etc. So we talk about
здесь
medicine.
необходимо пройти по
Uh,
определенным
then
методам,
apparently we
чтобы
have
понять, насколько эта
to
тема на
go through
самом деле
some
не
benchmarks
является
in order to
инновационной,
understand that
такая новой
it's not an
и,
innovative theme
соответственно,
and
какие были
everything is
обучения
quite
применены.
clear and a lot of
Ксенон как
uh,
благородный инертный
uh,
газ был
I mean, xenon
в
is
1969 году.
gas was discovered back
Британские
in
ученые, в данном случае это Вильям Рамсей и Трейверс, были
1868. It
исследовали
was done
смеси,
by William Ramsay
крупных атомов
when
ксенона
he
и
analyzed the
обнаружили, что
different
есть большая
combinations of
фракция
various gases, and also
засилия была
krypton,
неизвестна.
etc.
Она
And
была
he
чужая
studied
в
that
воздухе,
carefully,
поэтому
and he
ее решили так и
identified
назвать
some alien
CFS,
substances
благородный инертный
that
газ.
were there, and it was classified an alien gas, and it was not, I mean, previously classified. Then it was given the name of xenon, and after that, I mean, it took us quite a while to come up with the right description of this gas, and we saw that it took us, I mean, sometimes up to 100 years to come up with the right classification. But I mean, further usage of xenon and other inert gases, I mean, led to a new era, absolutely new. For example, in 1941, there was another classification of xenon, and also it was used for some deep water operations, etc. And we also analyzed some additional effects that can be produced by such gases as xenon, especially when, I mean, we talk about, for example, anesthesiological effects of such gases. We can see that, yes, we analyzed inert gases, I mean, the way that can be used for, I mean, different approaches. So we also um, uh, helium was another option that was also used there together with xenon. And so both gases actually demonstrated quite very interesting properties. And we realized when the concentration was going up to 50%, patients could fall asleep. And so the experiments were conducted to do that. And Mr. Lazarev is one of our I mean, counterparts. He suggested that, I mean, the effect of this inert gas is quite proportional to molecular weight, and the more, I mean, the heavier it is, I mean, the more interesting narcological or anesthesiological effects of this gas are. So then, back in the 1946, well, some other studies were conducted, and also it was guided by Mr. Lazarev and Mr. Kulin and Mr. Gross, where they analyzed the impact that can be produced by xenon. Our colleague in St. Petersburg, they also organized one of the first narcosis. It was done with the help of Mr. Smolikov, Boachidze. Those were experimental doses of xenon. They were used for some experimental works. We saw that in international literature there was quite a gap in publications and articles, but we saw that still there were some parts missing within the studying of all those gases. We can see here, I mean, a story that we also have regarding xenon and medicine, history of implementation starting from 1992 up to 1999, something that was accomplished together with Mr. Burov. Yes, this gas was studied more carefully. There was a pretty clinical study, I mean, of I mean, this gas and how it can be certified, etc. And also it was one of the drugs that was suggested by for anesthesia, and also it took our European colleagues 8 years to have this gas certified within the territory of European Union. So we can say that it was officially accepted within 12 countries, and there was certain practice put in place called xenology. I mean, all about the study of the xenon gas. It was, I mean, a very important aspect of that time. Also, we can see that back in 2013, we received some additional certification for this gas. It was done in Russia, and also it was in 2015 very much accepted by Mr. Rochal. It with the help of this specialist that also was
So it is very
accepted
important to
for
note
some
that
pediatric
our
usages.
colleagues
And
are
back in
repeating the work that
2018,
had been done in
we
Russia 10
also
years ago. And since
saw that we
2018,
started
clinical
some
research of
active
xenon
usage
is
of
started
xenon.
as therapeutic pharmaceutical for treating post-traumatic stress syndrome. And we were going through different anesthesia descriptions and stages. And now I'd like to talk about the practical aspects where gases are used, xenon is used specifically. And if we are talking about the most evident xenon use, because it has been in use for more than 70 years, then everything becomes very understandable. Uh, because xenon doesn't elicit allergic responses, and it protects of physiological risks. And then we can see what kinds of interventions can be used, where patients are immediately awakened, and how many hours this intervention should continue. And so anesthesiologists have a rule for choosing a criteria. So then the graver the patient, the more xenon should be used. And it should have some well-recognized niche. It should be accepted in the medical community. And in the therapeutic practice, xenon is used in all different directions. There is a highly effective therapy, and the effect is very expressed, very evident. Where, for example, there's no license for some narcotic type medicines, then we can use xenon and immediately give relief to our patients and decrease his suffering. And it also has a pain killing effect, anesthesia. That is why neurologists have more and more uses for these gases. In narcology, xenon was described in the 90s. These were the first articles in the 20th century where the problem of relieving neurological symptoms was described. And the whole combination and the anxiety disorders, or the behavioral level, and also the relief of patient's suffering without loading a patient with well-known pharmacological medicines. For a given category of patients, which is important for these relevant moments. And this is, of course, the improvement in neurological disorders, for example, with anxiety components. Xenon helps to correct this state. It is highly effective. And doctors get very good, very positive results. And even after one use of xenon, there is improvement of a patient's condition and mood. So then xenon can help a medical doctor. Another very interesting application is in cardiology. In case of the acute coronary syndrome or the myocardial heart attack, And when there is also anxiolytic impact, and in cancer studies and cancer treatment, where there are also significant results. I will tell you about this a little bit later, about the scale of research, after which it has been proven that in case of non-progressing cancer diseases, there is positive impact of xenon, and there is rather stable recovery process. In dentistry, xenon is used mostly for relieving the phobic expressions in patients, where there is a situational anxiety. And naturally, this also has impact upon the hormonal level. And this has also impact upon the side effects of this medicine. And then dentists use xenon before the procedure, but as a discomfort relieving medicine, or for example after some serious intervention, so that a person would perceive this treatment more adequately. And sport is one of the most interesting spheres. So after Sochi in 2014, and the whole association of anti-doping organizations, so that the technology would be allowed, but it is also can be used in case of the chronic disorders, and or when there is excessive psycho-emotional load, where there are
География применения ксенона на сегодняшний день достаточно обширна. Это более 300 клиник по России,
and these are about 300 clinics in Russia that are using xenon.
истории. И на данном слайде я привел даже не полный список, только
In this slide, there is not even a full list
частных клиник, которые работают с этой технологией.
for state clinics that work with this technology.
Говоря про методическую базу применения
And when we talk about the methodological base,
очень масштабно изученная тема.
we can say that this is a very well-studied topic that is used for Ph.D. thesis defense, and there are 10 methodological manuals developed, 5 PhDs were defended, and 4 post-stress, post-traumatic disorder syndrome. They use in oncology, in dentistry, and in practice, where there were dozens of scientific recommendations. This would be the most interesting story in this direction. So when we are talking about the legal basis, the use of xenon, xenon was certified since 2003, and it was allowed to use in medical technology. So it's about 20 years of clinical experience in Russia. It went through the appropriate certifications in medical supervisory bodies in Russia. And it is also used in Kyrgyzstan, and Kazakhstan, and Georgia, in the CIS countries. And I think that this work has high prospects also for registering in the European Union. And also the freshest achievements, Xenox, taking into account the mixture, So
полностью
you look at
предоставляет доступ
analgesic
с
means.
технологии врачу не анестезиологу, уже, так сказать, к другой специализации, поэтому вот допуск и сертификация этого препарата после проведения
So if we
клинических
look at
исследований
the certification and
позволяют
allowances
более
for this
широко
medicine,
терапевтическую область рассматривать совершенно в другом свете, на другом уровне
then this
легитимности.
therapeutic range and
Ну,
area
поэтому несколько
is considered at a
методологий,
different
поэтому
angle.
только
Since
российским
we have an
зрителям немного
international
взглянем на то, что
congress,
происходит в мире. На
we should
следующих
also see
слайдах
what's
я вам
happening in the
привел
world.
некоторый литературный обзор того, что было сделано. Безусловно, это слайды
I
для
would like
чтения,
to give
для
a
восприятия отдельной
literary
информации. Вот если мы посмотрим на
review of what
первую
has been done.
публикацию, первую с
If
конца или
we
сначала,
look at
которая
the
была
first
проведена на
publication
ресурсе
that was published
zine.ru,
in a resource,
то публикация 2009 года, стоящая под
and
номером
then the
1,
publication in
рассказывает о
2009
эффектах ксенона у животных.
on
И
the effects of
последняя
xenon
публикация — это
on animals.
945
Then
публикация,
we
отсылает к
look
далекому
at the
1938 году, когда начинались самые первые работы по применению
the
именно
first works
у военнослужащих.
with
Данный слайд демонстрирует
xenon.
определенное
And in
представление о
this
масштабах публикаций
slide,
в
you can
научных
see the
науках,
scale and the
доступных
xenon
в мировом
application.
научном сообществе. То есть это более 500
When we
западных
look at
публикаций
the
по
world
применению ксенона в
science
областной
community
нефтехимической практике. Но, тем не
and
менее,
the
есть уже
study of
целый ряд интересных наработок по
anesthesiological best
терапевтическому
practices,
применению ксенона. На следующих слайдах
the therapeutic
я
use of
сделал
xenon.
подборку работ по применению
In
ксенона
the
в
next
медицинской
slide, we can
практике.
see
В
a
основном он
selection
применяется
of
как препарат
papers
для купирования ишемии головного мозга,
on,
инфаркта
for
мозгового,
example, how
прежде
brain
всего
ischemia is treated
нейроорганизационные
with the
искусства,
help
которые в
of
данном случае
this
применяются. Вот в
medicine.
данном направлении более 28 научных работ, которые лично мне
So
удалось
when
внедрить
we see
из
at 28
специализации
science works,
для
when
тех, у кого
there is
интересно к этим работам обратиться, почитать
interest
свои мне западные коллеги, в данном случае на
to this
исследованиях.
direction, I think our Western
При этом очень
colleagues
интересная
can
тенденция,
also
если
pay
по
attention
применению ксенона в
to
неврологической
xenon
практике мы видим
and in
целый
neurological
ряд
practices.
репрезентативных исследований, почти
There
30
are
работ научных, которые так или
representation
иначе
studies
раскрывают определенные свойства ксенона и его действия.
that
По привлечению
open
психиатрии,
certain
несмотря на то, что их
properties
основные
of xenon,
показания были показаны методические рекомендации, медицинские
and
технологии
the
материалы,
methodological
то по
recommendations
западным
with
источникам только
then
одна работа опубликована, это как раз
if
в
we talk about
2002 году
Western
исследование
sources, there was only one
посттрауматическим стрессовым
paper that
расстройством
has been
при, соответственно,
published.
контроле этих
It's on
расстройств с помощью ксенона. То
post-traumatic
есть в данном
stress
направлении нашим
syndrome
западным
and
партнерам
the
еще
recovery
предстоит
from
целый
it,
ряд
successful
открытий,
recovery
которые
with
на
the use of
сегодняшний день
xenon.
для нас уже не являются чем-то новым, непривычным. Десятки, сотни, даже тысячи пациентов
Then
получают
there are
терапевтическую
dozens and
помощь с помощью
thousands of
ксенона.
patients
И, соответственно,
that get
активно врачи пользуются этой
monthly
помощью.
assistance with the help of xenon.
Коллеги, я постарался очень сжато, потому что понимаю, что есть временной регламент, осветить именно
So
тему
I
применения
tried to
ксенона
be
в
short, and
медицине. Думаю, что позже вернемся
then
к
there is this
самому
time
оборудованию,
limit.
которое доступно для пользователей, для врачей,
And
которые хотят
we have
использовать это
equipment
технологию.
that
Сейчас я бы хотел
can
также
be used
достаточно
by those who
кратко
want to implement this
пройти
technology, so we can share
данное
the
изделие.
equipment.
Это
Um,
интереснейшее направление,
and
оно
then
еще
very
более
interesting
изученное,
directions,
чем
helium
ксенон,
in medicine.
но
It's even
при
more
этом есть определенная
interesting than
ирония, что
xenon.
несмотря на то, что гелий применяется в медицине, как вот мы
And even though
сейчас
helium has
знаем,
been used in
уже
medicine for a long
более
time,
90 лет, на сегодняшний день
this has
гелий
been in use for
в
more than
нашей
90
стране
years,
как лекарственный препарат не зарегулирован. Я постараюсь вам
but
рассказать
it
о
is
тех
not
шагах,
regulated
тех
as
результатах, которые нужно получить для того,
treatment
чтобы гелий занял свое
use.
достойное место
And
в
helium
нашей практике.
has
С
taken
1868
its
года
good
этот
place in
газ
medical
был
practice.
открыт.
So
Французский астроном
this gas has been
его
discovered, and a
открыл
French astronomer
нашему человечеству как определенный уровень спектра при изучении
then
солнечного затмения в
demonstrated a
Австралии.
certain range,
После
like
через
when we studied,
несколько
for
десятилетий
example,
появления
the
в Земле
equinox in Australia,
на нашей планете было доказано его присутствие в атмосферном воздухе.
and
По сути,
where
с
this gas
начала
was found
19
in
20 века
atmospheric air
при
after
внедрении
this,
в научную практику
and
стратегии
after its
эффективной терапии.
use
Гелий
in
кислородной
science
смеси, как
practice.
я уже
And helium and oxygen mixes.
Внедрение ксенона в клиническую практику применяется достаточно давно.
In the story
Применяются
of
прежде всего
implementing
в
xenon
лечении в
medically,
немедицинских целях для
then
глубоких погружений.
we can see how it
И
was
вот эта
used
абсолютная
for
инертность
deep
углекислородных смесей
water
побудила, по
submergence.
сути, врачей и
So
исследователей
these
более
gas
пристально обратить на эту
mixes
технологию внимание, потому что гелий
should
достаточно
be
легкий,
studied
в
more
7 раз легче
closely
воздуха.
by medical doctors because helium is
Гелий
much
очень
lighter, seven
текучий газ,
times lighter
поток газа бесконечно
than air.
увеличивается
It
ламинарно,
is very
пациенту легко
flowy,
дышать, поэтому уже с 30-х
and
годов
so it is
начались первые
easy
исследования, которые
to
пытались
breathe with
проверить
it.
и безопасность гелий-кислородных смесей,
So then there is increased safety in helium and
начались уже первые исследования по
oxygen
применению
mixes, and
гелиокса,
also there is
по сути,
decreased
называется
possibility of
гелий-кислородные
harm.
смеси, при пульмонологических заболеваниях. Прежде всего, это
And
астма,
so I think
легкие
it is
бронхиальные
recommended to
инфекции,
use
ну и
this gas
впрочем, другие
in the treatment
проблемы.
of pulmonary
С
diseases.
1972 года гелий,
Starting with
точнее гелиокс,
1972,
сертифицирован на Западе
helium was
как лекарственный
certified
препарат, то есть как
in the
лекарство
West
уже с
as
50-летней
medicine.
почти историей.
This is a
При этом,
medicine
как
with
есть
a
в
50-year
случае,
history.
по иронии, в нашей стране, несмотря на
Then
богатейшее применение
this,
гелиокса при лечении различного рода заболеваний,
despite the
на
fact
сегодняшний день
that
технология никак
this
не
is
могла
used
бы
in
быть
our
сертифицирована, не зарегулирована.
country, but
Только в
this technology
2020
hasn't
году
yet been
вот эта
certified,
вся
and there is
полемическая
irony in it.
история и опыт применения гелиокса при
And there was this
пневмонии, по сути,
story
сподвиг Минздрав пересмотреть немного свое отношение
with the use
к
of gas that
отсутствию
changed the
гелиокса
attitude of
для
the Russian
лекарственных
health
препаратов и,
ministry.
скажем так, немного ускорить процедуру их сертификации,
And
регистрации.
to
Мы
speed up the
надеемся в ближайшее
certification
время
procedure.
уже получить гелиокс как абсолютно сертифицированное
So
лекарство.
soon I'd like to
2020
get
год в этом отношении, как говорится, не было бы счастья, да несчастье помогло.
Helivox.
На данном слайде приведены физические свойства гелия. В табличке, как вы можете видеть, указаны различные газовые смеси различного состава. Воздух. Мы с вами знаем, что он состоит, если говорить грубо, из 20% кислорода и
Um,
79%
here different
Соответственно,
concentrations, I mean, as to how actually helium can be used, and also regarding the composition, we can see where we have, for example, 100% helium or 30% helium and heliox 30 and heliox 21. I mean, the different mixtures
По
of
сути, вот эти именно
oxygen.
физические свойства,
So
такие как
basically,
низкая
these
плотность,
physical
высокая
properties like
проникающая способность,
density,
высокая
permeability
лояльность
level,
к
and
оценке
I mean,
полагающихся лекарственных
some
лекарств
other
и
components. Of course,
верхние и
they
устойчивые
identify
позволяют
some of the major effects that
его
can
крайне
be,
эффективно применять при лечении различных
I
видов
mean,
хронических
produced by
заболеваний.
this
Вот на
kind of
данном слайде видно
solutions. On this
анимацию,
slide, we
каким
can
образом
see this kind of
меняется
animation as to
движение
how
кислорода в воздухе,
actually uh,
физика
this
процесса.
effect can be attained. We can see mixtures of oxygen and also helium. I mean, different concentrations.
Поток из
So
турбулентного из
here we
исходного
can see,
переходящего
for
в
example,
ламинарный,
turbulent flow,
развивающийся
laminar
стиль
flow, and so on and
циклического
so
циклического
forth. We can
циклического
see also some physiological
облегченный
effects
поток,
produced
потому что
by
гелий несколько
thermic geliox, and also it very much depends on the density. We can see that it really can vary based on the concentrations that are used in
для добавления
various
гелиокса
combinations.
реально становится
So
очень легким. Поэтому
also in the fact
физиологические
that can be
эффекты
produced on the
подогретого
lungs.
гелия прежде всего
We can see that as
именно
for
физические
heated
свойства.
helium,
В
it's
случае
also
высокого
very much
кислорода
dependent
начать
on
определенные
the
маневры, потому что улучшается
properties of
поток
helium itself,
хелиума
and
следующего
also the
хранилища
way
подогрева
it
внутри газовой
can,
смеси. За счет
I mean,
легкой газовой
affect
смеси снижается
membrane
температура
penetrations,
гелиокса,
etc.
уменьшается
We also might have a
сопротивление
certain
кратных
experience
кофеинов, соответственно,
working
газовая
with
смесь
respiratory
подогревается
diseases and so on and so
и
forth.
будет становиться
We
гораздо
can
легче.
see
Ну и,
that
безусловно,
patients
скорость
might
выделения
really
лекарств
get rid of
тоже
some
влияет
respiratory
на
diseases based
вязкость лекарственного смеси.
on the problems that we might have. So
На
these
этом
are
слайде
some of the
можно
effects. On
видеть
this slide, we can
интересную
also see quite an
картинку,
interesting
как происходит
picture.
нагрев
We can see how actually
различного рода
the
тканей,
heating procedure is taking place
Первая
within the soft tissues of the human body.
картинка
we can see the upper picture and how it is analyzed by thermal sensor. We can see, I mean, ordinary oxygen and also heli oxygen, and we can see that there is a certain cooling effect on the tissues. Why? Because there is a um, I mean, a very interesting impact. We also have to analyze some of the most important reference points. For example, I mean, 25 degrees is a very important benchmarks, and there is an impact that is produced during inhalation, where we have the use of heliox, and where we use the temperature of 60 degrees. So when we look at this, we can see the difference that is produced by the combination of helium and oxygen, something that is, I mean, done with the help of helium and oxygen as for the field of expertise, and where they can actually be used. Of course, they can be used different lung treatment procedures, for example, obstruction of different respiratory tracts, etc. It can be used for asthma, for pneumonia, etc. I mean, it can be treated to can be used to treat this kind of diseases, and it has already been used also in COVID times, and it turned out to be quite an efficient approach. We saw that so the recovery process was quite efficient, and also very interesting that helium can be also used in some dementia, for example, cardiovascular dementia, etc. It can really produce a very positive effect. It can be used as a prevention of ischemic diseases, different heart attacks, etc. We talk about, for example, I mean, ischemic disease, and so on and so forth. It can really boost oxygen transportation and improve tissue diffusion and many other things. As for urology, quite unexpectedly, what we received very interesting results. For example, when we talked about ischemic diseases of the pelvic floor, and right now, together with the colleagues, we are developing a number of different articles about these particular issues, and it's really interesting, you know. And sport, of course, that was quite studied, and heliox has been used there for quite a while. It's a very important component for the recovery process. It's used in the hockey industry, and I mean, sportsmen, for example, they use the helium in order to improve the transportation of oxygen to their tissues, and we can see that it is 6 times more efficient than some additional approaches. And so we also should say that that is really good for recovery process in general, which is, I mean, something that is particularly crucial for sportsmen. Speaking about, I mean, legislative basis and the way it is actually regulated, we can see that starting from 1972, it was registered as one of the official drugs. We developed all the necessary drugs. I mean, for example, here they were given um, as I mean, and for example, we can see helix 21, helium 79%, oxygen 21%, medicine gas, etc. complex. They can be used for different, I mean, approaches and usages within Russia. As for helix 30, well, it needs to be studied more carefully. It can be used for pneumonias and other cases. Um, we see that certain studies uh, uh, have been conducted in order to substantiate different approaches to this issue. For example, we have a number of studies that have been conducted, and probably they will be used in the near future, just to really, I mean, improve the efficiency of this or that methods. Here we can see some of the devices that can be used also for together with Heliox. For example, there's something that was used back in 2000. For example, ITP Xenon, one of the major devices. They are based on two different methods. We can see AMTH and KTK01. They are different devices, but they are used for developing all those gas admixtures and also combinations, which are really important for our procedure. And also Xenon 1, you can see that this is one of the major approaches to the absorption of CO2, and in this block you can see it might account for a more prolonged effect, 20 or 30 minutes if necessary. And of course the patient they might feel much more comfortable, and so they can decide on the right concentration and so on and so forth. We also have on this slide Mobilis device, which is nowadays one of the automated stations for the use of Xenon. And actually medical specialists, they don't have to take part in all those procedures related to those provision of the services. We can see inert gas, medical that is used for that matter. No, well, we understand that there should be a certain experience behind the use of these devices, and of course we are something we are focused on right now. And also a very interesting case right now that is called inert gas medical, also used as one of the products produced by Mobilex. Now it's in the process of registration. And Xenonium, another product that is now in the stage of prototyping and certification, and another device that could allow our doctors to work with different parameters, to work with different concentration, and so xenon and oxygen, and it's also, allow the doctors to work with different medical procedures. As for helium therapy, we can see that there are three major devices. Three major devices starting from 2000. Like I said, Ingolite and Ingolite B201. Also, they can be used for different combinations where we can use different concentrations of oxygen and helium, and also Heliox. It works with the different regimes and modes where we can see different mixtures of oxygen and helium. So far, it hasn't been registered as a medical device, but the use of this equipment could be of great benefit for our patients. And also breathe lights, inert gas medical. This is quite a modern version of Engolite device. We could use it specifically for the helium-based therapy. We can use the different temperature settings, sensors, and so on and so forth. They can be used for various medical procedures for the patients, and it has already been turned out to be quite a success and quite an efficient stuff, and it should be implemented. We are almost done with certification, and we will be almost done very soon with all those issues. I hope that we will be able soon to work with these technology colleagues. So thank you very much for your for your attention, and I'm always open for discussion And so we'll be able to continue our discussion later on, not in the form of this official discussion, but thank you very much for your attention. Yes, and I will be able to cover all those issues very soon. Our Congress continues, and now I would like to give the floor to our next speaker.
С темой
And
эффективности озонотерапии при метаболическом синдроме.
there, our next speaker will be talking about ozone therapy as a part of therapeutical effect. Just a couple of seconds, and our speaker will join us very, very soon.
Уважаемые коллеги, позвольте представить Клавдию Николаевну Конточикову, профессора Приволжского исследовательского медицинского университета. Пожалуйста, вам слово.
Глубоко уважаемые коллеги, сегодняшняя наша лекция посвящена метаболическому эффективности озонотерапии при метаболическом синдроме. Прежде всего, что такое метаболический синдром? Согласно рекомендациям Международной федерации диабета, Международного общества по атеросклерозу, Международного общества по изучению ожирения, метаболический синдром – это комплекс метаболических, гормональных и клинических нарушений, в основе которых лежит инсулинорезистентность и компенсаторная гиперинсулинемия. Эта патология очень распространена в мире, и по данным ВОЗ только в Европе насчитывается от 40 до 60
By WHO data, we can see that there are 40 to 60 persons who have metabolic syndrome, and the reasons of this syndrome are, first of all, genetic defects in receptors and post-receptoral glucose metabolism. And this is also android overweight. Of course, this is modern hyperdynamic way of life, stress, wrong dietary habits, and this makes stress upon the nervous system. And what are the criteria of metabolic syndrome? In accordance with the International Federation of Diabetes, so this is more than 94 centimeters and women more than 80 centimeters. And this is not the only criteria. There must be additional criteria. For example, where triglycerides are more than 1.7 mmol, or for example, the lipid level. And for women and men, these are different figures. The low one is for women, the upper is for men. And the also hypertension, like the pressure above 130 by 80, or the diabetes of second type, where metabolic syndrome is elicited. Then these are the main providers
патологии, как сахарный диабет
for
и
such pathology
сердечно-сосудистые
as
заболевания.
diabetes and
Но нужно сказать, что
the
в клинической
heart
стадии
diseases.
ассоциированные с
And
метаболическим синдромом функциональные
then
и химические
the
изменения
functional and
являются еще обратимыми.
biochemical
И при
changes
соответствующем лечении
then
возможно
can be
исчезновение
reversible, and
или
when
уменьшение
there is
выраженности
certain
его основных
treatment,
проявлений, и, значит, таким
then the
образом
expression of
профилактика
its
развития
main
сахарного диабета
expressions,
и ряда
then
сердечно-сосудистых
there is a
заболеваний,
development of
особенно тех, которые сопровождаются
COVID syndrome,
нарушением
and
липидного обмена. Необходимо отметить, что именно
then there might
метаболический
be
синдром
lipid
сопровождается
exchange
различными
violations, and
дислепидемиями, то есть нарушениями
then there could be
баланса холестерина,
dyslipidec
триглицеридов, фракций
changes when
холестерина.
there is a
И,
balance,
в общем-то,
disbalance of
это все такой
cholesterol, and
играет гетерогенный
um,
потенциал и
then
усугубляет
it has
течение
this heterogenic
сердечно-сосудистых заболеваний.
potential, and
Для
also
коррекции
might worsen
метаболических
heart
нарушений,
diseases.
конечно,
For correcting
используются различные
metabolic
стандартные терапии,
violations,
направленные на
different
снижение
standard
уровня глюкозы,
therapy
на
can be
поддержание
used,
артериального
and in
давления, на
addition to
коррекцию
this,
липидного
there should be
обмена.
supplementary
Но интерес
technologies such
представляет,
as
конечно, и
ozone
дополнительные
therapy,
технологии,
and of
и в
course
том числе и
additional techniques
озонотерапия,
are interesting as
которые,
well,
для которой выявлены
including
различные очень интересные механизмы
ozone therapy
эффективности, в
that
том
has
числе и
different
такие
very
как
interesting
противовоспалительный
efficiency
эффект,
mechanisms,
активация
for example,
кислородонезависимых реакций,
anti-inflammatory
иммуномодулирующий
effects
эффект,
and immune
влияние на
modulation
свертывающую систему,
responses,
детоксифицирующий эффект. Все, в
the
общем-то,
impact upon blood
для этой
coagulation.
патологии, конечно, все
And
очень
for
должно быть
this
эффективно.
pathology,
И при этом
this should
необходимо,
be
конечно,
effective.
если мы
And
начинаем предлагать использование
if
озонотерапии,
we
конечно,
start
необходимым является сравнительная
proposing
оценка
the use of
данных
this
подходов
therapy,
лечения, стандартного
we
лечения,
should
обычного
use a
принятого, и
standardized
озонотерапии.
treatment
И,
and
конечно, контроль
ozone therapy,
эффективности. И, в общем-то, это вот как
and
раз
the
и явилось
efficiency
целью
control.
представленного мной исследования.
And then
Данная работа выполнялась
this
на
is
базе кафедры клинической лабораторной
this
диагностики
work was
приверженческого
fulfilled
медицинского университета,
on the basis
заведующей
of the
кафедрой
chair of
вас, Ольга,
clinical
является.
diagnostics.
Это городская клиническая больница номер 5, откуда были пациенты,
Then
которым проводилось стандартное лечение, и медицинский центр озонотерапии, где пациенты проходили монотерапию озоном. Основная группа, то есть те лица, которые проходили
and the persons who had ozone
человек в
therapy,
возрасте от 45
these were
до
60
лет
persons
с
with
метаболическим
metabolic
синдромом.
syndrome
Группа
and the age
сравнения – это
56
пациенты,
to
которые находились на лечении в
11
пятой
years old,
больнице.
and there was a
46
comparative group,
человек
a
тоже
control
такого
group,
же возраста. И
46
контрольную группу
persons with the
составили
same
30
age,
практически здоровых
and the control group
человек, у которых
30
были сопоставимы
healthy
по возрасту
persons
пояс
that
пациентов.
were comparable in
Химические
terms of
исследования,
age and
поскольку это
gender
метаболический
with the
синдром,
patients.
понятно, что нас
Biochemical
интересовали как раз
analysis
эти
was
метаболические показатели
conducted, and
различные.
these
И рутинные,
metabolic
стандартные, и более
indicators that were
сложные,
different,
которые мы
and
могли выполнить. Химические
also
анализы проводились до и после
chemical
курса лечения.
analysis
Проводилось
were
исследование,
conducted
естественно,
before and after
триглицеридов,
the
глюкозы,
treatment course,
общего холестерина, фракции холестерина, это или протеидов низкой
and
плотности,
the
высокой
different
плотности,
cholesterol
карбогидратов,
fractions,
которые входят в состав липопротеидов атерогенных очень низкой плотности, низкой
where
жирности.
we talk about
АБА, которые входят в
the
состав
hyperproteins and
атерогенного
therapeutic
липопротеида, выделяли С-реактивный
proteins,
белок методом
and where we
ультрафиолетового
determined C-reactive
исследования.
protein.
Конечно, мы исследовали параметры свободно-радикального окисления,
Of course, we
оксидации
also
белка,
studied the parameters of free radical oxidation,
оксида азота и
and
фагоцитогенная активность
uh,
клеток, активность
also the
антиоксидантов
activity
концентрация
of
оксидантов,
antioxidant ferments
особенности
such as
антиоксидантов.
superoxidismutase,
Курс
and
озонотерапии состоял из 6 процедур.
then the course of
Проводили
ozone therapy
внедрение
consisted of
инструментов
6 procedures
ультрафиолета,
that were conducted
ультрафиолета, поддерживая
um,
постоянную концентрацию
day after day by the method of
озонооксидантов.
three
Внутривенное
three
введение
needles, sorry,
ультрафиолетово-изомерной
and
терапии
included
позволило
the
снижение
intravenous
проводимой
introduction of 200 milliliters
растворе концентрации.
of ozonated physiological solution.
Что мы получили в результате
And what have we
сравнительного
obtained
анализа
as a
в группе?
result of this comparative
Во-первых, сначала
analysis
нужно исследовать
in the
пациентов,
group? First of all, when we started these patients, what kind of metabolic changes do we see? So, HOMA index is like an index of insulin resistance. So in the group of comparison, this is 5.19. So this was interesting why such groups are used. And there are also triglycerides and cholesterol was lower. And the patients who have the diagnosis and they are taking the medical therapy, and here are the persons who are in Ozone therapy group. That is why the indicators are higher. And the more interesting it is to compare these groups. So what did the lipid range demonstrate in the people who we studied? There was an increase of the overall cholesterol in 77% of patients in comparison with 25% of the recommended level. Terogenic effects were found statistically significant in 79%, and it was different in healthy persons. And also, when we looked at the anti-terogenic effect lipids, that was 1.8 times decreased in comparison with healthy people. So when we study, for example, the ratio of atherogenic and terogenic factors, in these patients it was 5.7. So this proves the violation in lipid exchange, and the level of thyroid hormone was increased by 53% and even 3 times increased in comparison with healthy persons. And then upper B, these proteins which are atherogenic protein of low density, and it is increased in more than twice. And then this was not different from the norm, but lately in all recommendations with atherosclerosis and the heart systems, great attention was for determining this protein level, and we see that our patients have doubled. So when we looked at triglycerin and the overall cholesterol, then there is very high risk of cardiological complications. The concentration of glucose was increased in 2. And this was also interesting because hypoglycemia then can help the aggregation of different proteins, including upper B and B and upper A. And if we look at glycated and saturated lipids, lipoproteins saturated with lipids, it then is connected to phagocyte cells work, and then we look at free radical responses, reactions, and in blood plasma we determined the free radical oxidation by these 2 indicators. So this was maximal in erythrocytes. And in comparison with the healthy one, this was the set value, and it was statistically significant. These 2 indicators are characteristic, they were decreased. And so these are the original data. And the activation of free radical responses in blood then was compensated while those antioxidant protection. And this is in case of patients with metabolic syndrome. We see that this activity was decreasing, and catalase was decreased, but these 2 ferments were increased, and then catalase activated in case of free radical oxidation. And then there is this oxidation of lipids. The process started, And then these ferments were activated. And of course, where the indicator of lipoperoxidation increases, and free radical oxidation is also expressed in nitrate oxide. Not everyone knows about this because NO appears in our blood when nitrates are used. And for cardiological patients, this is a powerful factor, and there might be macrophagal origin of this NO, and the macrophagal is connected to inflammatory processes. And we see that our patients with metabolic syndrome, in 80%, the nitrogen oxide was increased. In 20%, this was decreased, like 12.8 in comparison with 21. And all of this was confirmed, and this says that it has an active phagocytic process. So this is connected to correlation between them. And in the main group, we had ozone therapy, and the patients compared and obtained standard therapy for the normal levels of lipids. And so we have to compare groups, and the most expressed differences in the change of indicators were only for glucose. When a special sugar decrease in medicines were used, the level of glucose was decreased by 21%, and in the main group only by 5%. We see that on monotherapy, glucose cannot decrease too much. And in 3 weeks after the beginning of treatment, the indicators decreased, and then the level of the overall cholesterol decreased. This might reach norm, and then increase in, of entire tergen activities increases by 5%, and so heterogenic properties decrease. In the main group, it was in 62.
После проведенного курса монотерапии озона в среднем по всей группе больных имело место снижение вот этого основного белка, о котором мы уже с вами говорили, АПБ, на 8%. И величины отношения антиатерогенных к атерогенным.
So we can see the analysis of antigens that we use and the plasma, which actually proves to be quite a successful effect for immunotherapies. If we talk about S reactive protein, we can see that there was quite a reduction, and that was actually diminished from 3.3 milligrams to 2.7 milligrams. And it was actually prescribed for all those patients with these kind of diseases. Speaking about radical oxidation, we saw there was quite an impact on the number of erythrocytes produced. Let's take a look at the schedule. Here we can see quite a tendency. We can see some statistics, indicators of TG -2 of the groups, and as for plasma and erythrocytes, we can see that the indicators of peroxidation, for example, of the initial natures, they are not quite significant, but at the same time, as for the shift indicators, we can see that there was quite a difference. For example, the number of lipids that were identified within the membrane. This is in plasma, and also in erythrocytes, we can also state that. So we can see a certain reduction, for example, regarding the primary products. And we can see that was the case for ozone therapy and immune therapy. And as for the standard therapy, there was a slight increase, which is quite an interesting factor. And we can see that there are some processes taking place within the membrane as for the proteins and the way it actually interacts with this kind of components. Yes, as for ozone therapy, there was some statistic reductions because proteins are the first to get rid of our, I mean, products. They can also be oxidized, and we can see that during immune phenotypes they can be really recovered. And now speaking about
И в
uh,
группе сравнения
I
нельзя
mean, some
исключать
other
синтезу
enzymes, for example,
Potapov. То есть
SOD
активность
that was
ферментов,
mentioned
она
specifically
повышалась
when, I mean,
стандартной
it was about I mean, OD and different
касаясь
uh,
оксида азота, то это тоже
procedures
действительно
that
так.
were
У тех пациентов, у
exposed
которых
to
повышен
um,
синтезис, то есть
that
такой
kind of
эффект
components. So we can see that after monotherapy, with the help of therapy, we could
послушен, он
see quite
повысился
a
немного. То есть
reduction
это
of
как раз
the
говорит о том, что
nitrogen oxides.
эндотелиальный фермент
We
гомеостаза
also
начинает вырабатывать
saw some
оксиданты.
changes in
То есть это
dilateral
тоже нормально. И
enzyme
показатели
that
активности кортиков
initially
тоже это
was quite
подтверждают,
normal, but then it
включая
was
и
a little bit lower,
И в заключение
judging
должна сделать
on, I mean, depending on the situation that we have in each particular case. So here we can see some metabological syndromes related to certain groups of ozones used for the therapy, and also a lot dependent on the standard therapy that was used. We can see quite a standard number of lipids used for different matters. We need also to bear in mind different components. We also need to think about more about antioxidant systems of the organs, I mean, of the body in general, just to understand what could be the most efficient way to
Благодарим вас,
treat a
Владимир
certain
Николаевич, за
disease.
очень
So
поучительный доклад.
just wait a little bit. So thank you very much
Сейчас
for your
переходим к следующему
report. And
докладу
now we're
от
about to
профессора
proceed to
Полкового
our
инфекционного вирусолога.
next
Доклад
report
готовится
and next presentation, and we'll about to give the floor to Anastasia Khatkevich. Please stay with us.
Уважаемые коллеги, наш
Dear
конгресс
colleagues,
продолжается.
our
Я
Congress
приветствую вас
is
на
continuing, and I would like to share
докладе
experiences to actually
это
where we used
homeostasis.
carbon gases in different domains. What about different usages that can be used, especially when we talk about carboxytherapy and ozone therapy? Yes, they could be used in different areas. We can see some major areas as to how they can be used. They can be used for arthrosis, arthritis, in some neurological you know, measures. It could be used for gynecology matters, rheumatology matter, and angiology, diabetes stuff. It could also be used for that matter. It could also used for sports um, help and I mean psoriasis, alopecia, DH, cellulitis, stretches and stretch marks, and so on and so forth. According to the official statistics, I mean, of the World Health Organization, and also, I mean, data provided by the Russian Federation, it could also be used for motor locomotive uh, structures. Uh, and it is particularly related to all those statistics that tell us that the statistics is quite considerable. I mean, 80% of percent of population, they are suffering from this kind of diseases. Let's take a look at skeletal and muscle pains. We can see that a lot of patients suffering from these diseases, they have certain pathogenesis, and of course, pain localization might vary depending on the disease that they are suffering from, but it is actually applied to young patients as well as adult patients and also aged ones. We need to understand that probably all those, approaches could be used in different cases. I think that actually we all suffered from pain syndromes. What about the main reasons when we have all those contractions and some pain muscles? It's more about reflex contractions during pathologies of the cerebrum, and also it could be related to the reflex. Um, con- tension during different diseases of the internal organ, and also there could be a reason, of a different kind, for example, located to within, just within the locomotive uh, status. We understand that, for example, we have situations where, patients sometimes come over, they bring about, for example, difluvidenac, but at the same time, they do not fully comply with the prescription that is given for this kind of depressants. But we have to fully comply with all the instructions that are given when we talk about the use of such kind of drugs. And yes, it has been quite often a case in many situations. Myofascial pain syndrome, it could also be one of the most widespread um, uh, side effects of improper use of the approaches that we used. Here we have to take into consideration different trigger points that could be, formed in muscles, fascias, and also now we can say that myofascial syndromes can be formed in any muscles, and so they could lead to certain pains in different parts of the body. So here you can see that it can lead to aging, to loss of hairs, and so on and so forth. What about the trigger points? They are local zones with a high level of sensitivity, and during palpations, it can be really can be sensed, and we can say that it can be detected within a given location. We also understand that there should be some trigger points or some uh, affections that can lead to this kind of sensitivity to this or that reaction. We can see here quite a high tension, and some certain tension also can be detected within muscle tissues. During palpations, we can hear different formations, and so they might be really painful. And so when we work with perivertebral injections, we should affect these trigger points, and we need to destroy them, and then this syndrome will disappear. What about medical gases? Carboxyltherapy. This is a subcutaneous injection of CO2. It can be done with an angle of 45 degrees and also 90 angles, degrees angles. It can be done within this area, within the neck, and also within the shoulder area. It can be done there, and injections could actually lead to very good effects from the therapy.
озона или углекислого газа происходит гиперемия выделения кровяной росы и практически сразу расслабление мышц.
And almost immediately there is muscular relaxation. So we then see unpleasant phenomena for a while. Then there is warmth in this area where we injected. And unpleasant sensations from the procedure are forgotten. I'd like to say that when dioxide is used, carbon dioxide, then there can be a phenomenon for like 1 hour. And in ozone, this can remain in the area and give extra unpleasant sensations. And the properties of carbon dioxide are described here. And then the anti-inflammatory action.
Вазодилатирующее действие, здесь зависит от дозировочек введения, антибактериальное действие, антиоксидантное действие, интенсивность.
We look at the antioxidant, antibacterial impact, and also neoangiogenesis is improved. We can use ozone, and if a patient has root syndrome, in the case if there is hernia in intravertebral disc, then there is enema and inflammation that lead. There is deep use of ozone in order to recuperate the inflammation.
Более эффективно, чем при
And this can be more effective than the regular approach. And in our lab, we use a thermographer for determining the temperature grade when we use gases. Here is a patient. You can see this expressed vessel syndrome in the chest and in the left spatula and in the neck area. And this after 50 minutes of carboxytherapy, and immediately the pain syndrome is decreased. There are less tense muscles. And the patient with psychosomatics You can see this whole breast area and the stomach are overtense. There's increased temperature. And after 10 minutes of carboxytherapy and corresponding injections at neck tomography, we can see different color, including the stomach area. And here is expressed psychosomatics. Here we see trigger areas. And there is this complex treatment with the use of physiotherapy. Maybe working with a psychotherapist for 8 days, and we saw a good result. And the patient also with root syndrome, we see that she has facile syndrome, and it goes into the right leg also. And in this case, it is better to use ozone, for example, for radicular syndrome also. And we can also use medical gases. And the patients who had oncological diseases, then medical gases as carboxytherapy and ozone therapy. We see that it doesn't have any stimulative impact. And patients who had already electric treatment had 6 to 10 procedures and also ultrasound. And then you can use medical gases for the full alleviation of pain syndrome. And if you look at this metallic construction impact, then this might lead to heating. So here's a vertebroplastic. And here was a combination of massage and the SMT approach, and the use of gases, and there was no without harm to metallic structures, and extra overly stimulation of the heart in terms of trigger points and tense muscles. This is rehabilitation after endoprosthesis. This is the third week after endoprosthesis, and pain syndrome is preserved. There was also laser treatment with a positive effect. But when we also used carboxytherapy in combo with plasma therapy, immediately the pain syndrome was relieved. Patients with osteoporosis and the impact of massage is categorically forbidden. For example, if we look at tense muscles, so the use of the ozone to overcome this situation. And there should be diabetic polyneuropathy. And this should be like doctors and endocrinologists who are treating it. And then the neurologists are switching in. And then there is a positive dynamics. Then at present there should be an, not should be, but happens an increase of diabetes patients in their number. where there is a low immune resistivity and macro and micro angiopathy and overweight of any type, anemia of any origin, alimentary dystrophy.
Наиболее частое
Most common chronic complication in case of diabetes is polyneuropathy because of metabolic violations and changes in vessels that are bringing blood into the nerves. There is demyelinization, atrophy and degeneration of axons, atrophy of neurons in the frontal areas and in intervertebral areas. So the syndromes, the feeling like needle sensation as if needles are inserted into the body, the numbness in the extremities, the shaking from cold, and the violation in the moisture levels, the dryness of all extremities, increased moisture in the soles of feet, and the loss of balance, pathological changes in the joints. And the patients with diabetes, of course, there is this basic therapy that where we join different psychotherapeutic methodologies in order to improve the sensations and laser therapy, ozone therapy, and carboxytherapy. This is a 56-year-old patient with diabetes. And this is after the cutting off, the amputation of the phalanges. And you see the surface is a wet wound with this superficial infection and pus. The foot, the sole of the foot, doesn't have a pain sensation, it lost it. And after the use of 3 or 4 procedures, the patient started feeling the injections. There is this kind of dryness of the wound surface, and there is a process of regeneration. Then jointly with basis therapy, together with the ointment, this is the erosion of the finger. So there is, for example, the pain in the finger, in this area, diabetic sole of the foot. Such patients are very heavy because there is this secondary pathology change and microangiopathy, the change in pigmentation of the skin, the loss of sensitivity in this situation. Here are 2 months of the healing for this toe. And it's good to use a combination of ozonation with the physiological solution. And there should be like 6 to 10 procedures with 20 milligrams per liter concentration. Or, for example, pussy wounds. And also you can have carboxytherapy. And what kind of the use of psychotherapeutic methods increases the chances of a patient for a quicker healing, and the use of medical gases such as carbon dioxide and ozone in skeletal and muscular diseases alleviation, diabetic polyneuropathy. Thank you so much, Mrs. Anastasia Khatkevich, for such demonstrative materials, and we are going to talk about ozone therapy in spa. This is a highly interesting topic, and we have a few seconds just to upload the presentation.
С большим удовольствием передаем слово
Oh, it's my great pleasure to give the floor to one of the uh,
Татьяне
uh,
Александровне Клейм.
dentist, claimant Tatiana Alexandrovna. Yes, good afternoon. Yes, as for ozone therapy, it's a very important issue, and uh, of course, we need to work on substantiative basis. Uh, I mean, just to analyze some of the points that are used within ozonotherapy and ASP and wellness. Of course, so we used different approaches to that matter, and previously,
So if before spas were associated with
of course, we
relaxation
initially
and
initiated with some
pleasure,
massages and some
then with candles and
relaxation processes.
spas, but now
But
there is a
now this
big and
is
serious industry
quite a huge industry.
where this industry is becoming purely medical, with medical licenses. And then this spas turned out to be more lively. And the modern spas, this is a whole complex of technologies in recreation health, the energy of a person have an impact upon all the six senses. This is impact upon vision, different light phenomena, color phenomena and expositions, impact upon audition, hearing senses involved. And also the impact by the sense of olfactory, smell, this aromatherapy, and also sense of touch. And it's impact upon limbic system. And in spa, the organic cuisine is used, individual food programs, where there is this enormous industry of beauty and wellness, and the improvement of how a person feels. And in the slide, you can see all of these spas and now standard perceptions. And if you look at the Wikipedia, SPA is a physiotherapy method connected to water treatment, where we use the thalassotherapy, where sea climate is used, and also the use of heated sheets. And all of this is in the notion of spa. And here you can see a modern spa that includes not only the relaxation area, but also a clinical zone with clinical diagnostics. And then a better notion is wellness. This is like feeling well, sense of well-being, and this is related to the concept of healthy lifestyle. This concept is founded on a combo of physical and mental health, health food, and reasonable physical loads, and good dietary habits, and association with wellness. Here, I'd like to describe the analogy, including in Soviet medicine. This is like for those who are completing Soviet schools. And so wellness, these are three main notions. And the purpose is achieving physical condition and including fitness, different physical exercises. So this is a normal position where a person dedicates a lot of time and attention to the physical activity and physical exercises. And this is also social activity that includes adequate response for stress and social activity for the events that are happening. And this activity is with the accent upon getting healthy. So this is individual selection, and also this is the use of food products and also the renewal of tissues taken into account the food, and also there should be individual dietary modes. The quality should include also high quality services and satisfies personal goals for good cause of a person. And then also the main objective of wellness as process is wider notion, including spa. This is to prevent prevention. And also prevention of diseases, where it says that prevention is primary, where we use phytobars, and people went there and getting healthier. Wellness industry and we are coming back to the fact that the new is well-known old wisdom, and there is a need that people have to improve their health. So I discuss it with medical doctors who have standard practices.
отрасль, и на сегодняшний день там присутствует огромный класс специалистов.
And there is a big cluster of specialists.
Будем говорить, признание своих профессиональных качеств, и эта отрасль
So they should develop their professional qualities.
Она на сегодняшний день включает комплексную диагностику, она включает различные физические нагрузки и фитнес.
There are different physical loads and fitness.
Это спа-центры, спа-отели, релаксационные центры.
It includes relaxation centers,
массажные, да, бальнеотерапия, альготерапия,
balneotherapy,
гидротерапия,
thalassoterapy.
В wellness-индустрию.
This is included into wellness industry.
Медицина. И главным постулатом, наверное, одним из, будем говорить,
And maybe the main idea,
конечно, профилактика старения и различные способы.
and this is also prevention of aging.
Сразу договоримся, что дальше я буду говорить о врачах этой индустрии, назовем их специалист, анти-эйджинг специалист, несмотря на то, что это специалисты разной специализации.
So this is for specialists of different specializations.
Диетами, это отказ от вредных привычек и позитивное отношение к себе и окружающим, достижение согласия с миром и самим собой.
That's where you need to reach agreement with yourself and with the world.
Самопознание, различные практики медитации, что сегодня сейчас уже есть и даже в мобильных приложениях, все это присутствует. Знаете, что все это wellness-индустрия.
So you know that all of this is wellness industry, and we should not forget this. And I can say that when we are talking about ozone therapy, and I have been doing it since 2006, before this practice was only as alternative medicine, and the first persons who started paying close attention to it originally were the medical doctors who worked in spas. And we know that impressions are important now, including the clients and the users. They want to use the whole complex of services, and this is like during a short period of time. And so everyone really values the higher standards of service, and spa centers are different in this sense. They are different from standards. And so this is what makes the eyes happy. And of course it has to be comfortable, because there is an individual approach and rather high quality personnel. And also the combination of price with quality is important. The client will not understand why he or she is paying such price. And so now I'm going to talk to the owners of the clinic, and this is a highly important factor. So we look at what the users do, and then the also package proposals that are going to include not only the patients but their families as well. And the portrait looks like this. But I do not want to visit standardized clinics, but to get enjoyment. Typically, these are socially active people, and they would like to build up a cluster of the users of wellness services. And these are persons who are ready to use these approaches. So in 2016, I was at the Congress of Spa and Wellness. And now this is like the age from 15 to 75. And this exists for children, where the users and all the programs exist for the users 70 plus. And these are people who are aimed at self-knowledge and self-improvement. So they are present in the mobile phones. And there can be like some meditation programs, relaxation music. And you have to just look into YouTube and get some therapy. And in 2016, so if we look at the algorithm of building programs, there were 4 or 5 specializations. And typically these were cosmetologists or they were dermatologists. And now we have 13 different specialties working with us and using these approaches. And so they use this gas therapy in wellness and spa treatment for after functional diagnostics. There is this big collaboration. This is for treatment center. This is for high demands of the user. We need to understand what type of specialist should be working in these conditions. Of course, there should be diagnostics and clinical experience. And different apparatus and methodologies. And so it's a professional communicator also who is studying and improving their professional level. And in terms of ozone therapy, of course, this is symbiosis and spa services. There are successful centers, health centers, and also Verba-Mayer, the city of Pushkin. So it doesn't matter if it's a wellness or spa. It is enough to just use this approach, where these principles were fulfilled. They're related to the treatment and recreation of patients. Ozone therapy in spa, we are talking about all methodologies that are here. So these are physiological solutions and also subcutaneous injections. And all of these methods are present in the programs of the global rejuvenation of the body. And these are global methodologies, and also the subcutaneous injection, where also we work with ears and the oral part. And we are not going to dwell on this because they are common, and of course there are specialists who are working with them. I'll give you only a few examples. where ozone therapy is present. Then they have these methods have a clinical improvement basis, and also it is evidence-based medicine in terms of the practical application of ozone therapy. We see different combos. It is mostly paravertebral. And further, we are paying attention to the overall use of ozone, and this is all combined with the methods that are present in spa. So these are different massages.
Different massages and many other
And
things.
what's
I should say
important
it,
is
in
that
this
in this
case,
case,
we talk about wellness
we can
approach.
say if we are talking
Of
about
course,
wellness
here
approach,
we need
so we
to
can
give
conquer
confidence of
the
the
trust of the
consumer,
consumer,
and
and then
really it is
the
regarded as
client is
something
perceived
absolutely important as one of
as
the
this
pivotal
great
points.
crystal about cup. And there is a shift from simple to the complex. And a lot of specialists are working with the same patients.
So we need to have a certain methodology in place and understand what kind of approaches we might have. Of course, zone therapy is something that is integral part of spa and wellness therapy. We have certain requirements considering the quality of the service provided, and also, I mean, the quality in general of the services that should be provided. Of course, it's all about, I mean, attentions, and there should be an individual approach to all the services provided. So, there should be a good proportion of I mean, the prices and the quality of the services provided, and of course, it could help us to really, I mean, improve the status of the services in general. Starting from this year, from 2022, there was a decree that was issued on the 5th of March, number 148, and ozone therapy was one of the services classified as climate therapies, which is really important. So I'm begging on you, please, we have quite a huge experience, and if you still have questions regarding all those questions, or if you want to get more information about substantial basis, you can find more about that. I just wanted to say that ozone therapy is a very integral part, an important part of our medical services, and it is an integral part of spa and wellness sector. We have already accumulated quite great experience there. Thank you very much for your attention. Thank you very much, Tatiana, for your experience that you shares, and also this insight in wellness and spa. Our congress continues, and now, according to the program, we are supposed to have a break, and 1:40 we will meet again. We will be talking about physiotherapy and so many other aspects, and Vasilia Kiryanovna will be there to make a presentation on that issue. Please, thank you very much. See you there.
Esteemed colleagues, let us start the second plenary session of the International Online Congress, Clinical and Environmental Aspects of Using Medical Gases. I'd like to present with great pleasure the next report, the relevance of using the technologies of the transformed AI environment in physiotherapy. And first there will be Mrs. Kiryana. She is president of the Physiotherapy Association.
Добрый день, коллеги.
Good afternoon, colleagues. After the great previous speeches, it is, of course, hard to speak because a lot of experts. As a physiotherapist, I'd like to say that the problem of using gases, we should look at it in a wider way. So I'd like to make a report for you today. At a certain time, Mr. Ulashik, a famous physiotherapist, doctor of medical scientist, said that today the possibility and level of physiotherapy are such that it should be considered not simply as a rapidly developing branch of medicine, but also as the nation's culture level indicator. Only an uneducated, unconscientious person can use or ascribe medicines which has side effects if in many cases you can use simpler methods. And I always dwell on what is physiotherapy, because not all medical doctors know special features of it. And Hippocrates said that real medicine is nature, which heals us, and other medicines are all just the servants of nature. And physis is a Greek word originally, it means nature. So this is the use with a view of prevention, treatment, and rehabilitation. So it is in case of preformed factors, for example, where there's electricity, magnetic fields, or light treatment. And so this is done due to different devices and apparatus. So, for example, magnetic field, this is an artificial factor. And natural factors, or for example, the air environment. And at present, all of the classification of physical factors, there will be 8 factors. And then the 7th position is taken by the air environment. And of course, the natural environment is the breathing of a person, which form the Earth's atmosphere. And mostly of nitrogen and oxygen, gases that are needed for normal existence on the Earth. And in connection to the applied factors, the artificially transformed air environment has its own applications. For example, aero ions and hydro-aero ions. We have been using them for a long time. Changed air pressure like barotherapy, abdominal decompression. And I defended a Ph.D. For example, on how to use this air pressure for treating osteochondrosis. And this is for improving microcirculation as well. And separately, as I repeat, the 6th position of medical gases. And a lot of gases are used. We haven't thought as physiotherapists how important it is to combine them. So, for example, this nitrogen and carbon dioxide or radon, noble gases. And I think that these treatments are important because gas mixes are used widely, not only in diagnostics, but also in prevention and in treatment. You know about inhalations, of course. And it is used in resort and spa treatment and combined treatments. and aerosols. So this is a dispersed system that consists of the gas environment and fine particles that are suspended. They are formed during the mechanical refining and dispersing of the firm bodies and liquids. And we know well that the smaller they are, then the deeper they attract us. And you need to consider the size of particles in aerosols. For example, in case when there are breakups, violations in the work of bronchial systems and alveoles. And it depends, the treatment depends on the particle size, so we have to calculate it. And also the advantages of aerosols. So then we look at the therapeutic effect. So the wide spectrums, the sterility, and the practical application. Well,
We also need to think about the price of different, drugs that we're using. I mean, using for different purposes, diagnosticals, reasons, and we need to think about various types of aerosols. Here we can see disinfection and so on and so forth, disinfection, desertivization, and so on and so forth. There are a lot of different issues, and here we can see, for example, about compressed air chambers. Yes, they are also used for different ways of treatment, and of course, they also used in case of different, the, I mean, problems with pressure, especially when it comes to oxygenization. And of course, here we need to talk more about, the positive effect that can be reached with the help of this approach. Well, if we talk about these procedures, um, uh, we need to ensure proper control over the state of the client. And this work was really monitored by some of the initiators. Those manu- actually monitoring the vessel dystonia, and we can see that this is quite a serious disease right now, and it has actually reached our very important attention. We understand that here we need to provide comprehensive therapy for all those people suffering from this kind of disease. We can see quite an increase in the state of mind, in memory, and also we have quite an improvement in blood pressure, etc. So I think that it can make us believe that this kind of approach could help us a lot in terms of treating all those diseases. It could help us with respiratory diseases, with cardiovascular disease, and so on and so forth. With rehabilitation of different diseases that were also um, part of the respiratory problems. So here we can say that Here we can state that yes, we need to focus more on prevention and to think about a different range of prevention measures that should be applied for physical and intellectual or operative, sustainable actions to maintain our physical and psycho-emotional state. We need to focus more about hyper set the stimulation of our achievements for different results. We also need to think more about our environmental impact and the environmental ambience in general, just to make sure that they are completely suitable for our most proper results. So here you can see information about in general about cardiovascular diseases and other states and so on and so forth. You can see this information. So we can see that by using different approaches, um, um, we could really achieve very good results. For example, here we can use the uh, some additional information regarding contradictions. Yes, when we talk about physiotherapy, yes, they are always of quite common nature, but here we can see that yes, they can lead them some infectional diseases and so on and so forth. What about this therapy? This is absolutely unique, and it is um, has direct impact on the drainage functions of our lungs, which is really important. We can see here that the uh, um, a production of the, for example, chloride and sodium. We can see some immunomodulating functions that are also triggered as part of this therapy. What about oxygen? It has been mentioned today. Yes, it was, it is said that it's used during all those diseases related to the cardiovascular diseases. And also, this is something that has no admixtures. We also need to talk about the so-called oxygen intense baths. All those procedures where you use potable water and different approaches with the help of oxygen, where we can achieve the maximum effect of this or that effect. And also we can use the physical and chemical saturation with the help of oxygen. We can see different concentrations here, 50 milligrams and 40 milligrams and so on and so forth. Yes, they can be used for the improvement of our lungs. And you can see some basic information, uh, where we can use different approaches, using solutions, different baths, different spa procedures, and so on and so forth. Here you can see how actually oxygen can impact our state, how it affect our status, our general state of cerebrum, etc. So we have to think about that, and we have been focused on that. So within a period of 20 years, we organized a number of workshops, and also we are gonna organize them. A workshop of physiotherapists. They will be participating in our common event, and we will be talking about all those effects that can be reached with the help of this kind of therapy. It could be done with the help of our approaches, which is really great. Especially when we talk about blood pressure, especially when we talk about common state, etc. Here we can also talk about some adjacent issues about, for example, um, I mean, concentration of oxygen in the bath, for example, the one that's supposed to reach the threshold of 30 or 40 milligrams, etc. But what about in your suggestions that should be put forward for the um, signing this ozone therapy? We can see that back in 1940, Mr. Ratz said that some small doses of ozone could really have a very good medical effect, and at the same time, if we exceed this certain thresholds, it could be also lead to some lethal outcome. We need to strike the right balance. I want to say that it's very important to bear in mind all the experience and indicators that have been um, um, accumulated with a certain period of time. We need to consider them in mind if we really wanted to really stay effective. We also worked in close cooperations with different experts, and also we used animals to test some of the procedures, etc. But for example, Alexander Gennadievich, uh, he also conducted a very interesting experience. He worked with diabetes. He worked a lot with microcirculation. We can see that it might really have a direct impact on the microcirculation, where we talk about some of the major components. They can affect the function of the body, and also they can have a direct impact of microcirculation. And we can understand that this kind of therapy should be carefully analyzed in order to also understand whether microcirculation could be of importance for different processes and functioning. So far, we can see, for example, all the studies that were conducted by Mr. Razumovsky, Kronikov, Radovskaya, and we can see that the main goal of this work was to analyze the field of experience as to how actually ozone therapy can be used to treat certain diseases, for example, those related to the skin problems. And we can see that here we analyzed quite a big number of different cases, for example, over 180 cases related to skin related problems, etc. And it turned out that ozone therapy can be really efficient. For example, if we talk about CO2 with, dioxide of carbon, that's the one that can be used in certain proportion from uh, 0.02 up to 0.4 percent. It could be used as one of the major instruments and medical instruments for treating certain diseases. Here we also have some information about biospheres, about photosynthesis, and also, ways that could be used for using different concentrations. We have to understand here again information about United Nations by special commissions working with the United Nations. We can see information about CO2, about deforestation, about different concentrations that should be used in the optimum way, specifically carbon dioxide and so on and so forth. Here we have various pieces of information, and they, of course, have to be beared in mind. Here we can see carbon dioxide and the way it is actually analyzed in various types of infrastructure. Here we can see some general information about exchange of oxygen and carbon dioxide. I mean, the way it is actually done within tissues.
Our agenda is finalized. We will try to distribute everything as we can take into consideration. Anything else you would like to add? So once again, congratulations. And I wish to congratulate you for the community that they will get to work on Monday. Somebody is going to work now, but they only once a year.
So we can work completely differently. Please pay attention that the carbon dioxide creates a stimulation of the mobility systems, and this can be used also for special baths, treatment baths. So then we managed to change this procedure, and there is this sensation that this bath is very effective. So this is carbon dioxide purely. So especially neurology, cosmetology.
Вера Васильевна, напоминаем про регламент, пожалуйста.
And there are traditional counteractions, and we use also gas for baths. And we can see the nitrogen baths, where there are increased concentrations. And here is a nitrogen as bubbles. And here the impact is weaker, especially the impact of these baths upon the body. And the methodology that is used, we see that there is a whole range of patients, and there are light counteractions, because we are dealing with the gas serum bath, and then we see the results where this is used. And we know that the ions of this gas normalize the bodily processes, and the use of hydrogen sulfide is very effective. And now we can see how the baths are useful. And these are the vertebra illnesses, spine diseases. And first of all, these hydrosulfide baths are indicated and recommended. Thank you very much to one of the speakers who talked about it. Mr. Peretyagin, maybe. And we need inhalations and physiotherapy. And I have seen here that this can be used in different directions. And here we can see inhalations and breathing. And this anti-inflammatory effect is very observable. So we see here that these illnesses are general. So a lot of and we see the results that are obtained. And here we see the effect of pure oxygen, and it is much more efficient when there is incoming of oxygen. It has positive impact upon the respiratory system. And of course, there are oxygen experts that can make input into this. One of the pioneers was Mr. Pavlov, and he said that in the future, argon and helium are going to be used actively. And also they have a very powerful impact of increasing sexual function. That is also important. It's both for women and men. And there are a lot of indications. Thank you so much for your attention. Dear Vera Vasilyevna, thank you so much. Unfortunately, we didn't have time for questions, and I'd like to give the floor to the next speaker, to Dr. Emilia Shah, who is the chairwoman of the Ozone Therapy Forum. And this is the prevention in ozone therapy during the pandemic conditions. You are very welcome. We need a few moments. So, of course, our esteemed speaker is taking part in India remotely, and our engineers are working on connecting you. Please be so kind and wait for a few moments. Okay, I'll switch to Russian language now in order to speak in Russian to the audience.
I cannot.
You may begin now.
Yeah, I cannot share my screen. Somebody else is sharing the screen. You have to allow me to share screen. Okay. Yes. Now I can. Now I can.
Okay, let us start. All right. So you can begin, Dr. Milishach.
Yes. Thank you very much, Professor Nazarov, for inviting me for this conference. It's on medical gases, and we've been working in ozone therapy for last 18 years. Thank you for your support, and we will be talking about ozone therapy in COVID-19, natural way to healing. We As we know, ozone therapy is been practiced in multiple nations, including Russia and India also. We have found that it is useful in multiple diseases like metabolic syndromes of diabetes, hypertension. In India, we use it a lot on pain management, on skin lesions, cancer, integrative therapy. But COVID-19 is one of the shock pandemic situation where we had to use ozone therapy. So I will quickly take you through the what is ozone and how is it working. So COVID-19 had a lot of hypoxic condition, and ozone always leads to oxygenation and oxidation. And this was a predominantly reason why we started using ozone therapy in pandemic situation. It is a mixture of pure ozone and pure oxygen, whereas that is medical gas, ozone and oxygen. Ozone therapy always results in oxygenation and oxidation. When you give ozone therapy in a normal body structure, you will always have ozone therapy metabolized as hydrogen peroxide, lipid peroxide, lipoproteins in cell membrane, and in hydroperoxide. So, in within a spectrum of few seconds, ozone will not be ozone in, as in gas molecule. It will be converted as to cell mediator chemical messengers, and that's how it works in your body. The main biological effects of ozone therapy that it maintains the cellular redox balance. That means it balances the pro-antioxidants with intracellular antioxidant defense mechanism. So this helps in improving or balancing your disease condition. At the same time, it is a very powerful germicide, immunologic modulator. It improves your immunity by modulating it. I think that is the best way to work on immunity. It metabolizes your toxins and it improves your metabolic rate. That is, more ATP will be generated. At the same time, it increases the oxygen metabolism. Now, why did we use ozone in COVID-19? As per WHO's guidelines, there was no fixed planned treatment protocol for the COVID-19 as it was a new genome, new virus where we did not have a planned session of what is protocol and how can we treat the COVID-19. So ozone therapy corrects hypoxia is by improving tissue oxygenation. So ozone improves lung and peripheral tissue oxygenation and exchange of gases because of peripheral vasodilatation, which is mediated by nitric oxide. Modulation of this enhances the glycolysis. Also, it also increases the ATP formation. This ATP, with the help of 2,3-DPG, increases the functioning of NAK membrane pump 2. So when you give ozone therapy, you can reduce the hypoxia to the cell and thus it improves your tissue oxygenation, which was very much required in COVID-19. As for COVID-19, they either had antibiotic or they had steroids or they had cytokine modulators. We needed something which gives oxygen at the same time modulates the cytokine. When you do ozone modulation helps with the NRF2 modulation. It normalizes the redox balance through the increase in antioxidants in cytoplasm, mitochondria, and finally plasma. Mainly glutathione peroxidase and glutathione reductase are generated, and this modulates the NRF2. COVID-19 required NRF2 modulation because you needed to work intracellularly, not only support oxygen as an oxygen inhalation. You needed a biooxidative therapy for addressing this problem. At the same time, ozone controls the pro-inflammatory cytokines. Interleukin 6, which was characterized as a cytokine storm for COVID-19 patients, pandemic patients, it required the toning down of cytokine generation. So ozone therapy used in a particular way would also help in in protective enzyme called like heat shock proteins of HSP60, HSP70, and HSP90. This modulates the nuclear factor beta, and that regulates the production of pro-inflammatory interleukins and inflammatory tissue. All these three effects were very much in coherence with how we can use ozone therapy for COVID-19. So this was the important aspect of why we used ozone therapy in pandemic situation. The patient with COVID-19 are prone to have mild and non-specific hepatitis. So liver was compromised, and that's what also led to multi-organ failure, and that's what led to lot of diseases occurrence of post-COVID area also. It ozone therapy regularizes or stabilizes the hepatic metabolism and fibrinogen. So ferritin levels and D-dimer and the LDH was reduced after ozone therapy. We have found it in our usual treatment protocol when we do it. Prothrombin plasma levels were also normalized up in the infected patients after ozone therapy. There is a lot of research internationally and in India which was done on COVID-19 with ozone therapy as a adjuvant complementary additional therapy along with standard of care. Ozone therapy in also improves the monocytes and lymphocytes production, and that releases the cytokines which are good for the body and which enhances your humoral and cell mediated immunity. Germicidal power of ozone, which we all know that ozone helps in controlling infection, working synergistically with antiviral, antibacterial, and antifungal medicines. So when you give ozone therapy, it will definitely work on reducing your infection with bacteria, virus, and fungi and parasites. So ozone is a very powerful germicidal agent, and also the property of this is used to treat infection like non-healing ulcers and like any other septic shock. So this improves your general well-being. There are many preclinical and clinical studies developed for ozone therapy, which already prove that it can work in a COVID-19 situation, which is the improvement in asthmatic patients, both in analytical test and respiratory function. So ozone therapy is already proven in asthma. So when you using ozone therapy for COVID-19, you know the knowledge that it is working on asthma, it is reducing interleukin 6, it is reducing the multiple sclerosis patients interleukin also. So in general, when you give ozone therapy, it has a by and large effect on betterment of the patient. So what did we use? Now, with the knowledge of ozone therapy working on different diseases with our 18 years of experience in India for treating, where we have published ozone therapy in tuberculosis, a paper. We have published ozone therapy as an integrated oncology. We had choice of different application. We also had lot of choice that whether we can do major auto chemotherapy, endovenous major auto, we can do saline, we can do rectal, minor auto. But what we chose to look or we chose to do for these patients, which were quick, effective, at the same time, it gave a fabulous result. So we used either ozonated saline, 200 to 300 ml, or we did rectal insufflation along with minor autohemotherapy. So this, the advantage of rectal saline was that it was very simple to do, very effective. It could do oxygenation of the peripheral tissue. It could improve the antioxidant status of the patient. At the same time, ozone therapy activated NRF2 pathway. It also had nitric oxide synthesis, so it had vasodilation. The circulation has enhanced and it has improved. So the advantage of saline were far more, and it was very easy to do it and easy to deliver in the ICU where the patients were admitted for COVID-19. The other application for ozone therapy we chose to do was minor autohemotherapy. So minor autohemotherapy was extremely low cost. So if you know, minor autohemotherapy is a disease antibody specific immunity you get with minor autoimmunotherapy. We consider in India like an auto vaccination for the patient. Whoever is taking will have their own blood re-injected, which leads to serum absorption, leads to plasma absorption, leads to virons which are disintegrated because of ozone, and thus it helps in general well-being. So ozone therapy will be very helpful in doing so. At the same
Да,
time, when you are doing uh, just so ozone therapy, when you do something like this, it will definitely work as it will help as improving your general well-being. So minor autohemotherapy was very important for maintaining the auto vaccination. At the same time, it had very cost-effective treatment. When we in India we had multiple patients of COVID-19, and where we needed to address this faster, at the same time we needed to give a better result in it. The next application which we looked into was ozonated water drinking, which would help patients to have gut environment improved, and at the same time it could reduce the chances of viral replication with ozonated water. So we use that also for the patients. And rectal insufflation, which is by and large known for liver synthesis, it improves your liver conditions. At the same time, rectal insufflation will help the kidney failure, will help the circulation, will help also help in the handling the proper generation of the chemical messengers, and thus it improves your general well-being. Uh, so we started using these mainly salines, rectal and minor auto as a treatment for COVID-19 in India, in choice in few hospitals which were ready to do this work. The main work also we did was in a immunity prophylaxis. Immunity prophylaxis means that we can improve people's immunity towards COVID-19. This was done by giving minor auto 8 sessions, and it was also given by correcting vitamin status of the patient, which was vitamin D3 and vitamin B12. If you do the combination of all three, that is minor auto chemotherapy 8 times, uh, 2 times vitamin D and vitamin B12 injections, that would give you necessary immunity towards COVID-19. This was done to 320 employees of our own hospital, where we needed to improve their immunity as they were working in a lockdown situation where nothing was allowed and they were working for their company, for their hospital. This had a beautiful result generated, that is immunity building with ozone therapy. We treated 320 employees of Bisleri company, and out of which only 7 contracted COVID-19 infection. Now, these 7 patients were also asymptomatic and completely free from any complications. They recovered beautifully and faster. So this showed that the incidence of COVID-19 in the patients who were treated with ozone therapy was only 2.19, as against the incidences during that time in India was 15%. So where the 15% chances of getting infection was predominant, these patients who were working outside in the field of open field where they would contract a lot of people, meet a lot of people, we improve the immunity. So that's how we improve the immunity for these employees for 320 employees. And this paper is published in European Journal of Biomedical and Pharmacological Sciences. This will be published online soon by 30th November. It should be online, but we have got the acceptance letter for this. We also did CTRI, that is Clinical Trial Registry of India trials for ozone therapy. started two CTRI trials. One was the COVID-19, one was for mild to moderate patients whose COVID, where we gave rectal insufflation and minor auto hemotherapy. Rectal insufflation was given at 40 microgram per ml concentration and 150 ml in the morning. After 8 hours, we repeated the rectal insufflation, which was again 150 ml at the evening after the gap of 8 hours. So this was the protocol. Minor auto was given once in a week, and we gave this once in a day. We gave this for 8 to 10 days. Now, the second protocol which we followed was every day saline infusion of 200 to 250 ml, and it was ozonated at 5 microgram per ml concentration, which was supported by Professor Nazarov's input also. We started treating these patients who were moderate to severe, whose COVID-19 score was from 12 to 18. So this was our two trials. One was for mild to moderate. Here we did moderate and people who were admitted in ICU, who were dependent on lot of oxygen and lot of other supportive steroids and anti-inflammatory medications. Ozone was introduced to these patients for 8 days in saline formation. Now, the results which we got with this trial was that on the 5th day of the ozone therapy and standard of care, the 77% patients became negative. Whereas the standard of care, the only other group had only 53% of improvement. We, with ozone group, we got 77% of improvement on the 5th day of the treatment, and on the 10th day of a treatment, we got 100% improvement. Whereas in standard of care, we had there was around 3 to 4 patients who moved to ICU, and out of which we had 2 mortalities also. So the standard of care, patients progressed severely towards the mortality and towards the ICU, whereas the normal, our patients who were taking ozone therapy along with standard of care improved very well, and they came out of the whole disease within 10 days and not even 14 days. So which was very marked difference. The RT-PCR became negative on the 5th day to 10th day. We had complete resolution. So ozone group had complete resolution of, so they became negative, 100% negative by the 10th day of the treatment. Now, frequency of symptoms. So, when we have COVID-19 patients, they have symptoms like cough, sputum, shortness of breath, chest pain, diarrhea, loss of appetite, loss of taste, loss of smell, generalized weakness, giddiness, headache, and pain. These are the wide spectrum complaints which any patient can feel. When we enrolled these patients, all of them had this on the scale of 5, they had these problems on 5, 5, 4, and ranging from all the different aspects. When we started them with ozone therapy, we saw drastic reduction in their treatment from the 3rd day. So the 3rd day, we saw a good reduction on in cough, breathlessness, and other applications, and by the 10th day, it completely resolved. This is the visual field which you can see improvement of chest X-ray in rectal and minor. So when we did rectal and minor, patients did improve. At the same time, when we did saline, patients did improve. So what does it show? It shows that ozone therapy improves your general well-being, whether it is given as in saline or it is given as in rectal or it is given as minor. So you do not need to do only saline or rectal. Choose what is available for the patient, choose what you can do for the patient, and you must do the therapy to improve the patient's condition. We with Ozone Forum of India. In India, we have been working to come out of the agony and pain of COVID-19 by using ozone therapy. It's been used in multiple private sectors, also in government few hospitals. We've been using like Lokmanya Hospitals and Eurogen Hospital, which is in Vashi. We've been working towards getting this therapy more and more popular towards the use of it, and as an adjuvant, supportive, drugless therapy, ozone works very well as a medical gas therapy. And I think that's what I wanted to share and convey on ozone therapy as an immunity prophylaxis. So here I want to put forth that you can use ozone therapy to treat, to control, and to prevent COVID-19. And once we start using this, the whole world will improve. And I think soon we can meet all together and not be relying upon the Zoom meeting for the conference. Thank you, Professor Nazarov, for inviting me for this conference. And thank you.
Большое спасибо, доктор Мили, за такой информативный и очень
Thank you so
актуальное
much, Dr.
сообщение.
Miller,
И,
for
конечно, ваш
such a
опыт
highly informative and
является
relative
просто
communication.
бесценным для
Your
сегодняшнего
experience is absolutely
терапевтического
precious
сообщества.
for the whole community.
Наш следующий
Thank you, sir.
доклад,
Thank you. Thank you.
And
доцент
our
Санкт-Петербургского
next
медицинского
speaker
университета
is
Нелли
from
Васильевна
Kazan, Nelly
на
Galeva.
влияние озонотерапии на гемостаз у больных
She will be
хроническим
talking about
бронхитом
the
с
impact of ozone therapy on homeostasis and approaches that are taken in this particular domain.
Включение, пожалуйста.
Sorry, we're just getting ready for the connection. Is it here? Yes, everything is fine. We can see the slides regarding ozone therapy. Can you see the screen? Yes, I can, and I would like to again invite Galeva Nelly, Dean of one of the educational establishments working with and ozone therapy, and specifically with the effect on homeostasis. What about the sound? It's missing, but we can see the screen. We have some technical issues. I hope that we're gonna tackle them very promptly, and then we'll start. Good afternoon, dear colleagues. I would like to share my presentation regarding the use of ozone therapy and also its impact on liver and something. You know, that's an integral part of any metabolic procedures. And also we can here identify certain factors that should be discussed within this framework. Sorry? Am I audible? Can you hear me?
Алло, алло. Да, вас слышно? Вы в русскую...
Добрый вечер, уважаемые коллеги.
Good afternoon, dear colleagues. I would like to say a few words about ozone therapy and the ways it can be used when it comes to hemostasis with, patients with a chronic hepatitis C category. I'm about to switch to my slide presentation.
Уважаемые коллеги,
Participants and dear colleagues, I would like to share my presentation and the use of ozone therapy, especially when it comes to hepatitis. We know that liver is a special organ, and of course it actually has a direct impact on our state. When we have a problem with this organ, it can actually lead to very serious consequences. We understand that there we have quite a number of effects that it could lead to. Negative one, for example, when we have problems with thrombocytes or vascular membranes, and also, for example, with coagulating the properties. Yes, it could have a direct impact on that. As for hemostasis, yes, it's a very important factor, but it could be very much affected by the, I mean, the state of the liver that we have, and also lead to some problems, for example, like thrombosis and many other problems, and also it could lead to problems with the protein C and many other issues. If we can state that, of course, we have to analyze different patients and group of patients in order to understand how it actually, I mean, those issues are interrelated. We can see the different issues that need to be analyzed. For example, thrombocytopenia and many others. They have to be considered when we talk about this kind of approach. And so here we have different groups of patients. We have, I mean, different patients where we have patients based on the number of thrombs that they have. For example, here we have hypercoagulation. We also here have a figure of 350 per 10 liters per days. And also we have transitional forms, and also we have hypercoagulation, where we have an issue with cirrhosis of the liver. So we need to analyze the thrombocytopenia-based hemostasis, and here we need to take a different treatment approaches. For example, where we could use different solutions based on sodium chloride with different volumes, for example, up to 200 millimeters, etc. We analyzed different patients, and specifically with d.t.s syndrome. We have here different patients with different states of the liver membrane, etc. We have different patients, female and male, etc. We also had some factors in place that have to be analyzed, for example, with experiment and hypercalculation, etc. We can see that I mean, there is a correlation of two groups of patients, I mean, female and male patients, and we analyzed inflammatory processes in livers, and apart from thrombocytes, we also analyzed the function in the liver, and there we had to analyze at some critical levels, I mean, where there was a certain change in the function of the liver. We can see there a spontaneous growth in the number of thrombocytes. For example, there you can see, especially, I mean, those figures coming, I mean, growing up, started from 2.5 up to 3.5, etc. So, but usually it's I mean, tells us a lot about some problems with both the liver and kidney systems. And for example, we can see some spontaneous growth, which can be explained only by the fact that there is a problem with, I mean, all those systems. Well, we can see that 86% we have, I mean, patients with cirrhosis, and also we have quite a well-pronounced way of hemostasis that was not actually properly analyzed at the very beginning. So, speaking about, for example, the first group of patients, yes, and all the indicators that we have, yes, they have to be analyzed more carefully. Here we can see, for example, and thrombo analyzed procedure. So Here we can see this curve. This is the typical B-phase curve for the thrombocyte aggregation. We can see thrombocyte plasma, and specifically this indicator PRP, and the way it actually grew in size, and the number of thrombocytes that were analyzed. Yes, we have two waves, the first wave and the second wave. Here we can see two waves.
Озонотерапия мягко снижала эту высокую агрегацию, приводя, в общем-то, приближая показатели к здоровым лицам. Высокую агрегационную способность тромбоцитов на фоне хронического гепатита С можно объяснить низким показателем коагуляционного белка, это антитромбина 3, который также синтезируется в печени и на фоне естественного течения заболеваний претерпевает изменения в виде снижения. В связи с тем и повышается, в связи с тем, что это одна из причин высокой агрегационной способности тромбоцитов. Но тем не менее, посмотрите, после применения озонотерапии мы видим некоторую стабилизацию этого процесса у пациентов, как в фазе гиперкоагуляции, в переходной фазе у пациентов с низким числом тромбоцитов и при циррозе печени. Причем эти изменения статистически значимы, то есть уровень антитромбина 3 повышался под действием озонотерапии. Еще один белок, коагуляционный или плазменный показатель, это фибриноген, которого популяционная норма этого показателя находится в пределах 2-4 грамма. Норма, которая получена у нас у здоровых, вот она здесь указана, 2,6 грамм на литр. И если посмотреть по ходу естественного течения хронического гепатита, мы видим, что у пациентов она находилась на нижней границе нормы, и у пациентов в стадии гиперкоагуляции переходной она не отличалась от показателей здоровых лиц, в отличие от пациентов с более низким числом тромбоцитов, где мы видели разницу с показателями здоровых лиц. Применение озонотерапии приводило опять-таки еще к большему снижению этого показателя. Но нужно сказать, что в результате, хоть и есть статистически значимые показатели вот этого критерия Вилкоксона до и после применения озонотерапии, тем не менее уровень фибриногена оказывался где-то в пределах допустимых пределах популяционной нормы. Еще один показатель коагуляционного гемостаза – это активированное частичное тромбиновое время. У пациентов с хроническим гепатитом С по мере их наблюдения мы видели повышение этого показателя по мере снижения числа тромбоцитов. Озонотерапия улучшала реологические показатели, она, в общем-то, поднимала этот показатель, опять увеличивала. Но опять, если вернуться к популяционным нормам, 25-40 секунд, мы видим, что все эти показатели после применения озонотерапии вот во всех исследуемых группах, они также не превышали эту норму. Также мы посмотрели влияние озонотерапии на протромбиновый комплекс плазменного звена гемостаза. И мы увидели, что у пациентов с хроническим гепатитом С есть при снижении тромбоцитов идет увеличение.
When there is a lowering of thrombocytes, we see the normalization of this capacity and the use of prothrombin time and prolonging of prothrombin time. And then we another indicator that is different from homeostasis. This is enzyme nucleotidase, and when it's inside the overall bloodstream, then it is connected to fibrinogen and fibril. And in the case of contagion, then there is a high concentration. You see that the wall is damaged. And we see the concentration of this enzyme in the blood. And the increased probability inside of the use in the body tissues, we see it's a statistically significant figure in the patients with hypercoagulation. and it's a transition phase. And also there were many speeches that ozone has impact upon lipids. This probably has importance in our case, and the aggregation of thrombocytes is very closely connected. This is a connection that is related to the blood coagulation. Then there is the impact upon oxidation, and we look at the thrombocytes impact. This is due to increased production of all products, and then we see the releasing and the oxygenation lipids. And we see the traditional connection between products and ferments, enzymes with maximal amplitude of spontaneous TR aggregation. So anti-oxidation ferment, glutathione, and then we see that it is expanded, it is spent, and there are lipoperoxidation processes are happening. And the use of ozone therapy has a positive impact, and at the same time it has a positive impact upon aggregation form of thrombocytes. So there is a primary product, and so when we talk about the quality of hydroxide, then ozone therapy has impact upon another product with lipids. So these are higher data in comparison with the healthy persons, and we see the lowering here, the lowering of the level I had been talking about. So the impact of ozone therapy, we should look at this hepatitis C, and then azeotropic treatment is used. And the first medicines that came on this interference that were transferred to patients. And at present, the interferons were part of the therapy, and we needed to see whether they would be useful and help. During ozone therapy, we had two groups to compare. First, antiviral therapy, and the second group, antiviral therapy plus ozone therapy. And so we looked at the adaptation to these medicines, and this was during the first 10 days. What is the difference in patients who got antivirus therapy and those who received it jointly with ozone therapy? And the patients who only had antiviral therapy, there were no big changes. Even in some cases, I was worsening. And when there was a combination, then it was statistically valid decrease in thrombocytes. So it improved the rheological conditions of blood. And we saw then these changes in case of thrombocytes. And even if we looked at 10 days, so in connection to using ozone therapy, you see at a statistically significant decrease. And the second way of aggregation. So we see the impact of our therapy, and then if we look at the combined therapy, antiviral and ozone therapy, and so there is lowering of thrombocytopenia, and it was not statistically significant in comparison with the patients who had a combination that was better result. There was a statistically significant decrease in this indicator. So positive impact is also in the therapy of ozone treatment upon the coagulation hemostasis. And so we see this insignificant growth, and this growth was statistically significant. So rheological properties were improving, and prothrombin time was decreasing in comparison with patients who had only antiviral therapy. And this was different from the patients who had antiviral therapy. And patients who had antiviral therapy, there was a bit of a decrease. And there's fibrinogen level change as well. So we looked at the medicines of antiviral action. So when we were studying the changes of this indicator at the forum, at the fourth week, we were observing its increase, and when we were looking at monotherapy, so when we looked at ozone therapy and immunotherapy, then when we used antiviral therapy and ozone therapy, we saw it as destabilized, and then it stabilized in this way. And then in case of chronic C hepatitis and those stages, because of insufficient clinical expressions, in case of small inflammation of the liver, then the studies with cirrhosis, comparative studies have better data. But when the changes are not on the level of lab data, and we need to understand where there should be a success of ozone therapy in comparison with chronic hepatitis C. It is important to start ozone therapy and antiviral therapy in time. And in connection to what was obtained, that's the acuteness is only on the lab level, and the impact of ozone therapy. The patients with chronic hepatitis C, we should recommend it. Then this can be on this level without the clinical expressions. And when there is a change, transformation of chronic hepatitis into liver cirrhosis with a change in lab indicators, and then we look at class B where there is decompensation, because in these cases we could not use therapeutic or antiviral therapy, and then a patient doesn't have any significant therapy whatsoever. So this is a conclusion we need to make. So if there is acute flow of the natural violation of thrombocyte hemostasis and hemocoagulation, ozone therapy should be indicated and used. And then with the treatment, when we use ozonated saline solution with the concentrations of ozone, this should be normalized. It should normalize its coagulation properties. And this is in case of chronic hepatitis C. This should also be recommended. And when there's a degree of aldehyd and 5 slash Peretyagin and in case of ozone, so in this case ozone use should be recommended. Thank you for your attention. Thank you, esteemed Nelly. This direction of ozone therapy, this is one of the most important directions in the world, ozone therapy, and we are very happy, and we are very happy that we are moving to such a high level. Now there is the switching on of the next speech. Please do not leave our broadcasting, and there will be the next speech, the multi-resistance of nosocomial infection and the ozonotherapy effect. So this will be Mr. Talakvadze, the chairman of the Georgian AMTH department. Give us just a moment to upload the presentation. Thank you.
Так, и приветствуем Владимира
So
Толоквадзе.
greetings. So now Vladimir Talakwadze is going to talk to us. Vlado Talakwadze.
Да, пожалуйста. Рад слышать вас.
Добрый день, дамы и господа.
So good afternoon, ladies and gentlemen.
Толоквадзе,
I'm
председатель
Vladimir
Ассоциации
Talakwadze,
румынских
the
университетов.
chairman of
Работаю в
AMTH,
Киевском
Association of
государственном
Church,
медицинском
and I
университете
work
на
also at the medical
кафедре детской
university
хирургии.
as the chair of
Мой
children's
сегодняшний доклад
surgery.
будет мультирезистентная нозокомиальная
And
инфекция и
I'll be
эффекты
talking about
озонотерапии.
multi-resistance of nosocomial infection and
Инфекционные
the effect of
болезни
ozone
определяют
therapy.
высокую заболеваемость и
And
смертность повсеместно
infection
серьезная
diseases
работа
determine
государственных
high
медицинских учреждений
morbidity
по
rate
изучению
and
инфекционных
mortality rate all
болезней и
over the world.
экономического влияния на
And
бюджет.
so we
Были
see
рассмотрены все
what
инфекционные
is
болезни и определенные
the
специфические группы.
impact of
Оказалось, что 4,5
specific
миллионов
groups,
дней
and
госпитализации и
and
более чем
it turns out
860 миллиардов долларов в
that
уходит на лечение
more than
инфекций, инфекционной
$865
терапии.
billion is
Госпитальные
spent
инфекции
for treatment of
значительно снижают
infections, and hospital
качество
infections
оказываемой помощи
significantly
жертвам на
decrease the
протяжении века.
quality of
Наиболее
the help
частые
provided
госпитальные инфекции являются
for a
ассоциированные с
century. And
катетеризацией центральной
most
вены, что
often hospital
дополнительно
nosocomial
требует
infection is
лицензирования штатов в
associated
среднем
with
больше, чем 45 тысяч долларов
catheters
к
and
основным
more
затратам
than
на лечение одного больного.
$45,000
Пневмония,
per
связанная с
treatment of one
механической
patient is spent as a result
вентиляцией легких,
additionally.
является второй
And
причиной
the artificial lung
больничных инфекций,
ventilation
дополнительно
also often
требует
causes
затрат
nosocomial
в среднем
infections
больше, чем
and
40 тысяч долларов на одного
requires
больного.
more than $40,000 per one patient
Типичные
to help
представители
him or her.
госпитальной инфекции
And
являются
typical
ацетаты,
representatives of
стафилококки,
hospital
псевдомоnas и так
infection,
далее. Все
catheters,
ассоциированные инфекции имеют
associated
выраженную
infections
тенденцию
might
распространения в
have the
больницах и
expressed
особенно в
infection
отделениях
in
интенсивной
hospitals
терапии
and
и
especially
реанимации.
in departments of
Я не
intense
буду
therapy
сейчас
and
говорить
reanimation.
о озоне и действии
I will not
работников
be
озон-деятельных
talking often
на
about
бактерии и
ozone
на
and
вирусы.
its impact upon
Я хочу
bacteria and
остановиться, несмотря на
viruses.
известный механизм
I would like
воздействия озона,
rather
эффект
to
озона для
emphasize
радиоактивности,
the
недостаточно
mechanisms of
документирован и пока
impact of gas.
плохо
The
изучены клиникой.
gas haven't
Нет
been
документальных
documented well
гайдлайнов и
enough,
научно-документальной
uh,
медицины,
and
подтверждающих
in
клинический эффект озона при
documentary
инфекции. Как
guidelines, I
оказалось,
think that
нет
I
научных
would say
работ
that there are no
с
documented
соответствующими дозами,
guidelines
чтобы определить
in
эффект
the
озона.
system of evidence
Для
medicine to
определения
confirm the
последнего
clinical
требуется использовать
clinical effect of ozone.
секвенцирование генов госпитальных штаммов.
And we need
Методами
to
связанных
also
связанных с
determine whether we
финансированием
need to use
исследований.
sequencing of
Центр
hospital
геномных
strains,
исследований при
nosocomial disease
лаборатории
strains,
Лугара
and
Национального центра
then
по
the
контролю за заболеваемостью
laboratory
в
named
Грузии
after
является
Lugar
действенным местом
in
не только в
Georgia is
Грузии, но и
studying and
в регионе,
controlling the
где
level of disease.
возможно
And
исследование с
it is
помощью
the only place not
секвенцирования
only in
генов.
Georgia, but in the
Центр
Caucasus
геномных
region,
исследований имеет
where
наличие хорошо
there is
подготовленных
genes
профессионалов, которые проводят
sequencing
геномные
studies
исследования как бактериальных, так и
by
вирусных
using
патогенов.
next generation sequence platform.
Несмотря на то,
And
что проводилось
even though
множество геномных
there were
исследований
many
по эволюции
genomic research
антибиотикорезистентности, очень мало было связано
to
с
study the
предсказанной
evolution
работой в
of
связи с
antibiotic
применением озона.
resistance, a few
Здесь
were
Киевской университетской
dedicated
клинике
to
Киевского
transcription
государственного
in
медицинского
connection to the
университета,
use of ozone.
департамент хирургии Центра
And
геномных
so
исследований,
where
были изучены
there is
штаммы
a
псевдомона
center
аурумиози,
for studying
проведено
this
геномное
issue jointly
секвенцирование
with
и
the
анализ
surgery
генов
department.
резистентности
We
возбудителя
did
донорства и
genomic
лечения
studies
озоном
together with
через
them to study
определенное время.
nosocomial disease strains after regular periods of time.
У нас был больной,
And
3 года было ребенка, который
those
болел
were
двусторонней пневмонией и плюс сепсис.
cases
Ребенок
of
был
children
на
with
искусственном
bilateral
дыхании месяц.
pneumonia and
Через месяц,
artificial
когда
breathing
сделали
systems.
бактериологический анализ,
So actually, we conducted
был
bacteriological
псевдомонас который был
analysis
резистентен на
of all the
все
symptoms that
антибиотики.
were manifested, and also it was done
Мы
prior
начали
to
делать
ozone therapy. So we conducted that prior to the procedure involved, and we also after that analyzed the ozone therapy that was applied, and after the third course of that, we could see that the resistance a little bit changed. I mean, based on a number of factors. We also analyzed the genetic factors and many other aspects that were involved there as part of the analysis. And after that, it turned out that, I mean, at least what we actually saw there, yes, zone therapy was quite efficient, but there was a pseudo-immune analysis. It could only be conducted by the American side, so we managed to, I mean, compared the dates that we had, that we received I mean, in Russia and also in America that we received. We had to analyze certain guidelines and many other aspects involved, but at the same time, we had to understand that those guidelines should be really implemented in the true sense of this word, in the way it is done, for example, in the states, etc. But it's not always the case, for example, for other countries like Georgia, etc. And also we saw that DNA and many other factors, they are not always applicable. And the third point that actually happened, here you can see in green lines and in the yellow lines, you can see the effect that was produced by antibiotics prior the ozone therapy and after ozone therapy. So we saw that after third manipulation, we had a certain impact on proteins. We saw that there have been quite a number of procedures applied, and after the seventh procedure, the child was withdrawn from the treatment and taken home. I conducted a small analysis, and here you can see. Here is the effect of the multiplication that I conducted. You can see green and yellow colors. We can see those colors that blocked the ozone therapy enzymes. We can see some of the proteins, and we had lysis. And it also was reflected on the diagram. It was proven that the effect of the antibiotics was not always the same in different situations. Is it visible for you?
Нет. А нет, вот сейчас
Oh,
появилось.
yes, now it is. Yes, now it is. Yeah.
Да, да, да. Продолжайте.
So, theoretical analysis, I mean, of the whole system showed that there were some blocking elements, and we had to analyze them more carefully, especially when it comes to antibiotics. We have to understand that this is a very important factor, that there is such issue as resistance and many other things. We also have to analyze the different involvement procedures, for example, interaction with different proteins, etc. And here we can see that we have different types of antibiotics, and their effect might be really different. And just to summarize, I'd like to say that after ozone therapy, the expression of the genes and their resistance really changed. We received some preliminary results, and they were absolutely marvelous. They were absolutely different. We can see that in terms of their multi-resistance, especially, I mean, when it comes to nosocomial infection, I mean, something that is there was absolutely different. Thank you very much
Спасибо,
for your
Владимир.
attention. Thank you
Большое
very much,
спасибо
Vladimir.
за
I would like to
очень
thank you,
интересное
Vladimir, for
сообщение.
such an interesting
И
message
сейчас
and such an interesting
будет
presentation.
небольшая
And
заставка
now
и
we are
готовиться
gonna
к
have a
следующей
short break,
части.
and then we
Остаемся
will
на
give the
связи.
floor to our next speaker. We are staying here in our studio. Thank you very much.
И с большой радостью
So it's my
представляю
great pleasure to announce our next speaker, the Dr.
директора меди
I
Ozone,
mean, head of
d.t.s. Welcome,
Medio
Dmitry.
Ozone Clinics.
Hello. Now today I will be talking about
Сегодня я буду говорить
radicals. Just a second.
Меня слышно, да?
Да, вас слышно. Презентация нет?
Yes, you're audible. What about the presentation? It is available or not?
I have to find the place to share the screen. Just a second.
Я просто пытаюсь поделиться сейчас экраном. Секунду, я сейчас настрою.
Ждем.
Okay, we're waiting for that. Yes.
Just a second. I just couldn't find it yesterday. I could find it, but today I couldn't find it. Just a second.
Нормально. Вот, а сейчас что-то у нас не выводится.
I cannot find the button to share the screen. That's the
Я
deal.
могу найти кнопку, где нужно нажать, чтобы поделиться экраном, поделиться презентацией. Сейчас нормально все? Все нормально? Сейчас слышно меня?
Слышно и видно.
Yes. We can hear and we can see you perfectly well.
Okay, yeah, if you can hear and can see, okay, I continue. Okay. Today I will be talking about ozone therapy and free radicals. Mostly when we have patients in ozone therapy, either those patients have some complaints like pain, wound, diabetes, varicose spider veins, or another. But some of our patients has no complaints. Only they just say that they want to be more stronger, healthy, or maybe they don't want to age, and they need some benefits. But whatever benefits they want cannot be shown in the tests. Like, for example, if the wound is on skin, you can see the wound, and also the patient can see the wound. Or if the patient has diabetes, you can measure the blood glucose levels, or you can measure hemoglobin A1C, or you can measure some other forms. You can measure insulin or other things, and then you can follow up your ozone therapy. But in some patients, there is no laboratory finding to follow up the patient. So when we face a patient that there is no measurement that we can do, what should we do? For example, a patient can come say that, well, I don't feel myself that comfortable, I feel dizzy, I feel weak, but we do the therapy, and then the patient says, well, I cannot see any benefits. So if this patient is saying that they cannot get any benefits, how can we show this patient or other people of the friends of this patient that this therapy is affecting and changing something? So in everywhere, many people are buying ozone generators, doctors, and doing therapies to them. But some of them are doing the therapies at the clinics, or some of them are doing at home. So how can we do this? Basically, ozone therapy is one of the high energy therapies. As you know, that when three molecules of oxygen turn into ozone, we need energy to do that. And Bocce years ago has shown that we need 68,400 calories to form ozone. So when this ozone is formed, ozone is high energy form of oxygen. So when we use ozone, when we inject ozone into a skin, the skin really gets burning effect. Or when we inject it into blood, the blood gets high energy. So ozone is the third most potent, most harmful free radical in the world. Number one is fluorine, number three is persulfate, and ozone is the number three. So ozone is very oxidant molecule. So when it is injected to that, and we increase, in fact, we increase free radicals in the body. We increase free radicals in the skin. We raise other radicals in the skin. But as a controversial reaction, body increases and produces antioxidant enzymes. So that is the main principle of ozone therapy. We just give some ozone to the body, which is a free radical, but the body, to respond it, the body creates antioxidant enzymes. It is like antigen and antibody, or like yin yang. We just use, there are two opposite things, but ozone is a free radical, but when we inject it to the body forms antioxidant. So some people, when we do ozone therapy, after the session, they feel themselves tired. They say that, well, doctor, I came to you to feel better, but after the therapy, I feel tired. Why? We know that those people feel tired because they cannot tolerate the dose that we are giving to them. Actually, the body, after giving the ozone, the body is producing antioxidants. But if the dose that we are giving to the patient is more than their limit, it's more than that they can respond, the body feels itself weak. So this person, we can say that this person cannot tolerate the dose. So just basically, if we go review oxidative stress and antioxidant potentials of the body, we will be able to understand better. So it is oxidation is a way of losing electrons, and this is that giving electrons to the body. And antioxidants is a very large and heterogeneous category that products that can donate electrons. The process to donate electrons is called reduction. After losing electrons, they become oxidized. Oxidation and reduction are inversely connected because if a molecule is giving electron to the other one gets the electron. So it's just in the balance. So mostly all those oxidative stress is controlled by reactive spaces, which is called free radicals. And there are many free radicals. To make short, I will not go into them, but there are many reactive oxygen spaces, nitrogen, sulfur, chloride, others. And also, we have, on the other side, we have oxidative stress. Oxidative stress can damage the cells. It can cause aging and other things. But the body can protect itself by antioxidant enzymes. So when we give reactive oxygen spaces to the body must create a response to that. So also there are many other antioxidant enzymes in the body. So when there is an oxidative stress in the body, just as seen in this diagram, there are many causes that can cause oxidative stress, and also on the other hand, there is antioxidant enzymes. If there is a balance in them, the body can protect itself. Otherwise, we can get cardiovascular diseases, dementia, early aging, inflammation, and many diseases because they are all caused by oxidative stress. So ozone reacts with body fluids. We know that it reacts with all body fluids. So when ozone mixed with water, the water part of the body fluids, it causes antioxidant enzymes, and also besides reactive oxygen spaces, it causes LOPs, lipid oxidation products. So ozone outside of the body, it can increase oxidation and also decrease antioxidant enzymes. But in vivo, in the body, it's just totally different. In the body, when you inject ozone to the body at the beginning, first the antioxidants get lower, free radicals increase. But the body gives a reaction, and then this suddenly changes, and then the body starts to increase antioxidant enzymes. So this is the main political reactive action of the ozone. And also it can oxidize several things in the body. And there are many tests that can be done. Here in this diagram, you see, depending on the doses, the body creates different reactions to antioxidants and oxidative stress. And in this study, one lifetime control group, 20 micrograms, 40 micrograms, 80 micrograms, 160 micrograms. When you increase them, we get other responses in the body. So that's why years ago, Professor Bocci determined that ozone therapy must be done at low doses and start low, go slow, because the body must respond to the dose that we are giving. So in the oxidative stress and antioxidant capacity, it's our main philosophy, main target. So there are many ways to determine oxidative stress, and we can measure them in several ways. And there are many publications how to measure them, and like we can get a little drop of blood, centrifuge it, and then we can test it. So by those we can measure the oxidative stress of the body. And also when we measure the population, we see that some mean values are done. And also in some studies, some studies are done with using those methods. And so the mean values are just about 260 and 300. Mostly people have oxidative stress in those levels. So when this test is carried, so we can see how much oxidative stress does this person have. So when we are doing ozone therapy, if we measure the initial oxidative stress of the body, so we can see how ozone therapy can affect. And also in this free radical test, we can measure the status before then the ozone therapy and after then the ozone therapy. So besides this, on the other way, we can also measure oxidative antioxidant replies. So we can use this measurements in sports medicine, cardiovascular disease, diabetes, neurological disease, and ozone therapies. And on the other hand, the like yin yang, the other one is the antioxidant capacity. So antioxidant capacity can be measured in several ways, like we can measure glutathione, or we can measure other molecules that are antioxidant enzymes. But also we can measure them in total, we can measure them in saliva, we can measure them in blood. So when we measure them in blood, we get an answer how much antioxidant capacity does this person have. So by this way, we get some values. So those values, if there's a deficiency, the value is less than 1800. Optimal values is over 2800. So the definition is in between those values. So when we give ozone therapy, so we did a study with this, and when we give ozone therapy at different doses, you can see that 40, 60, and 80, they affect d.m.s and potential antioxidants in different ways. So after giving ozone therapy, we see that we can increase antioxidant capacity of the body. So we can also, by this way, measure our dose, if our dose is effective or not effective, or we can increase our ozone therapy with this. Also, antioxidant capacity can be measured in the saliva. Saliva, similarly, we cannot measure free radicals in the saliva, but we can measure antioxidant capacity in the saliva, and then we get some different values in saliva. If there's a shortage, it's less than 1,000. If over 2,500 possible inflammation on the place. And so we get other things. So our body liquids can be measured in ozone therapy almost in real time, and also we can measure the optimal ways how to do this. And also there are some indexes, but this is a little bit too much. This is further knowledge, and we can oxidative balance risk index, and this is another index that we use, but it's a little bit more high information. And also we can measure it. Just there was one study before that was done, 1 hour before ozone, 1 hour after, 25 hours. So in this we got those values. So those values in first week, second week, first week. So by this way, we see that every patient before and after ozone is changing, but more in time it gets better. And so oxidative stress index test and the other things get better. And also we can measure effects of ozone by advanced glycation end products. We can measure advanced glycation end products like carboxymethyl or methyl glucoxal. They can be measured. Also, ozone therapy can be followed. The benefits of ozone therapy can be followed by measuring advanced glycation end products, and also it is showing how things are going. And also we can show how arteriosclerosis, thrombosis, and vascular biology is going with them, because AGS, advanced glycation end products, have really strong relation with that. And oxidative stress and antioxidant status tests are very effective for monitoring ozone therapy. Besides the test for status of the patient, we can simply use d.m.s, PAT, SAT test. We can set our doses according to them. For long term, we can use AGS, general effects of ozone therapy. To track AGS is very beneficial for all of us. So, thank you.
Доктор Рухи, я думаю, что я
Dr. Ruhi, I would like to express my opinion as everybody's opinion that you really enriched our notion about the methods of lab control in ozone therapy, because ozone therapy is a highly active method of treatment. And thank you very much from the depths of our heart. And now we'll take a very small break, and exactly at 16, so like in 20 minutes, we are going to continue our session. Thank you so much again.
efficient basis. And in trichology, we also saw that we also now use the mask and creams for uh, different types of dermatitis. Here we can see four basic patents, for example, the ones that are used for the treatment of neurodermite and different other diseases, rosacea and many others. We can see the number of, those patents, and we are trying to really fix, all those diseases where we can work with all those types of infections, etc. Here is an example of ozone therapy, where we work with this kind of disease. So this is a small autoimmune ozone therapy, acne. You can see how it can be used as part of systematic methods. And also we can see a very good example of another meson of therapy that have been used for over 15 years as one of the rehabilitation methods, especially when it comes to rosacea. And here we can use also additional use of steroids, etc. The results is quite visible. They are really positive. I also worked with Ph.D. and dissertation. We can see different mixtures that were used with antioxidant effect. We can have some mixtures used, with serum and histamine and many other things, and also those fluids that lead to a better uh, circulation, blood circulation, and so on and so forth. Here we can see some of the recommendations that are prescribed specifically for these methods. So speaking about this problem, yes, we should say that this is a special sector, and this is very much analyzed by quite a number of countries, for example, Russia, Italy, Spain, Cuba, etc. And for quite a number of decades, we talked about bactericides and also virus-related particularities of our approaches, and we developed quite a number of new devices and new drugs, and we can see appearance of new drugs. And, appearance of new drugs that can be used in our practice. So speaking about ozone-based, something that was tested in Nizhny Novgorod after quite a number of tests. Yes, we have come up with a number of products that have proven to be quite a success. For example, Otroline Cosmetics, you can see them on the screen. They are oil-based. Of course, we have special chemical properties. They have different particularities regarding different specificities. So now we have quite a good spectrum, approximately 38 different products. They have real good potential within dermatology because they have combined and also antibacterial and anti-inflammatory effects. And we can see that they are quite efficient because the results are really marvelous. And just look at those figures that we are now showing. We can see a very good antibacterial resistance. We have quite an a good price combination and very good anti-inflammatory result. And apart from that,
И плюс еще вот не могу не сказать,
we
что
should also
прямо
say that
резистентности, которые
we
сейчас
also need
являются большой
to
проблемой в
talk
мире.
more about
Эндермейеров,
antibacterial
иммунотерапия
resistance,
микозы
especially when
также,
it
да,
comes
и вот то,
to
что
dermatology and many
вот
other aspects. Here we can see, more detailed information about
и вот по
ozone
этим
therapy. You can
базовым
see some of the
параметрам
most
терапевтики
important
следует
chemical
воспринимать целевую
parameters of
кислородную массу, связанную
ozone-based
терапевтику.
oil,
Причем дерматологу обращать внимание
olive
на эту целевую
oils, and
параметрию.
for example, peroxide
Тем
number.
более
This is one of the
выраженная,
most
так называемая
parameters
специфика.
that should be analyzed when we talk about these kind of oils that are used, and specifically when it is used for cosmetics purpose, for spa and so on and so forth. So if we want to work with herpes and many other diseases, we need to focus more on this kind of parameter, and especially, oxidity parameter. It needs to be analyzed, that's for sure, because it has a direct impact on the state of our skin and many other, things that are very important for us. Speaking about this survey that was conducted, as of today, we have quite an interesting survey that were conducted by macro laboratories. They fixed some of the very important results. Also, some results were based on ultrasonic investigation. We also used olive oil, and as of today, we started to also analyze some functional parameters. We also try to analyze them as part of, course-based treatment, and based on some of here we can see, for example, bacterial and fungi-based pathogens. They are all there. They were reflected on the previous slides. Of course, we should think more about the Minsk ozone therapy school. They analyzed these figures and all those factors as well. We have also here results that were showed by our colleagues from Cuba. Here are some of, for example, Mr. Yakovlev. In back in 1995, he published a very interesting work where he talked about onychomycosis. With punchy information. Some surveys were conducted regarding Peter and also some successful uses in case of atopic uh, dermatosis, information about the use of olive oil in gynecology, also one of the examples where it was used in all those publications, and also these cases. And here we can see uh, ozone-based and ozone-saturated olive oil as to how it can be used for the treatment of different chronic diseases. Here is another example from my side. We can see here an example of cryotherapy and actually how oil can be used from this point of view, and the results that we can achieve within quite a short period of time, and results of ozone booster complex treatment. First visit and after 2 days, uh, 10 days, so you can see well, if olive oil is used for quite a prolonged period, at least 10 days, as part of comprehensive treatments, there we can see that we can achieve very good results. Here we can see that there was quite a number of uh, problems related to the limbs, etc. And yes, there have been some neurological problems, but thanks to our therapy, we managed to achieve very good results. Another good example where we also repeated the example of our I mean partners from Cuba, there is a very good example of clinical experiments. And you see that there was quite a typical clinical picture. She was it was suggested they should take corticosteroids, and with the help of olive oil, we saw that she quite normalized. I mean, the situation with her nails. Of course, it takes quite a while to do that, but at the same time, yes, even though that is 3 to 4 months, but at the same time, we understand that this is quite a good result, and this is something that is really suggested and clinicians I really recommended this kind of approach. We have another affection, and for example, on the nails, that was demonstrated on the previous screen. So we can see that these are two of the major products that are now recommended in the form of corticosteroids, etc. We can see the soil and many other drugs. We have, and right now, a wider range. For example, ozone relief, and many others, and a lot of them are produced in Turkey, Spain, Finland, and many other countries. So they have made their own contribution to the development of this sector. We talk a lot about the effects that can be produced by this kind of drugs. Of course, what are they supposed to do? Of course, are they supposed to retract, I mean, collagenal effect and microcirculation? Yes, they can do that. But what about the way that they are produced right now? Do they actually help us to
So
work
these
with all
medicines
those
are
problems?
produced
We understand that we have
for
different
skin,
types
and
of
of
skin.
course
Sometimes we
the
need lotions,
skin
different
with fatty
gels,
lid needs
solutions, and so on
solutions
and so
and
forth.
lotions.
And we have some
And
problems
in case of
as
atopic
for atopic
dermatitis,
dermatitis. So we need
then there is a
to
mass of effects,
think about some
and this
additional
should
problems
be used on
that
such
were
means,
mentioned on the
and
previous slide. We need
we
to
have
have
been
sometimes
developing this direction for a long
moisturizing
time,
effect.
and there are
We
moisturizing
need to think
effects.
more about
And in
the
addition to
effects
this,
that can be reached with effects
there
of
is
ozone
the
therapy,
treatment of the
and also
secondary
some
bacterial
bacterial side effects.
complications.
We need
There
to
should be less
avoid such problems
erosion,
as itching. We need to also avoid problems like infection, and so on and so forth. And they could be used for that matter. Absolutely.
то можно взять вот такой, в общем-то, достаточно простой метод оценки функциональных параметров, как корнеометрия, и прекрасно эти эффекты зафиксировать. Но есть и другие методы визуальной диагностики и функциональной диагностики. К ним относятся и трихоскопия, в частности, да, и ультразвуковое исследование кожи, ну и также
and
оптическая
there is ultrasound
если вернуться к
research of
технологии
skin.
производства озоносодержащих препаратов в Нижнем Новгороде, то линейки постоянно расширяются, и вот если в 2012 году мы имели только
And
6
if in 12, in the year 12 we only had 6 medicines,
имеем теперь
then in
более
2000
20 препаратов, и вот для того, чтобы как-то привязать, да, эти средства к клиническим эффектам.
and in order to connect this means to clinical methods, at a certain point I did statistical analysis, and there are
И вот одно из наиболее успешных полей, безусловно, это лечение всех вариантов.
and then this is the treatment of the spread dermatosis,
болезнь
And
Долея, болезнь
then
Довержения. Вот все
there
наши
is
пациенты
this
также положительно реагируют в ответ на эти средства.
illness of
На
Dobberge,
сегодняшний день в
and
России
all of
мы
these
имеем
patients have
3
positive
варианта,
impact
которые
upon
проводятся, производятся в Москве, в Нижнем
these
Новгороде и
treatments.
Зеленограде.
And we can look
Имеется
at
очень большая
needs
клиника
of
озонизирующих
local
препаратов на
impact
Украине, ну и
for the
также
body.
такие вот страны,
So we
как
see in
Италия,
Ukraine
Испания,
such
США,
countries as Italy,
Турция,
Spain,
безусловно, ЕС,
USA,
лидеры. Ну
Turkey,
и вот
as
на
they are
экране
leaders.
наша
And in
нижегородская
the screen,
клиника. Вы
our
видите, что
Nizhny
здесь эти
Novgorod
препараты как
line,
для
you
гладкой
can
кожи,
see
так и
that
для мясистой кожи головы. И
this is also
эти
for
средства
the
прошли
skin under the
апробацию
hair of the
Ассоциации
head.
российских озонотерапевтов,
And
и только при соответствующей методике их эффективного применения должна еще указать на необходимость хранения этих препаратов
And
в
I need to
холодильнике.
indicate the
Один
necessity
из
of
методов
storing
неинвазивной
these
диагностики
medicines
состояния
in
кожи, о котором
refrigerator.
сегодня уже речь шла в
And
начале нашей прошлой
so
сессии,
we were
это,
talking
безусловно,
about
важный
this in our
метод
previous segment.
колометрия. Существует действительно вот много
There
публикаций
are
по
many
применению метода ЛДФ
publications
в дерматологической и
for
гинекологической
using LDF
практике.
method.
Безусловно, что этот метод сложный в
And this
исполнении,
method
он
is
чувствительный и
complex
очень
in use
информативный. И мы
and
используем его
highly
как для
informative.
пробы от наших косметологических пациентов, так и для наших трихологических больных.
And
Еще
also for our
один прибор
trichological
из нашей
patients.
вот
Here is
клинико-лабораторного комплекса.
another
Это прибор
medicine.
Multi-Skin Test Center,
Another
который
is
изучает
a
такие параметры,
multi-skin
как
test center
корнеометрия,
apparatus,
себометрия,
and it
уровень
studies
пигментации,
corneometry and the level of
фотоэластичности кожи.
pigmentation,
Вот достаточно простой в
себоmetry,
исполнении. Ну вот здесь
elastometry.
я показываю, что еще
So
и d.m.s
this is
включен.
a
Мы проводим
rather
макрофотографию у всех наших пациенток обязательно
good
делаем. И вот эти
approach, and we
приборы у
also are
нас
using macro.
вполне компактно в кабинете дерматолога, косметолога, трихолога
And
располагаются. Еще
this
одна дружественная
is located
ассоциация российской
in
к врачебной косметологии нечто иное создала
this can
диагностический
be
комплекс,
different
помогающий
in
врачам
medical
работать в точке входа с
cosmetology.
помощью аппарата Face Analyzer. И, безусловно, что вот эти, мне очень приятно делать сегодня доклад по функциональным параметрам кожи именно в Санкт-Петербурге, поскольку вот я первоначально ориентировалась,
And
конечно,
I
на
was
диссертационную
working in
работу
St.
руководства
Petersburg.
профессора Корольковой Татьяны Николаевны. Ну и вот эти параметры, они, безусловно,
I worked
являются
under
ключевыми,
Mrs.
потому что
Korolkova
здесь
leadership.
представлена уже вот такая представлены цифры, да, которые подвергаются статистическому анализу. И вот в
Which are under
период
statistical
мы
analysis.
проводим исследования разных пациенток разных возрастных групп. В качестве группы контроля выбрана группа, получающая гликолевый пилинг. Все наши пациентки
It's a group that receive glycol peeling.
опрашиваются, да, мы
And
заносим
all
все
of our
необходимые
patients
последующие
are
для
asked.
исследования
So
случаи,
this
и
necessary
дважды
for
проводим
the
исследования
study of
до
the
и через
cases.
месяц после
And
применения
we were doing
озонит,
studies
содержащего
after a
крема
month
для лица.
of
И
ozonate
вот
containing
те
cream for
показатели
the face.
функциональной
And
диагностики кожи это
for
лазерный
functional
комплекс
diagnostics of
информетрии
skin, there
и
is this
вот
laser metry,
которая показала нам, в общем-то,
which
положительную
demonstrated
динамику
to
при
us
исследовании.
positive
Ну и
dynamics
также мы
during this
изучаем и вот
research. And
такие параметры, как
we
влажность
also
кожи,
are studying
жирность,
such
пигментацию,
parameters as
осмосис, и
skin
также видим
moisture and
положительную динамику. Ну и
pigmentation,
вот на данном
elasticity, and
слайде
we see
и
positive
данные
dynamics as well.
аппарата Face Analyzer
So in
также
this
они
case, we
подтверждают
also have the
предыдущие
data
исследования. Ну и в
for
заключение
face
несколько
analysis and
слов по
confirm
трихологическим
the
аспектам
research and about
применения. Вот
trichological
крем-маски, они
aspects
сейчас очень
for
широко
using these
вошли в нашу
creams, and
трихологическую
this
практику. Буквально
cream
они вышли на
masks are
пике.
used in
Они совершенно, например,
trichological practice,
уже исключают использование и
and they
мезоозонотерапии, и
really
озоновых в силу, в общем-то, конечно,
do not include the
возможности для
use of
использования. Но мы безусловно,
mesotherapy,
уважаем и вот
even
опыт
though we
наших
respect the
ведущих российских
experience
тархиологов, которые
of
помогают в обследовании по
our
проборам. Но, тем не
leaders.
менее,
in the sphere, and so there are these injections that are used. And of course, ozonated masks are a great way of treatment, and also allopaxis is used. And in 2019, we also developed a new direction, which is called Azotex therapy. And so in case if it's needed, there is also LAMP research and presentation of similar specialists or interdisciplinary specialists. And at the beginning of our clinical work, we also did this in vitro research. And we also used the services of volunteers during the trichological research. And also there was a complete recuperation from inflammation, and we used these types of masks, hair masks in case of dermatitis. And the year 2019, we developed the new methodology, and this is to stimulate the neck area in order to use ozone cream. And so here we see the use of azotens as a neutral cream. And in patients with the repeated variant of recurrence, then we saw very positive results and great improvement of skin. So we use ozone therapy and ozonated saline solutions, ozonated olive oil for herpes treatment and associated diseases. And this is a classical therapy of atopic dermatitis, and it is necessary to note that the reasons for this external synedesis is often the lack of need to use complex solutions, and in terms of economic reasons, I cannot really answer because the cost of these medicines is changing all the time. And we definitely can ask producers questions where are specialized pharmaceutical enterprises, and should we conduct this direction, how to develop these means in pre-act way, because in precipitatory therapy this can be developed without nasolines, and we need to tell our patients about other needs, because it has been working for many hours. And cosmetics with ozonate is a new direction, trichology, that has a complex impact. And thank you for your attention. Oksana Anatolievna, we are grateful. Now there will be a little break in order to switch on the next speaker, who will be participating remotely as well. Please wait for just like 1 minute and stay with us.
Так, и продолжаем трансляцию. Представляю нашего следующего докладчика Аполихина Инна Анатольевна, президент Европейской ассоциации.
So this is Mrs. Apolihina. She is chairman of the European Association of Genital Aesthetic Medicine and Plastic Surgery. and she'll talk about carboxytherapy in gynecology. Thank you very much. Let me greet to you at this international congress, which is devoted to the use of medical gases. And I think that we're working beautifully. I listened to the previous lecture, it was quite interesting. And I think that this congress is going to work well. And I'll talk about the use of carboxytherapy in aesthetic gynecology. In the year 16, at the center of Kulakov, a department, a ward was opened, and we organized the study for aesthetic gynecology. And this is for the use of different technologies. And if we study history, and okay, I need to switch slides. And so there is this rich history of using carbon dioxide at in different countries, especially in France. And these services were actively used for healing trophic wounds. And it was effectively used in cardiology. And starting with 1995, carbon dioxide is used in different aspects of aesthetic medicine. It is easy for us to work because we have amazing devices. The systems are highly effective and thought out technologically. So what about carboxytherapy of the medical dioxide, which is joined to a special apparatus? And two aspects are important for clinicists. And this method, this is the level of efficiency and effectiveness, and it is not toxic. It is very close physiologically.
And it's very close to the physiological properties of the human bodies, and also it covers quite a wide spectrum of the technologies to use. It can be combined with other methods, and finally we can see that a lot of processes can be actually combined and automated. So what about I mean, CO2, where it can be used? It can be used in urology, in sports, medicine, and gynecology, and vessel, cardiovascular therapy, etc. And also we have to cover, for example, not just cardiovascular disease, but also problems that we have with metabolic effects and some problems with the joints, erectile dysfunctions, and vulvovaginal rejuvenations. I mean, something that can also be covered from this point of view. So, speaking about rheumatology, of course, we could cover that, and I think that cosmetologists and dermatologists could, I mean, cover that issue more intensely. Well, these methods has already been tackled. We have acupuncture and impulse and permanent regimes that have now proven to be quite a success. Here we analyze the tissues, we control quality, we also work with different gases. We have antibacterial filters, special tubes that are used with needles, and they are, I mean, they are up to 30 millimeters in their length. And now I'm gonna introduce a very interesting device which is called NCO2. What it is used for? It heats up gas. It can be done up to from 23 to 45 degrees. Here we can see that we can regulate gas temperature and also injection control can also be monitored more properly. We also have three different types of gas purification. We also can work with different needle modes and regimes, I mean, the way that they are used. And we have different modes that can be used for that matter. I mean, impulse-based, I mean, the so-called permanent one, or a cup and true based, and it is all based on our kind of therapists. What about characteristics of CO2 on these technologies? Well, first and foremost, of course, we can see that there is no risk of explosion, there is no problem with the smell, etc. It can be used on quite a safe basis. And as part of this procedure, we increase the concentration of CO2 in blood, and it actually ousts oxygen from hemoglobin, and of course it leads to a certain oxygenation of all the tissues. We also understand that it boosts metabolism, and we can see that blood circulation really increases in its, I mean, in its manifestation. And speaking about different contradictions that we have, well, we can see, I mean, different ways as to how can be applied to interact such diseases like and genitourinary syndrome after operational and other kind of tissues. We also think about these issues when we need to tackle different issues. For example, when we have some kind of problems with appearance sake and so on and so forth. We can see also that we need to think about reproductive function, some stains that we have, I mean, pelvis floor, and unfortunately we understand that sometimes we might have quite an issue with pregnancy when there is a problem also related to this problem, and also when plasma is introduced with the ovaries, we have surgical in appearance and interventions that can actually boost the function of ovaries. But we are searching for new methods that could allow us to be more efficient on that. Here is some of the contradictions that we have for carboxy therapy, for example, stenocardia, thrombosis, thromboembolia, some problems with respiratory diseases, anemias, I mean, different types of diabetes, anaerobic bacterial infections, pregnancy, and also lactation periods, and so on and so forth. So there is a full list of all the contradictions that we have for this kind of intervention. I would like to say that the procedure itself, when you inject CO2 within the genitals, it's not that difficult. So yes, it can be done very quickly, but at the same time, we can state that there might be some painful moments. We also can feel some kind of crepitation after the, I mean, the procedure itself, we might have some negative impacts and effects like itching, etc. And probably it will just take 10 or 20 times to get over with all that. Right now we have the different ways to tackle that, and also to really come up with all the possible negative effect that might be there. We have already analyzed quite a big number of female patients that allow us to believe that we know how to tackle all those problems, etc. I mean, within the range of 39 up to 58 years. We have different uh, interventions, and of course, they are based on different therapists and different approaches that have been approved. We use this new ultrasonic scanners, and so there we see how actually CO2 is distributed. Special fluctography, where we used this method. We use a special contrast agent, which is called Sanogenetic, and it is produced in Switzerland. So we use their uh, I mean, 4.1 out of 100 millimeters, and there we can see a distribution of CO2 within the genitals. So we also can see some information that was analyzed further on, especially when it comes to injection carboxy therapy of genitals. We can see information about needles, about the gas that was attained, for example, from 36 to 43 degrees. We can see the information about the flow and also the angle of the needle that was used for that matter. We can see the amount of the gas that was used for that matter, up to 10 to 50 centimeters, I mean cubic centimeters. We can see the duration of the procedure and also the number of procedures that we were supposed to accomplish within this period. So this video you can see how we actually inject CO2 within, I mean, the genitals. So we can see there is already some symptoms of the initial disease, and step by step we are actually I mean working on that. We can see that the patient is quite fine with that. There are no painful reactions or anything of that kind, and procedure is quite nice, and it doesn't require any anesthesiological follow up afterwards. There is a elastography of the genitals that was accomplished after carboxy therapy. Here you can see some of the parameters involved in this analysis. I mean, specifically elastography, and those who know how it works, I think that I mean it would be of interest for you. But from the point of view of gynecology, it is something, I mean, really marvelous. We do it with the guest, Mr. Sechnov, and you can see how this procedure is accomplished and done. And in this video, you can see how CO2 is distributed within the tissues. We see how needle is used, and we can see how the position of the needle is changed. We can work with the right dosages, and we can guide needles in the right direction. we could work on all those issues. Can work with the vessels. We can improve for microcirculation, and also we also can focus more on proliferation of fibroblasts, and also can boost synthesis of collagen, can activate cell-based inspiration and respiratory function, which is really important for the function of the tissues, and that can lead to very good results from the gynecological point of view. Here are some of the parameters that were also used during ultrasonic in survey. I'm not going to extrapolate that much on that because these are more for specialists who know more about that. Here we can see visualization with contrasting and so on and so forth. But we understand that there is a certain price behind that, but at the same time, the procedure is absolutely transparent. What about our procedure? Yes, we need to assess vascularization. We need to assess dynamics. Also, I mean, washout dynamics and many other parameters, factors like PI, DBS, etc. It had to be analyzed. We have to understand that if we talk about I mean, just in form of summary, yes, we received results. Yes, we could accomplish, elastography, multi-parameter analysis, etc. Yes, it can be very much supported by all our approaches. Yes, we can do that, but at the same time, all parameters they have to be analyzed. But at the same time, we have to come up with a certain dynamic, systematic monitoring and approach. Yes, we also have a visual instrumental approach that's used for analyzing different parameters. And if we do really want to, monitor all those parameters in future, we have to think about ways to do that. We can use different devices for that, especially we can analyze the duration of tissues and so on and so forth. We can analyze ultrasonic devices. That could be quite an informative components for us. We could analyze microcirculation, activation of neoangiogenesis, and many other factors could also be covered. We already have certain publications for that matter, and we have certain recommendations that should be taken into consideration. There is one of the clinical cases, female patient, 43 years old. She had some problems with the itching within the genital area, and also some dryness, etc. Something that we refer to as dyspareunia, and some problems with urinations. Yes, and some issues were there, some problems. We analyzed historical data, and when we'll take a look at that, we saw that there was a problem of pangyrectomy with some ovaries and a part of a gynecological survey. We saw that there was a problem with the mucus part of the genitals, and also as for the vaginal house, we understand that there was quite a low rating. It was just 19 scores. It was about the state of epithelium, etc. And unfortunately, it wasn't in the optimal conditions, especially when we talk about this kind of syndrome. So we analyzed that. And we decided to focus more on carboxytherapy. What is all about? We suggested that she should be given 8 procedures. Here we can see the state of genitals prior to the procedures, and what was actually done before. That, and we saw what actually happened afterwards. Here we can see before and after pictures. Another patient, 56 years, again, pretty much a similar diagnosis. Here we used quite an innovative technology. it was handed over to us for clinical approbation, also based on CO2. Here we can see urinary syndrome during the menopause, something that was, can be seen before the intervention and after 4 procedures. So we can see the efficiency that was attained thanks to the intervention that we have. Another patient, 55 years, sclerotraffic liking. We can see that there were problem with itching, different um, fractures and many other problems with the skin. So that is the picture before and picture that was taken after 2 procedures and after 10 procedures. So we can see a huge difference. But at the same time, there could be some side effects, and every particular case need to be analyzed very, very carefully. Yes, there again were complaints regarding fractures, regarding itches, etc. So as for the course, it was suggested just like on an ordinary basis, but we can see that the structure of the skin really changed tremendously in the positive sense of this word. The 2 courses of CO2 lasers, and after that we added plasma thrombocyte rich uh, also procedures were also suggested for that. We can use that with gynecology. We can use the radio waves and many other ways. But as for this particular approach, cardiotherapy, this is something that is incredible, something that has proven to be quite a success, especially when we talk about ion CO2 based technologies. And I would like to talk more about that. We could discuss different cases, different approaches. Carboxyl therapy has already filled in a certain niche, and of course we understand that we need to really stay focused on that kind of approach because it could help us a lot and it could help us tackle many issues. I'm ready for your questions. Anatolian, thank you very much for such important information for clinicists. Yes, what about questions? I think that they can be found in our web chat. We are getting ready for our next presentation. Yes, hope that your presentation is going to be a success and everything is going to be.
Can you hear me?
Уважаемые коллеги, представляю нашего следующего докладчика Михаил Артамонов.
So I would like to introduce one more speaker, Mikhail Atramonov, MD, PhD, and the representative of American Society of Medical Gases, and he will be talking out on meal therapy using, with ozone frontiers.
Can we start now?
Михаил, вы слышите нас?
Can I start?
Mikhail, can you hear us?
Звука нет.
Yes, I can hear you. Can you hear me?
Вы меня слышите?
Да, да, слышим.
Hello? Can you hear me?
Yes, we can hear you. Yes.
Okay, so I can start, right? All right. Well, hello everyone. My name is Mikhail Artamonov, and I'm presenting here or representing here the American Society of Medical Gases. And it's a very exciting event that I can see, and the lectures are great. The faculty is amazing. I wish this year would be different, like we all wish, and we all can gather together in the same room and shake the hands and change our opinions. Unfortunately, as we all can see, the time makes some difference, and we have to do it in a remote way. So I have 20 minutes to not only to introduce the topics of today, but also introduce the society as well. It's a new society of American medical gases. It just formed right in the beginning of this pandemics. I'm very proud that the Russian School of Medical Gases is one of the most advanced in the world. As a matter of fact, I'm very proud to present today two topics that Russian medicine is probably the most advanced in the world, both medical gases and intraosseous therapy. Before we begin, I also would like to express my gratitude, and I'm sure I'm not the only one, to the organizer of this Congress, Dr. Professor Nazarov, who was a leading authority in the previous association, made huge efforts for this conference. And of course, I'd like to thank our angel of this conference, of this Congress, Dr. Khatkevich, or Dr. Anastasia, like we all call her, for her energy, dedication, for her spirit that allows us all to be together today in this room. Thank you. And big round of applause to both of you. So the subject of today's lecture is automyelotherapy with ozone. I have over 80 slides, and most of them are simply for references for you to check them later. I certainly go over the slides relatively quick to present the point of that, so you can go back and if needed, if interested, to check. Sometimes what I discovered in the last few years of doing intraosseous therapy is what I call unknown anatomy. It reminds me about this picture I took in one of the aquariums when we see and don't see, or we see something else at the same time. It's mesmerizing to see the anatomy that at least I was never been exposed in my medical school training, and see the anatomy of the bone and inside the bone. That's what we see sometimes inside the bone, behind that skeleton that, again, since medical school, we used to look at the supportive tissue that we need to add the flesh on. It's extremely active metabolic tissue with its own nervous system, its own circulation system, and I'm going to explore this topic today in some details. I'll show you that this video, most of the video, if not all of them, are proprietary. You would never see them again in your life, that nobody's really doing that. It's a live fluoroscopy with using contrast, exploring the central venous spinous system that, again, almost you can find it in any anatomy book. So look. So we see the needle position in a C2 spinous process, and we see the bidirectional flow of the one of the spinous venous system. One more time. It's really unique picture, and I explain later the future of that. Look at the circulation going towards the brain. I'll go over that in details later. It opens a lot of possibilities here. And before I proceed, I'd like to, we're all standing on the shoulders of the masters, and I like to thank you, these two people here. They both represent ex-Soviet Union School of Medicine. On the right, you can see Professor Yankovsky, who unfortunately passed away, early this year, at the age of 90 plus, very active. And he attributed his activity to intraosseous injections that he called the fountain of youth. On the left, respected Professor Sokov from Moscow. He's the president of one of the pain society and also director of the clinic of pain treatment in Moscow, as well as the professor of Friendship University in Russia. He is the leading authority in the world of intraosseous medicine, spent his entire career doing that. Today I try to address these questions: why interosseous, why outer, why mild, and why ozone? Why all in one package? And through the presentation, I'll show you some pictures, some videos, because sometimes it's better to see it once than hear it 25 times. So this is one of the videos. You see the needle is positioned in the spinous process of the L5 vertebra, and you see the contrast distribution on both sides. It's mesmerizing anatomy because, again, I've never been exposed to that part in my life. The type of patients briefly that I'm dealing with, I'm interventional pain and spine specialist by primary training. So I do a lot of interventional procedures on the spine, trying to save people from the largest surgeries. So one of the ladies, 75-year-old, status point kyphoplasty, as you can see, L1, 2, no response to any conservative treatments whatsoever. Finally, I decided to do intervertebral transpedicular approach, L2, probably because of the mechanism that we discussed a few minutes later. The response was amazing, at least several months of no pain. Another typical patient, young lady, status post-fusion laminectomy with severe pain. As you can see, the spinal cord stimulator was placed before. I believe I did it with limited success of the low extremity pain. Axial low back pain persisted, no response to conservative treatment. As you can see here, transpedicular approach to the vertebral body, complete pain relief for 3 months. Then it came back and required repeated procedure. Just to give you a sense of what I'm going to talk about. Now, what do we know about intraosseous, meaning inside the bone? It sounds scary, it sounds painful for sure, which I can reassure you that it's not with a proper technique. As a matter of fact, I was surprised to find that there is quite enough literature and it's approved method, even by FDA requirements, it's approved method. And the main indication, at least in the United States, is administrations of fluid and medications during the resuscitation attempts when general IV access is failed or difficult. It's still relatively rarely used even in emergency departments, mostly due to the lack of knowledge and training. Even though it's a well-established method, you can see obviously a lot of devices developed. That's one of the typical placement. Simple PubMed search brought me to over 80 full-text articles. Again, 100% of them addressing intraosseous way of delivery of intravenous medication during the resuscitation attempts. No therapy labels whatsoever. As you can see, the intraosseous infusion can be implemented in all critical situations when peripheral venous access is not easily obtainable. As a matter of fact, by law, by regulations, intraosseous infusion or intraosseous access is allowed for blood sampling, so you can draw on the blood and make the same analysis as intravenous blood. Interesting enough, virtually all types of fluids that we can safely provide IV intravenously can be addressed and injected intraosseously. Military, of course, pay a lot of attention to the intraosseous access, obviously because of battlefield medicine doesn't always represent ability to do the conventional IV access. It's popular in the military. Most of the devices actually developed as a vendors to the military economy. Again, most of the slides I'll leave for you as a references so you can look up later. Why intraosseous access? Well, we have one of the reasons, we have bone marrow, we have a stem cells there. That's the holy grail of the regenerative medicine. And that's what the depot of the stem cells are. Whether you like it or not, that's our God-given resources. It's our bank account that you don't want to tap into too often, even though they give you the credit card to access that. So this access required to get to the stem cells. And even though I have to admit I haven't started counting effect of the intraosseous therapy on the stem cells itself, because it requires very advanced technology, but by all theoretical considerations, it should be the case. Some of the standard points from, I believe, from basic intravenous or intraosseous atlas, you can see mesmerizing anatomy inside the bone. Every time I look at the picture like this, it's really something that I can stare for a long time. Another video I played with a lot of different placement. You can see simultaneous placement of the L5 vertebra in both transpedicular lateral approach and approach to the spinous process. I was trying to see the difference. You can see uptake of the contrast and see the asymmetry and see this anatomy that really never been explored in a live person under fluoroscopy. Even though there have been some works exploring anatomy in the cadavers and also some other work, but under live fluoroscopy it never been done. So it's very interesting to see this anatomy. There is some contraindication to intraosseous access, surprisingly very few. Obviously skin infection, some local bone issues, but as you can see, the side effects or complications of the intraosseous access is less than 1%. So it is considered to be pretty safe. I don't use those devices, but they're well known, including famous bone gun that allows over 1,000 insertions done very quickly. There is a certain technical aspect of how you do that. Again, it's not a point of my today's topic, and I would be happy and honored to present a practical workshop, maybe in one of the following meetings, on how to actually perform intraosseous placement. So there is a strict criteria to make it safe, effective, and painless. Again, just for those of you who are in spine and pain business, you can see, you probably would appreciate that contrast anatomy more. You can see simultaneous placement here on iliac crest, spinous process L5, and transpedicular L4. So I play with all those different placement, just I guess because of my curiosity. You can see again adjustment level of the L4 and L3 and spinous process. Let's watch. Immediate uptake from the bone into the spinous venous system, immediate uptake. So there is a direct connection between the bone and the vascular system. Again, interesting enough, all resources that I've seen suggest that, at least in theory, any medication that's safe to introduce intravenously can be done through the intraosseous access. So approval-wise, legal climate-wise, it's very important to understand that intraosseous way of administer drug or access the tissue is actually not experimental. It's fully approved, at least for resuscitation efforts. Most of the medication we use are approved, which takes a lot of responsibility of the shoulder of the injector. Look at that. When I saw this contrast distribution, I was pretty sure it's epidural distribution. For those, again, of you who are in business, that's what the first thought you would think. But this is intravertebral placement through the transpedicular approach L4-5, and you can see immediate uptake by the probably anterior epidural vein will look like exactly epidural access. Again, the complications are very uncommon, mostly related to the technical factors and inability to insert the needle, which again in the trained hands is very easy to do. Again, approved, safe, effective, almost all medication as IV. My main interest when I started developing it actually became the central nervous system itself, since I do a lot of work for neurodegenerative diseases, Alzheimer, Parkinson, and so on and so forth. So I start accessing this intraosseous system through high cervical spine to make sure that I get access probably to the brain, bypassing, hopefully, blood-brain barrier. That's why now I'm showing you this video again, because it's important for me it was important for me to realize that the flow is bidirectional, meaning it can go both ways. Why? Because there is no valves in the veins. So what it gives us? Well, it gives us the opportunity to manipulate that flow by using position. So I start applying Trendelenburg position with a fluoroscopy table and was able to direct that flow more towards the brain. And we'll know why in a few minutes. So that's what we know about intraosseous approach. What do we don't know? So when I started going into the history of medicine, which probably is by far the most fascinating object in medicine, I found quite some evidence that the people were looking into the bone from different angles. For example, one of the most recent work from Japan, and I know Professor Mori is after me, so my congratulations to Japanese science. They discovered actually intraosseous nociceptors that are able to be activated by different kinds of stimuli, including intraosseous pressure, including the fact that intraosseous pressure with a bone marrow edema is closely related to the back pain. Russian literature, as I said, is probably the most abundant in the world. The school of intraosseous therapy has its tracks back to probably several dozen years back in the Soviet Union. You can see work from 70s, but it was as early as 60s and 50s. So the school and literature is there. I'll skip the slides on the complex anatomy that I discovered in a different anatomy book, so you can look it up. The key point to me, what I was trying to achieve by visualizing of intraosseous approach, besides satisfaction of my natural curiosity, of course, was that to me, intraosseous injection can be a novel emerging method of drug delivery to the central nervous system. Because as we all know, physiological barriers prevent the macromolecules from efficiently penetrating into the central nervous system. And that's what the holy grail for majority of chronic disease, not only what we call neurodegenerative, but hey, diabetes, hypertension, who said that the central nervous system doesn't play a critical role in those diseases? So the access safe and efficient to the central nervous system is one of the most critical questions in the current medicine. And I believe that intraosseous approach can be one of them. Again, I leave the slides from, I spent hours researching that. It's really fascinating. Back in 19th century, very, very famous French anatomist Brechet discovered and described actually in details a lot of findings in the central venous nervous system and circulation. Was forgotten, of course, like many things in medicine up till 1940, when Batson in Pennsylvania described it again. It's interesting enough, I found his original work, 7 pages, that's it, unlike many current modern work that we see of dozens of pages. 7 pages, turned completely modern oncology at that time, because he was looking at the function of the intraosseous circulation and vein system from the metastasis standpoint. He discovered that most of the cancers spread intraosseously, unlike some other ways, lymphatic and direct circulation way. So having said that, you understand another angle why this topic is so important to me. not only to access the central nervous system, but potentially be able to break that circulation, that flow of the pathogens affecting and bombarding our central nervous system, including metastasis. Brichet, again, pictures were published in most of the spinal anatomy atlases and normal anatomy atlases up till 40s when it was forgotten. You can read about that. There is some, I play around again a lot using intraosseous access. You can see unique placement of both intradiscal and transpedicular ozone, which again, it's most of the time we do the treatment of the spine using intradiscal ozone, but it's unwise to see the discal on without addressing adjusting, nutritional and bone and supportive tissue can be a solution. When you address the entire segment by using natural holistic therapy, that results are much better. There is evidence of changes even on electromyography in H-reflex after interosseous treatment. There is evidence of changes of infrared thermography after interosseous treatment. Again, some history. Mechanism of intraosseous therapy proposed mostly by Professor Sokov from Moscow. I mentioned his name before. Well, it's trepanation of the bone. I strongly suspect that at least half of our orthopedic surgeries work that way. That's why people feel better so much faster. And a few months later, there is no difference. So basically, clinically, when you palpate the bone, you feel the painful spot. I can guarantee you that that's the spot that needs to be injected because the intraosseous pressure there is high, and that's what's causing the pain. Very simple, no brain, but that's the way it works. So when you put something to trepanate the bone, to open up that closed vessel, closed jar, people feel better immediately. Obviously, there is other mechanism. We include local anesthetics. We stimulate bone marrow again. That would be subject probably to my next year presentation. We improve the detox of the central nervous system through improving the venous outflow, to improving lymphatic drainage. Many mechanisms that I can talk for a long time. Again, mentioned Professor Sokov. He came up with osteogenesis theory of pain that actually is new world in medicine, that all degenerative changes in the bones or joints related to initially increase intraosseous pressure, compromise the flow from the bone, compromise nutritional approach, flow to the bone, and that's what needs to be addressed. Can be used for many different reasons. I also put some scientific data from recent findings back in 2007 when we see PET scan data. It's a brain of the live rat. Paraspinal injection of etanercept, which is TNF alpha blocker, into the central nervous system. Few minutes later, we see increased uptake in choroid plexus, which prove pretty much direct connection between the paraspinal places and the central nervous system. There is some information on the channels that recently been discovered in the bone and the skull, which seems to be super important in exploration of any neurodegenerative diseases and the further treatment. Those channels are active, they're regulated, they're designed to control the flow both ways. They're designed to let certain cells in a certain time let in and let out. It's a complicated system, beautiful system. Nothing in our body is plain and stupid. Some pictures of how you place the needle intraosseously. Interesting picture, for example, the way I do it, that's the right hip. I introduce ozone into the joint cavity, and you can see that white line. This is ozone. And then I usually move further into the cortical layer and inject ozone again. And you can see on this picture first that this immediate uptake of ozone, basically it's aerogram from interosseous uptake. And I sent it to the group of Professor Sokov, and they put it actually in Russian, corresponding to the anatomy atlas, which I found very fascinating. You can see in this aerogram the picture of the vein, picture of the ligament, and so on and so forth. Interesting. Charcot foot, tough cases. One of my tough patients, I put it intraosseously, Charcot foot. You would think it's painful. He didn't feel anything. Postponing surgery for at least several months. Hard to say, tough cases. The circulation is totally different in the spine compared to the cortical bones. You can see the uptake here is more local, less systemic. Interesting. Can be also can be regulated as well. We play with different things. Pathological anatomy. You see, because of the fusion, there is no spread back to the spine. Look at that block here on both sides. I found it very fascinating. That allow us to understand maybe different mechanism of the failed back surgery syndrome. You see, there is no uptake whatsoever going to the spine. Another case, sacroiliac fusion, spinal fusion, same way. Look how impaired the anatomy is. That's my typical patient. Now we understand a little better why intraosseous, why myelo, why outer, why ozone. Again, I would define at the end of my presentation, I would briefly define intraosseous therapy as a group of therapeutic techniques based on a certain effects on intraosseous space of the spongy bones in order to eliminate the pathogenic causes of pain and other diseases through the elimination of or normalization of intraosseous perception, intraosseous blood flow, in bone marrow stimulation. That's why we call it outer hemomyelo therapy. And thank you very much for your time and attention. I believe I made it slightly over in 22 minutes. Apologies.
Большое спасибо, доктор Артамонов.
Thank you very much to Dr. Artamonov. This was a highly interesting piece of information, and your research has a very good future. We have a very great interest, and then soon there will be Japan.
Уделяем буквально 1-2 минуты для подключения следующего докладчика.
And now we are switching on the next speaker.
И переходим к теме использования
So we are about to proceed
водорода.
to molecular
С вашим
hydrogen,
удовольствием представляю нашего
and
следующего
it's my pleasure to
докладчика,
introduce
Нода
our next
Маме,
speaker,
профессор
Mami
Высшей школы
Noda,
фармацевтических
Ph.D,
наук. И
representative
тема
of
доклада
pathophysiology,
молекулярный
Graduate School of
водород,
Pharmaceutical Sciences,
транзлатический и
Kyushu
лечебный
University. She will be
медицинский
talking
газ
about
водород.
molecular hydrogen,
Прошу.
specifically Peretyagin and therapeutic medical gases. Over to you, please.
Okay, well, my name is Mami Noda, and at the beginning, I'd like to express many thanks to Professor Nazarov and organizing committee of this conference to give me a chance to give a presentation in this conference. It's a great pity that I cannot visit St. Petersburg, one of the most beautiful cities in the world, but I hope we can get together someday in the near future. Well, again, I'm from Japan, and then from the south island called Kyushu, and the name of the city is Fukuoka. We don't have much historical places, but one of them is the Zaifu, and here God of study lives there since 7th century. Well, now I'm going to start about molecular hydrogen gas. It's the smallest molecule in the universe, so that it can go through the cell membrane and even plastic bottle. Therefore, it must be kept in either aluminum container or a glass bottle. The breakthrough of the research of the medical hydrogen therapies started in 2007. The paper published in Nature Medicine with a title that hydrogen acts as a therapeutic antioxidant by selectively reducing cytotoxic oxygen radicals. They used ischemic rat model, and the result was hydrogen-containing gas dramatically reduced infarct volume in animal model of ischemia. Well, here, hydrogen, as well as carbon monoxide or hydrogen sulfide, well, this is schematic mechanism of cytoprotection induced by these medical gases. They either upregulate antioxidant enzymes or they scavenge the radicals so that they have a cytoprotection as a consequence. Actually, we observed that hydrogen reduces the production of reactive oxygen species, ROS. The left hand is cellular level, and the right hand is tissue level. This is primary cultured microglia, and when we applied rotenone, then the hydroxy radical or peroxynitrides were produced. However, if we apply hydrogen, then it was very much attenuated. In a tissue model, this is I'm going to show you later in our Parkinson's model animal. Well, in the brain tissue, the orangish one it shows the superoxide. This is a marker of superoxide. It was produced by MPTP, the toxins. However, if the animals were drinking hydrogen-containing water, it was very much reduced. So far, there are more than 1,000 and maybe 400 papers were published, and then there are so many beneficial effects by hydrogen. It looks like hydrogen works all over our body, and since I'm a pharmacologist and pathophysiologist, mainly on the brain or nervous system, And since the time is limited, I'm going to focus on Parkinson's disease model in this talk. So I'd like to explain you the protective and preventive effects of hydrogen in Parkinson's disease model mice. We published in 2009 that hydrogen in drinking water reduces dopaminergic neuronal loss and MPTP induced model mice of Parkinson's disease. But needless to say, the pathology of Parkinson's disease is the loss of dopaminergic neurons. We took a look at the substance nigra or striatum, and then looked at the tyrosine hydroxylase positive dopaminergic neurons. And this is very reproducible results in Parkinson's disease animal model. You see that there is a loss of dopaminergic neurons. And how to make hydrogen-containing water? We bubble the water in for the glass bottle for animal case, and we bubble with hydrogen gas for, let's say, 8 minutes. Then there is a water with hydrogen gas on top of the water. And usually under this condition, we can get, let's say, 1 ppm hydrogen-containing water. And this water, since it is filled with hydrogen gas on top, so the concentration of hydrogen was kept for many, many hours, even 2 days. So this is how we made hydrogen-containing water for animal experiment. So this is the result. Well, we gave hydrogen-containing water for 7 days to the animals, and then we injected MPTP. This is a toxin to kill the dopaminergic neurons. And 2 days later, we sacrificed the animal and look at the brain. And here you see, after injection of MPTP, the dopaminergic neurons were very much lost. However, if the animals were drinking hydrogen water, then these dopaminergic neurons were very much preserved. In striatum as well, the loss of dopaminergic neuronal fibers were significantly preserved in hydrogen drinking animals. So this is the statistics. But the loss of dopaminergic neurons by MPTP was significantly ameliorated by drinking hydrogen water. And interestingly, the concentration of hydrogen, well, it's not dose dependent. It looks like 0.08 ppm. It's almost 1/20 of the maximum concentration. It was enough, and it looks like all or none effect. Not only pathology, hydrogen rescued behavioral deficit. We performed open field test, and usually the animals showed much less motor activity. However, if the animals were drinking hydrogen water, it was significantly rescued. This is the Japanese group in Nagoya University. They performed the pilot study using Parkinson's disease patients. If the patients drank hydrogen water for 48 weeks, means 12 months, so it means 1 year. Patients drink hydrogen water 1 liter every day. Then the score was significantly different between placebo level. group. So it very much seems to be that drinking hydrogen water works in human as well. The right side of the panel, this is interesting data. It's also from the same group. This is animal experiment. They tried various ways of applying hydrogen, either drinking hydrogen water or increasing the intestinal hydrogen gas or inhaling hydrogen gas, continuous hydrogen gas or intermittent hydrogen gas. And interestingly, drinking hydrogen water was the most effective. Why? So it was very interesting for us. Then we thought the effect of molecular hydrogen is not so simple, and there must be some various ways. So we tested how it works, and we thought the effect of hydrogen is not an acute effect, but it takes time. It means drinking hydrogen water only for one day is not enough. This shows that drinking hydrogen water for, let's say, 1 day or 3 days or 7 days, and then we injected MPTP and look at the dopaminergic neuronal loss. And you see, it shows that 7 days of drinking hydrogen water is necessary to show this significant difference between control level. So now we know this is animal model, but it suggests that, well, 7 days, 1 week of drinking hydrogen water is necessary. Then once we drink, let's say, once we drink hydrogen water for 7 days, and then the effect continues, how long? So we performed giving hydrogen water for 7 days and stop giving hydrogen water 1 day, 3 days, 7 days, and then injected MPTP and looked at the dopaminergic neuronal loss. And you see, if we stop drinking hydrogen water after 7 days of drinking, then, well, 3 days already, 1 day is okay, but 3 days of stopping drinking hydrogen water, already this protective effect disappears. So it means once we start drinking hydrogen water, we should continue drinking hydrogen water to keep the protective effect by hydrogen. Now, what's the mechanism? What's the mechanism of the protective effects of hydrogen? Then we found stomach-brain connection. Well, before starting this experiment, we knew that drinking hydrogen water was very beneficial. But the hydrogen in drinking water goes to the brain. So we measured the hydrogen concentration in the brain of the rats. We inserted hydrogen electrode to the striatum of the rat's brain, and then we gave hydrogen to this rat, and then we measured hydrogen concentration in the brain. This curve shows inhaling hydrogen gas, but this blue line, we gave hydrogen drink water to the animal. So this shows that inhalation of hydrogen gas increased the hydrogen concentration in the brain tissue, but disappeared in 10 minutes if the animal stopped inhalation of hydrogen gas. So actually, hydrogen gas can go to the brain, but if we stop inhalation of hydrogen, it disappears quite rapidly. And drinking hydrogen, unfortunately, no change in the brain. So it means, well, there may be indirect effects of drinking hydrogen, from the digestive organs. So to test the indirect effect of hydrogen in drinking water, we performed 7 days of drinking hydrogen water, and for 7 days we stopped giving hydrogen water. And then at the day of 14th, we gave we gave MPTP at the 7 days, and then 7 days later we examined the brains, so that when we sacrificed animals, there was no hydrogen in the brain. This result was published in this paper, a scientific report. Oral hydrogen water induces neuroprotective ghrelin secretion in mice. The ghrelin is a novel gastric hormone recognized in 1999 by Japanese scientists as a mediator of growth hormone release and stimulating appetites. And it may have other important physiological functions as well, such as neuroprotection. So the story is, when we drink hydrogen water, it goes to the stomach. And then we found, after drinking hydrogen water for, let's say, 4 days, then, well, usually the ghrelin producing cells are located at this part of the upper part of the stomach. And then when we measure the messenger RNA of ghrelin, it was significantly increased. And not only messenger RNA, the protein, the ghrelin protein in the plasma, it was significantly increased as well. And this ghrelin is released to the blood because it's a hormone. And then this ghrelin, it goes to the brain. It can cross the blood-brain barrier. And fortunately, it was reported that the ghrelin receptor called growth hormone, like secret growth receptor GHSR1 alpha, it is robustly expressed in substantia nigra pars compacta. Therefore, ghrelin released from stomach can go to the brain and binds to their receptors in substantia nigra, and then that's how they have a protective effect, especially on dopaminergic neurons. This is to confirm that it really by ghrelin. When we injected a ghrelin receptor antagonist, then together with hydrogen water, then the protective effect of hydrogen disappeared, because ghrelin cannot work on the receptors. And one more thing, the ghrelin release, it is reported that the ghrelin release is dependent on the stimulation of beta-1 adrenergic receptor. So if we injected the beta-1 adrenergic receptor antagonist, atenolol, then the ghrelin level was blocked like this. And we also tested the effect of atenolol together with hydrogen water. Then, as you can see, the protective effect of hydrogen disappeared, and it looks like it's getting even worse. So this result suggests that patients taking beta blocker may be better not to take hydrogen water, because they cannot expect the beneficial effect of hydrogen anymore. We also confirmed the hydrogen-induced ghrelin release using stomach-derived ghrelin-producing SG1 cells. This is a cultured cell line. We applied hydrogen 1 day, 3 days, 7 days, and then measured ghrelin messenger RNA. And it really, the ghrelin messenger RNA was significantly increased after 7 days of hydrogen application. And then, on the other hand, the ghrelin released from the cells, as we had expected, noradrenaline increased the release of ghrelin from the cells, but hydrogen itself does not induce the ghrelin release from the cells. This is very well confirmed in the cellular level. So this is the cartoon of the summary, the hydrogen-induced stomach-brain connection. Again, hydrogen goes to the stomach and works on the beta-adrenergic receptors, and then ghrelin is released to the blood, and then this ghrelin crosses the blood-brain barrier, and then go to the brain and works on the receptor, and then we don't know precisely. However, as a consequence, the ghrelin has oxidative stress resistance, and that's how it causes neuroprotection. Well, not only ghrelin. There is a report that the involvement of other endocrine system by molecular hydrogen. It shows that the sex difference in cognitive benefit induced by hydrogen in Alzheimer's disease model mice. It was published by our colleague in China. Their results show that, well, Alzheimer's disease pathogenesis, it causes oxidative stress and inflammatory activation, and that's why the cognitive dysfunction. And especially in female, in the Alzheimer's disease patients, well, the brain estrogen decreases and estrogen receptor, especially beta, the deficiency of the receptors are reported. Because of this, impaired estrogen receptor and BDNF and TrkB signaling, that's how the dementia occurs. Then molecular hydrogen, it can inhibit this pathway oxidative stress in both female and male and female. However, in female, hydrogen blocks this cascade. So in female, hydrogen prevents the estrogen deficiency or estrogen receptor deficiency. That's how we female are very glad that drinking hydrogen works to prevent dementia, hopefully. So, and so far, the possible mechanisms of how hydrogen works is that it takes several days to show neuroprotection. And then the neuroprotective effects last for 3 days without taking hydrogen water. This hydrogen-induced ghrelin release from the stomach takes several days and needs beta-1 adrenergic stimuli. Hydrogen also modulates other endocrine systems, such as estrogen and its receptor. So this morning, Professor Nazarov mentioned that not only hydrogen, but ozone or xenon, these medical gases may have similar fundamental mechanism. Those medical gases may have close relationship between endocrine system. I'd like to mention a little bit about more predictive mechanisms of how hydrogen works. This is my colleague's paper. They reported recently that molecular hydrogen suppresses superoxide generation in the mitochondrial complex 1 and reduced mitochondrial membrane potential. It is a complicated story, but in the mitochondria, this is the scheme of superoxide production in complex 1. And in complex 1, it's called Q chamber, and there is a Kinnan pool. And hopefully, well, we predict that the 2 protons and 2 electrons surrounding the Q chamber are donated by activated hydrogen. That's how hydrogen inhibit the production of superoxide. However, there are only indirect evidence so far. So the reactions of hydrogen, so the reaction of hydrogen with Kinnan intermediates should be investigated from now on. That's what we are working right now. And at the end, I'd like to mention the future perspectives of hydrogen gas. This year, well, we are suffering from the pandemic a lot, but from China, the top medical doctor called Nanshan Chong, his group reported that hydrogen-oxygen mixed gas inhalation improves disease severity and dyspnea in patients with coronavirus disease 2019 in what does it call? In a multi-center open-label clinical trial. Well, this work may be repeated tomorrow by my friend. Well, I just briefly mentioned that what they reported. Inhaling hydrogen together with oxygen, the disease severity improvement and dyspnea improvement, though only at the beginning, or cough improvement was reported, or chest distress improvement, or chest pain, or oxygen saturation improvement were reported. Of course, not only hydrogen, but together with other drugs. So my friend Tyler LeBaron, he's going to talk tomorrow. They wrote a review in a journal Reactive Oxygen Species. So I'm sure he's going to talk about this tomorrow. They overviewed the SARS-CoV-2 infection and the importance of molecular hydrogen as an adjunctive therapy. So I'd like to emphasize the usefulness of hydrogen in health and disease. There are lots of reports, as I mentioned at the beginning, but hydrogen is likely to prevent reactive oxygen species-related disorders and age-related symptoms. And luckily, hydrogen has no serious side effects, being quite safe gas if the concentration is less than 4% in the air. And in the future, from now on, hydrogen can be used to prevent or ameliorate the severity of COVID-19. Well, thank you very much for your attention.
Огромное спасибо, профессор Нода,
Thank you so much, Professor Noda, for this brilliant speech and the information for our audience right now without any pause will be as follows. By Professor Lamberto Rey, who is the chairman of the Science
Федерация,
Council.
из Италии. Тема доклада «Новости о чрезвычайных ситуациях пандемии
So this is
COVID-19 в мире
about
и
emergency
рациональное
situations in
использование
the world and
озонотерапии.
the rational use of ozone therapy.
Hi all. Thank you very much for inviting me, and a special thanks to Professor Nazarov for giving me the opportunity to share with you the last news in ozone therapy. And in my speech, I would like to talk about the rationale about the use as complement in this pandemic that is affecting all the world in this moment. So I am really happy to share with you the last news and to follow my speech. Thank you again.
Thank you.
Briefly, in December 2019, the outbreak of this novel coronavirus disease in China spread worldwide, becoming an emergency of major international concern. Human-to-human transmission, contaminated hands and surfaces has been described with incubation times of 2 to 14 days. So far, no therapy has been approved by the official Ministry of Health worldwide. Italy was the first worst country with pandemic diffusion out of China, and the first cases was confirmed in Spallanzani in January this year, and the secondary transmission occurred in Codogno, a Lombardy province, in February this year. Today we are living the second wave, and we can count about 1 million of cases and about 40,000 deaths. In this graphic, we can see the daily new cases in Italy occurred during the first wave, February, April, and the second biggest wave, where most of the cases are occurring till now, till today. We can see really how big is the diffusion of this second wave in Italy. It is interesting to see how much is the diffusion worldwide of this pandemic. This is the graphic that I showed during my previous conference in September this year. And this is the second graphics recorded about 2 or 3 days ago in November, where we can see that about 13 million of global cases, more than the previous graphs. So you can imagine how speedy is this diffusion along the world population. Despite the gravity of this pandemic, we can see that in the best recognized drug administration all over the world, there are no medicine, no treatment of officially approved. The same Food and Drug Administration approved some investigation on antiviral or hydroxychloroquine, but just only for emergency use authorization. That is where the condition of the security of the medical treatment is not absolutely recognized or approved. Same situation in Italy, where the agency of drug, Italian agency of drug, so far do not approve any medical treatment officially. Also, if there are some trials with heparin, anticoagulant, antiviral, and also with ozone therapy, that seems to give some good results, good outcome, almost as complement and not as first treatment, and perhaps better is before ICU admission of this patient. Interestingly, Dubai Health Authority also if not official approved medicine like corticosteroids, methylprednisolone. Perhaps for the first time we can see that they suggest some multivitamin supplementation like vitamin D, vitamin C, zinc, and some other supplements that could be helpful in this kind of infection, just to help the immune system and to reduce the cytokine storm that usually is the responsible of the final outcome of the patients. And better if before ICU admission. A complete picture of the actual treatment we can see in this table that was published and proposed from JAMA Internal Medicine in July 15, 2020, and where we can see the patient treated and the outcome from a live patient and died patient following the treatment, each treatment that was submitted to the same patients. Usually the severity of the illness is indicated in 3 stages. The first is the early infection, the second one, the pulmonary phase, the third one, the hyperinflammation, the cytokine storm that is responsible of the final diagnosis and the final prognosis of the patients. And it is mostly very difficult to reverse. This is the reason why we suggest to treat patients with complementary, with coadjuvant treatment like Ozone in the early phases, stage 1 or stage 2. Regarding cytokine storm, it is really very difficult to define. No definition for this kind of situation. And does mean that there is a storm of inflammatory cytokines that are injurious to host cells, but to add further complexity, that most mediators implicating cytokine storm demonstrated pleiotropic downstream effects with the multiple seemingly unrelated organ systems that are affected by this terrible storm. That is the reason why we have fatal results and fatal outcome with this patient. So looking at all the above reasons and the above data that we have so far regarding this COVID-19, we can try to understand how we can help with ozone this patient. What is the rationale that convinced us to propose ozone treatment or oxidative treatments for these patients? That they are already suffering from a storm, a cytokine storm. So below, after this, I would like to show you what is the rationale, why we think, and we are sure because the first results give to us the reason to understand why ozone could be really helpful, almost in the first phases, but also in the more severe second and third phase. First of all, one of the most important reasons is that ozone now is supported by good literatures, and we can see a lot of references, and interestingly, there are 31 clinical reports associated to the possible coadjuvant treatment of ozone in COVID-19 patients, just produced in this last month. This fact demonstrates that despite its initial pathways regarding NRF2 could be strategically very important against COVID-19 outcome, just regulating the inflammatory processes inside the body of the affected patients. first important reason why ozone could be helpful, and with ozone also other oxidative therapies, is that in this situation we increase the delivery of oxygen. Does mean that the tissues and the lung in these cases can receive more oxygen released by erythrocyte, as demonstrated by many papers. As you can see, Bocci was one of the first important author and scientists working in this field. Second, not less important, is that through the NRF2 pathway, the oxidative therapies could control the cytokine and inflammatory storm, so they can modulate the activation or the inactivation, the inhibition of anti-inflammatory or the pro-inflammatory cytokines, thus modulating the effects of the storm, reducing the damage of our organs. Last but not least is the modulation of immune system. It is well known that this pathway, the NRF2, and thus also the regulators, the upregulators of the protein, like ozone treatment at moderate concentration, can modulate the immune system. So the immune system is the key factor for the severity of the COVID-19 outcome. So following the above, the World Federation of Ozone Therapy proposed a protocol that is actually used in many countries with some variation, but the main data are the amount of blood that usually is under 200 milliliters, and the concentration usually vary from 30 to 50 micrograms. The duration of treatment we suggested is about 6 to 12 days, and twice a day treatment. These protocols have been used in trials in Italy, in Spain, in many other countries with excellent results. And as told above, there are 31 trials actually in working in progress that from the first data could reach very, very good results. The following countries are those where official trials that are also cited in clinicaltrials.gov and are in progress in Italy, Spain, Romania, Iran, China, and many other countries worldwide. So the conclusion are that we have currently no viable treatment for COVID. The pathogenesis of the virus is not fully understood, but the pathological picture in the lungs varies significantly in terms of diffuse alveolar damage. So ozone has multi-beneficial properties that could be useful in treatment of COVID-19 pneumonia, to our opinion. The reason are that ozone can deliver energy and oxygen to the tissues, as said before, and as reported by many authors. Furthermore, it improves the rheology and capillary action of the blood. Not only, it increases the release, the modulation of nitric oxide synthetases. Furthermore, ozone has an antiplatelet effect and increased release of some prostacyclines such as PGE2, which are beneficial for patients with microthrombosis. All of these effects can help decrease the hypercoagulation phenomena observed in COVID-19 patients. I'll say above, also the role played by ozone in the modulation of the inflammatory response, as reported by many authors. Not only, ozone can also confer renal protection. The rate of kidney damage in COVID patients is significant, and ozone modulates the accumulation of neutrophil, the expression of interleukin, and so many other functions. Increase local antioxidant capability. So it is well known that ozone is effective against pathogens, not only directly but also indirectly, just working on the modulation of interferons and our cytokines. Furthermore, it can also modulate and stimulate phagocytic function, which can have a very positive effect in COVID-19 infection. Here we can see all the references that we can find in the literatures. Many other papers are indicative of many other functions that could be helpful and suggest that ozone and oxidative treatments could be really very effective, just because the action on the NRF2 pathway that is regulated by different oxidative substance and also by pharmacological agents. So in the end and in the real conclusion of my speech, it is very strange that it's very important coadjuvant treatment like ozone therapy is not so far approved. We agree that we need large controlled clinical trials, but we know that we take time for this, and unfortunately COVID-19 don't give us enough time to save people, suffering people, and people die every day all over the world. So what can I say is that we have to look just also with a very different way the few papers that so far could appear in the literatures, like that of Hernandez and not only, because there are many papers also in Italy that demonstrate that ozone could be really helpful, almost reduce the damage produced by this terrible pandemic, and to reduce also the severity of the illness. Thank you again for your attention, and